We need to get this.
When a community health volunteer goes to a household, they register the households. Is there an expectant mother? Is there an under 5? Is there people with diseases? So it is my responsibility to look at the data, interpret data, analyze what has been collected, and plan for any action depending on the data that was being collected.
My main responsibilities in my community is to visit my households and to make awareness, like to talk with the young mothers and the pregnant mothers on how to come to clinic and how they can bring their children to clinic.
We have 10 CHVs in every community health unit. So that means for the 28 community health units, that is 280 CHVs. 280 CHVs, each of them take care of 100 households.
Yeah, it is difficult. The workforce also, we are very few who are supposed to collect all that data, put it together, interpret, understand, put it in the DHIS, go give feedback to the community. At times most of the time it is a very big workload.
It's a lot of work. You cannot even know which was where most of the time. But it's true, it's a big bulkage of papers.
How I would wish if actually everything was electronic. That would have been so good because it would actually also help us sieve and figure out and give us the exact information or help us in analyzing the data that we have.
So it will be my prayer if the government to come down on the ground and see the need, because we are serving a lot of community and a lot of things are happening. So one person is not able to maneuver all this work.
The volunteers, wow. The volunteers play a very big role that cannot even be measured through the data that we put in writing. The volunteers have changed humanity. They've actually helped the people down there in the community.
I'll continue because that is my talent, because it is inside my blood or inside my body. I'll continue and continue until my end of my life.
Okay, we need tablets. Thanks so much. That's great. Wonderful. Excellent, everyone. Okay, if there are not any comments or reactions from the floor, just appreciation, then we're going to move to the debrief from yesterday. And allow me to turn that over to Carolina and to Tashi, please.
Thank you, Rachel. Carolina is on her way. Good morning. The discussion we had yesterday was very rich, and I hope everyone had a good night's sleep and is as energetic today. To reintroduce myself, I'm Tashi. I just joined the CNG based here in Geneva 2 weeks ago. Prior to this, I was working in the Ministry of Health, the Policy and Planning Division in Bhutan for the last 9 years. And the division drives evidence-driven decision-making in the health sector. And I'm fairly aware of what actually transpires on the ground in this area. And yesterday was my first big meeting since I joined, and also my first experience of having WHO, UNFPA, UNICEF, academia, private sector, CSOs all in one room at the same table discussing a common objective to improve health information systems in countries. So it was quite an experience for me, a very interesting one. And I can't wait for the discussions today. We have put together, the team has put together a few key highlights from the discussion yesterday. And I think we can all agree that it's face-to-face, there is no substitution for face-to-face meetings. It's energizing, it's powerful. So we hope to have similar meetings in the future. And we did discuss about alignment issues. How do we measure alignment? Alignment between the different stakeholders, example, the private sector, research, academia, and the civil society. And only when we are aligned in our approach, then we can drive impact at the country level. And we also had diverse views on scaling country impact. I think it all boils down to managing expectations at different levels, the expectations of the countries, expectations of the partners, and also to build on the existing structures so that we don't go in with a fragmented approach, so that we don't duplicate. And what came out strongly in the third session was that technical focus should be integrated at the global level, and also that there's a lack of representation from countries at multiple levels. I recall what Modeste said in the Cameroon experience. There's only one person in the HMIS managing everything in one single country. So we don't want to push and pull them in all different directions. We should be integrated in our approach so that it's not messy all over the place for them, so that we are all together and have the same approach. And also the presentations from the working groups, we saw that there's like so many things going on, so many good work that has been carried out, that is ongoing, but the other members in the group, they're not aware of what's happening in the other groups. It's all in, most of it is in silos. And the need to communicate that better really emerged from our discussions. So these are some of the highlights. And actually, Carolina was supposed to do the action points, but I'll take it, I'll do it. So when we talk about the alignment issues, the question is, do we still use the SDG gap heat map that's on page 46 of the report, the heat map on the health coordination environment? I don't think it came out very clearly from the discussions yesterday, maybe something we could look at today. And it was also interesting that we also talked about measuring the status of alignment between HDC countries and the non-HDC countries. Is there a difference? Is it working well? So that would be interesting to see. And we also agreed that we take up a resource mapping exercise to look at how the money, the resources, it's flowing, where and for what and by whom. And this will be an opportunity to see how coordination and alignment, the needs for coordination and alignment, the actual situation, and if it's being done efficiently, if the approach we are taking is efficient. And also I remember Gavi's point on when the budgets they come in, many countries do not prioritize health information system. So how do we make a case to invest in health information system? That came out very strongly. And I'm also happy to inform that the DDI has already started this. I think my colleagues would have more to say about this. And we saw that there's so many things going on in the working group, and also it clearly emerged that there's a need for resources at the working group level. For example, the RHIS repository, to keep it actively managed and also to showcase the good practices, the data governance practices in the DDG working group. And also we talked about the mission, the Malawi mission. It was very interesting. The mission was very interesting, the presentation, and to be used as a prototype for future missions. And really the objective of this mission is so that the government and the partners come together and understand the priorities of the country, the gaps in the countries, and to make an investment case so that all the partners can come on board and work towards it. And also the last action point is an administrative action on our part. We saw that the number, it's huge, the membership, the list is really huge, but a lot of the members are not on the group anymore, and that's our, to look at the list properly and then to clean it up. So we will be taking it up. So these are some of the action points from yesterday's discussions, and looking forward to the discussions today. Thank you.
Thank you so much, Tashi. That's enormously helpful, I think. One of the items on your list is a question, and I let me just open the floor for a few minutes here. Either other comments on this, but there's a question, a very explicit one about the heat map. And I do think, yeah, we didn't have an opportunity to discuss that. So please, the floor is open for anyone who's had a chance to look at that, reflect on its value. I think that's the question we're hearing from the HDC. Should they proceed with that, et cetera? And maybe you could project the heat map for people to take a look. Craig, please.
A little bit more background to the heat map for those that may not know, and it's page 46 on the SDG GAP report that's in my mind. But the thinking of and we value your inputs. This is your inputs into the way that the SDG GAP Secretariat is putting things together as well. It's a series of questions that are going to be asked every year on an annual basis to monitor progress of alignment of partners and how stakeholders in countries feel about whether there is alignment or not. And there's a series of questions. If you dig deep, it's actually an interview questionnaire, and it highlights in different countries whether there's alignment or not. So it's going to be adapted every year. And I think the team is looking for inputs about what questions are good, what questions are not good, what's working. So it's an evolving tool. Whether it can actually be the same questions every year, so it makes it easier to monitor trends over time, is another issue as well. And that's one of the issues that the GAP Secretary, I think, is struggling with. But they really wanted your inputs into, is this valuable to monitor alignment or not? Thanks.
Just a quick question. So in the same report, is there access to the tool itself, or so the questions themselves? And the second question is, who is filling this out, which is always the critical question. Over.
So as far as I'm aware, the questions themselves are not explicit in the report. I need to have a look at it again, but we can share the questions as they are just now, so you can get an idea of what the questions are being asked. Who's asking them? My understanding is it's someone who's contracted by the SDG Secretariat. It's a group of consultants who've helped with this.
Correct.
Yeah, that helps.
I can just clarify.
You're in the room, Hendrik. Sorry. You're probably
Hiding here
better
in the
over briefing.
No, let me just provide a bit more background. So that questionnaire indeed is the overall part of the overall monitoring framework for the SDG 3 Global Action Plan to measure both or get feedback from countries on the level of alignment and the level of collaboration of the agencies. So we can share, I think it might have been in the background documents, the full monitoring framework with the specific questions. It gets sent out officially from WHO via note verbal, notifying the countries, asking them to have the highest ranking civil servant on health to fill it out or to delegate it. The experience we have, it's usually the director planning and in the Ministry of Health who provided that feedback. The first round, and last year was sort of the piloting round, was focused on low and lower middle income countries. We got from the 71 lower middle income countries, 42 replies by May. We received a few more over the summer and are actually just compiling those. One of the questions, and I think that's the most focused on the data element, is the use of local monitoring systems by the partners. And the countries are invited to provide feedback there. And that's it's very small here, but it's the fourth column, which you see, with one red, a couple of orange and yellow. So we use this sort of traffic light rating. The greener, in a way, the more positive the government officials see that support. So that's basically the tool. It comes with additional questions where governments can provide feedback what should be improved concretely, and how this can be done. And of course, these questions can be tailored further. And if there's an interest on the data side to dig it a little bit deeper, one could add one or two questions to that. And that's currently the phase we're in, reflecting also with the other groups what could be added to that. But happy to circulate the full monitoring framework and a bit more information there.
Thank you so much. I don't see a hands up at this moment. Oh, please, excellent. Okay, Pam, and then I come to you.
Thank you so much. I would be really interested in seeing the questionnaire and a lot more data about the weighting and how this was done and all of the details. That would be really helpful. Thank you.
Tisha.
Thank you. Mine is more a request, and if this is in place, then that's good. Just some level of coordination and assessment of the request that WHO is posing out to countries. We were just reminded again on becoming a burden. And thus missing our key objective. So just level of integration and assessment on how we interact and engage with countries to get information. Thanks.
Thank you so much. Deborah.
Morning, Deborah Jackson from London School. So I always like heat maps, but I guess I have a question. Is this specific to coordination? It just says heat map coordination environment. Is that specific to data or health information? And then how might this relate to something like SCORE? Does SCORE also include, whatever you call it, coordination or integration? So those are just two questions. Thanks.
Thank you so much. I think, did we have a hand here from Malawi? Yes, please, Amos.
I think it's in line with what the previous speaker said. I was suggesting that is there a way of making it a bit more objective than just having responses like we agree or we don't agree, so that when it's a red or yellow, what exactly does it mean in terms of the scale of alignment or the response? But maybe because we've not seen the questionnaire itself, but I think there would perhaps would be need to bring in that aspect. Thanks.
Okay, I'll add one last question myself, and that is this only going to HDC engaged countries, or is it not going? There's this interest in a secondary question, which is what difference does HDC make? And if this is asked of HDC countries, or countries engaged with HDC, countries not engaged in HDC, then it becomes an instrument that may lend some insight into the value of HDC. But it seems like you have a lot of interest and some feedback. And anything more you Hendrik, want to say from your side? Over.
Thanks. Yeah, let me try to reply to some of those questions. So indeed, we will share more information also how it was analyzed. It's a mix of these quantitative rating 1 to 5 translated into a heat map, and then the more qualitative questions where governments can basically share their observations and explain a bit more where they want. So we wanted one basically tool to easily visualize that, but also collect the richness of information. And of course, the key element where this information should be used is in dialogues at country level. What can we do better? So it's a quality improvement tool. It's a tool to basically allow governments to provide overall feedback on how the partners are operating in the country. And it's not just focused on data. It's focused for basically overall the health sector and SDG focused support. So it's not a data tool. Just one of the elements coming out of the whole alignment discussion is the use of national monitoring systems by the partners, or whether they're basically parallel systems. And yeah, and there's no specific, it doesn't go only to HDC countries, it went to all countries. And everyone interested in providing that feedback can provide that feedback. But we can, of course, then look at, what's the specific focus in the replies from HDC countries. Of course, there's a social desirability bias in how this is being filled out. Of course, it's in the instructions that honest feedback is thought. I think where there were more engaged discussions at country level, I think the respondents felt they could be a bit, let's say, more not negative, but sort of more honest in their feedback, maybe a little bit less of social desirability bias in those. And we also see a number of countries which are there sort of in fragile settings of very complex coordination environments, which embrace the idea of the SDG 3 Global Action Plan, are quite active, but also provide feedback that the system is basically not well aligned. And of course, over the years, we want to see positive trends, but I think that equally the value is really in facilitating these discussions at country level to see how we can improve the quality of support.
Okay, very, very helpful indeed. Pam, yes?
Thank you. That's really helpful. So I'm looking at the heat map now. It just strikes me that I think it's a very useful tool. I guess my question here, apart from how the analysis was done, I understand that it's qualitative and quantitative, but would it be possible to have a more some kind of empirical support for this? Because my concern is that when a heat map like this goes out to the public, especially if it is just like one single screenshot, that background will not go with it, and it will just become something that is referenced without the background. Is there any way to provide a little bit more of an empirical assessment, either along with this or in addition to this? I'm just thinking out loud. It's a question, that's all.
Thanks. Yeah, and this heat map is embedded, as Craig said, in the progress report. So the progress report provides a bit of context. It also has the link to the monitoring framework. So it's basically, it's just a picture out of that. And we'll share the longer analysis done by the consultant looking at all the data, and indeed look forward to feedback and suggestions how to further improve it. Thanks.
Okay, thank you. All right, I think we're now going to move to session 4, and that is turning over to Chris from CDC and to Preeti from the Institute of Public Health in India. But I note that we have a new face, at least one or maybe a couple in the room, and I do wonder if you would mind introducing yourselves. I think we don't have time for a full tour de table, but is this a colleague of yours? Do you know? Teresa, I think there's just a welcome. The main point is welcome, and if you could share your, specifics.
Hi, I'm Dr. Teresa Diaz. I'm the Unit Chief for Epidemiology and Monitoring and Evaluation in the Maternal Newborn Child Adolescent Health and Aging Department here at WHO.
Delighted to have you. Anyone else new? No. Okay. All right. Chris, Preeti, over to you.
Thank you very much, Rachel, and good morning, everyone, and good day, everyone online. So we will be moving into a session that's going to be focused on the work plan and budget from 2022 to 2025. And there was a Survey Monkey that hopefully several of you had filled in before the meeting. So we'll see some results from that from Melissa. Then the Secretariat will be presenting on milestones and metrics, and again, the work plan and budget. And I think as we're seeing updates on the work plan and hopefully the activities that are being proposed, et cetera, yesterday we had some very good sort of big picture over, umbrella type commentary and reflections. And today it's kind of taking off our jackets and rolling up our sleeves and looking at the concreteness of the work plan and the activities and, what's realistic to put in place, what makes sense, et cetera, to really kind of get down a little more at the ground level, hopefully, as we review the elements of the work plan and have suggestions and proposals. So please keep that in mind as we're having our discussions this morning. So with that, I'd like to invite Alyssa to start with presenting results of the Survey Monkey.
Thanks so much, Chris. So yeah, I hope all of you received the link to the Survey Monkey. We wanted to send out this survey as a way to gather some insights and feedback from the group ahead of this meeting in terms of what are some of the priorities and areas that we see in terms of how we can direct resources, how we can look at the work plan going forward. And we had about 32 responses come in for this data that's represented here, although as of this morning, I just checked, it's about 38. So we do encourage you to continue responding to the survey. I think we'll keep it open for a few more days to allow others to complete it if you haven't had a chance to yet, and also to capture some of the feedback and reflections from the meeting. So just to, can we get the slide up? Is it showing? We had some data to present on the results. The session 4. Thank you. So just to quickly run through some of the data from the responses, we can see here by constituency, research, academia, and technical networks was the largest representative in the responses, with private sector and civil society at the lower end. So again, I think this reflects the comments that have already been made in terms of increasing engagement from those two sectors. Next slide. In terms of geographic representation, again, we can see Switzerland and United States of America are very much the highest representation in terms of country responses. Looking at it by region, again, Europe, Africa, Americas are quite high, Europe being highest, and then Middle East and Asia relatively low. So again, I think this can help sort of guide our strategy in terms of increasing diversity and engagement from areas that are either by constituency or by geography continue to be somewhat underrepresented. And just to say, this isn't representing, HDC as a whole necessarily, but I think it is one angle of looking at sort of the responses to the survey that are reflective of the larger HDC membership at the moment. Next slide. So this question was asking which 3 data issues can have the most impact to accelerate country progress towards reaching their 2030 health-related SDG goals. The top 3 responses in terms of the percentage, first one was capacity building. So capacity building of staff for data collection, sharing, storage, analysis, and use. Second was RHIS strengthening, and third was decreasing fragmentation of data with stronger data governance. And you can see the sequence of the different responses going down. And again, I think this also reflects the discussions that have been happening in terms of how we can increase the data collection efforts on the ground, increase efficiencies, and strengthen the RHIS and the data systems. Next slide. Now this question was comment-based, so we couldn't do a graphical representation, but we did try to do a word cloud just to capture some of the reflections that were included in this response, and just pulled a couple of quotes here. So in terms of another issue that you think might be important but not listed in that prior question, again, institutionalizing data use through planning, monitoring, and supervision came through. Decreasing fragmentation, again, very strongly coming through. And then data use and planning sort of popped out from that word cloud in terms of being sort of the highlight points that were repeated in many of those responses. And you can see in that cloud sort of the other responses that are also captured there. Next slide. So this question was asking, what are the top 3 issues that the HDC should focus on to strengthen data for the health-related SDGs? So this kind of relates to the prior question as well. But again, we can see here coming through strongly in the top 3, knowledge brokering was a major emphasis in this question. So through webinars, events, sharing good data, digital practices, as well as using the HDC as a platform for regional exchanges and country peer-to-peer learning. So those 2 came through very strongly, in addition to coordinating more multi-constituency joint missions to align support for country data needs. Next slide. And again, this was another word cloud response question where we've tried to capture the responses that came through from the comments. So here again, we see developing best practices, guidelines, videos on data use, and multi-agency leadership, and a set of common approaches and tools to strengthen HIS and data use. So again, these are really common themes that run throughout the survey in terms of increasing the multi-agency coordination mechanisms of the HDC, to really improve the processes and the methods that we're using and to support countries in terms of data collection and use, as well as reflecting the knowledge brokering priority that was identified in the previous question. Next slide. And this question was asking, what are the top 3 changes that the HDC needs to consider between now and 2030 to maximize impact? So the top responses on this one, first was ensuring more diverse and active country representation. And again, this goes back to the slides showing the sort of geographical representation and constituency representation. The multi-agency working groups, so they should be more focused, time limited. Resources should be directed according to priorities and not trying to solve everything at once, but really focusing the resources on the top priorities in the countries, in the local communities where it's needed, and kind of doing the due diligence on the ground to identify that before, as we discussed yesterday in the mission responses, before going in, how can we prep the environment, the local environment to be added, adding the maximum value. And again, which we'll get into now, the funding, really providing funding for activities in countries and for the working group efforts in terms of producing tangible outcomes, tangible results that can be applied in real time. Next slide. And the final word cloud, is there one other issue you think may be important not listed? Making use of country leadership, really building champions in communities who can really push forward the digital transformation agenda, who can work with local stakeholders from both public and private sector. Very important to build those linkages and foster those relationships through the HDC mechanism. In addition to the global policies for cross-country health data portability and sharing platforms. And these quotes are just a couple of examples. And we can also, just to say, we can share the full report, including all of the responses with everyone. If that's something that you would like to see, we'll be more than happy to share. We just couldn't fit it all on one slide, but this is just a representation of some of the responses. Next slide. I think that's the last one. So again, we'll keep the survey open. So please do continue to respond if you want to, go back in, or, even if you've already done the survey, you could go back in and submit some more comments. We'd love to hear your feedback. It's very important that we hear from the HDC and that everyone, has a chance to input into the survey. And also just to say that I think we'll continue to use surveys as a tool going forward to continue collecting insights and information. This is a good opportunity for us to really understand, what are the priorities, what are the challenges, what are the pain points, and what are the opportunities to improve. So thanks to everyone who completed the survey, and I'll hand it back to you, Chris.
Okay, thank you very much, Alyssa. Just a quick question before others react. What was this sent out to the meeting participants, or what was the target group, I guess?
I believe Craig can clarify,
Or
but
was
it was
the
sent out to
quote-unquote
all of
membership
the
in
HDC,
general?
I believe.
It was
right?
the whole of the HTC.
Yes, yeah.
So the 800 folks or whatever, okay.
Yeah, so,
Okay.
30 from
Well, I mean,
800, we can
yeah, it
definitely
may be
increase
nice
the
to
response. Yep. Mhm.
do a follow-up email saying, thank you for those who either participate online or in person, and the survey will be
Mhm.
open for another week. So
Exactly.
those who were not, because it's a little kind of low for the participation rate.
And that's why I said, the data is a small
Yes, of course.
section. It's not representative in totality of the
Right, right.
HDC,
But
but
that's
it
what
does
we're
give
kind of needed.
some
Yeah.
insight into how we can
Okay,
be
sounds
guiding
good.
this conversation. So,
So before I hand it over to, any questions, and then I'll be asking Preeti to move us on to the next session, next part. Any questions or reflections? Okay, well, certainly this is available during the day today if you want to have sidebar conversations. So Preeti, over to you to hand it over to the Secretariat for our continued work.
Yes, thank you, Chris, and good morning, everyone. I think the next presentation is from the Secretariat about the HDC work plan and budget for 2022-25. Craig, is that going to be you?
I'm on the hot seat, so I'll do my best. So before we start, just to let you know, so the SRG has actually approved a work plan for 2021 and 2022, and that was structured around the 3 objectives of the HDC. So the first objective, or series of activities for helping to support countries' health information systems. Second objective is the alignment issue and how we might do that in country missions. And third is contextualizing global level tools and a large number of activities in the working groups. And then there's a fourth objective of basically the governance and the secretariat and facilitating meetings like this as well. So it was structured around 4 objectives. It's actually in your Google Drive. There was a budget put together, but we wanted to kind of look at if we want to stretch ourselves till 2025, and we wanted to wait until this meeting and really get your inputs before we kind of crystallize any thinking and make sure, you know, we test the waters. It's the first time people have got together. So we're going to be really thinking about what success might look like in 2025. And here's, I'm going to just go through a series of slides, just looking forward to what does success look like for you by 2025, take you through some of the issues of just restructuring the work plan that might look slightly different around the 4 priorities that I think we've all identified, and not necessarily structure around the objectives of the HDC. And that's just a suggestion, and kind of really value your inputs into that. We're suggesting that we may well change the way in which the work plan is structured around increasing diversity. There's a range of activities there, and we've got some milestones in that. Comms and advocacy, scaling up, and the investment case. And there's a series of milestones we put in, and I'm just going to go through each of those 4 suggested milestones between now and 2025. And then within that, some of the suggested activities based on the conversation yesterday. And again, we need your input. This is a bit of a journey. So I'm not putting things in black and white just now slowly with activities, but it would be good to have this discussion now and get your suggestions on it. Many of you may well have seen an email that we sent this morning to the working group specifically saying, okay, in the next week, we've got some of your inputs for the next year, but what inputs do you think you require between now and 2025? So we've actually asked for those inputs to come in the next few days. And I realize that's very short notice, but we don't want to predict. We'd rather the working groups just actually had that. So there's an email that's gone out that's asked for more inputs from the working groups, because I think some working groups, as we were developing the work plan last year, weren't aware of the opportunity. We tried to advocate and make sure we got about half the inputs we needed. So that's just a bit of background. The other background that I want to kind of emphasize is the current budget, annual budget of the HTC is around $700,000. And that covers, I mean, I'm just being frank here, and that covers half of my time and just now Wenya's time. And because by default the Secretariat is hosted in WHO, it's very difficult to have increased numbers of staff, so staff members, because we have a cap in headquarters. We're kind of looking at how we might use our regional mechanism or country mechanism. We're looking at working with other entities as well to try and look at how can we bolster that. I mean, just now, frankly, the last 2.5 years, it's been myself half-time and kind of extra, and Wenya. So in the last sort of 6-9 months, you will have been aware of another consultant, Alex, who joined, who left. She's based in Seattle, but managed to basically beg, borrow, or steal off other budgets to make sure we've got some extra resources. And I'm going to say, you know, the resources are basically Tashi, who we now have for hopefully a couple of years, and Carolina as well, who'll introduce herself later on today as well, who you met yesterday. So we've got a bit of extra resources, but they're not reflected on the work plan. I've actually had to go to other budgets and kind of, you know, as we all do, creative budgeting it's called. And Tashi has a huge range of other issues that she's going to be dealing with, as will Carolina, as do myself. So I'm just putting that on the table before we start, or kind of just to help you understand, like, okay, it's nice to be here, but behind the kind of the figures, there's all sorts of other things that go on. I think we all do it, which is creative accounting, but I'm just being as transparent as possible. So what I'd like to do is just take you through some of the ideas that we've had and just do a bit of exercise. So what does success look like in 2025 for the HTC, given if we can agree on its mission and we can agree on its objectives, and there may well be an evaluation next year that will kind of might shift our thinking, but just at this moment in time, could we think about the aim? And the aim is to improve efficiency and alignment of investments. And when I say investments, I'm not really just financial. Actually, the bulk of it is technical, financial, and political investments for country health information systems through collective actions, so that by December 2025, there's a clear mechanism for aligning partner resources, i.e. finances, technical, political, supporting specific country HIS contexts, so that technical and financial HIS investments align with country priorities And the impact is greater efficiency, decreased reporting burden, fragmentation, and better quality data to accelerate progress towards the health-related SDGs. And the leads would be the Secretariat, so we'd be doing the facilitating, and the collaborators is basically everyone who's a member of the HDC in different shapes and forms. And that's what we're proposing in terms of a success and trying to get us all to think, does that resonate with you or not? So as I said, next slide. So as I said, what we're thinking of doing was actually shifting the kind of the way in which we structured the work plan. And again, value thoughts. We could just stick with the three objectives of the HDC and then an objective for governance, and that's fine too. But what we're proposing is that if we structure a work plan around what we think are the strategic priorities to make success work, diversity, comms and advocacy strategy, scaling up, and there's details in that, and the investment case, we might reach our success in 2025. So next slide. So just with that first one, with sorry, I've got my glasses. Okay, for the first one, it's small, but it's in your packet as well. So the first one, increasing diversity of countries and partners, and we're suggesting that one of the metrics. So we fully admit actually measuring progress in the HDC has been challenging over the last 2 years. They very much have working groups produced. Have we met? It's been a tough line, but we want to really sharpen up the metrics by which success is measured, and the metrics for this specific milestone. Increased diversity of partners, we're suggesting the numbers of active countries or impact countries, whatever we want to call them, by region and by country income. And we're suggesting, given yesterday, I think we got a green light to be relatively bold and ambitious to a certain extent if we learn from a kind of group of 5 countries in the next 9 to 12 months or so. And we're suggesting still stick with the targets. 12 active countries this year, 16 2023, 2024, and then 26 in 2025. That kind of stepwise approach. On the proviso that we look at the first 3 mentioned, Nepal, Malawi, and Pakistan. Looking at Nepal, and Prabhan is in the room just now, we were talking with him, maybe a mission towards the end of January that would be probably led by WHO, UNFPA, and UNICEF, but welcome other partners, of course, to join that. And the same with Pakistan, very much technically focused on CRVS and GIS, but with that kind of at the end of it, a bit like as Rachel and colleagues from Malawi presented, a white paper which could be looked at in terms of an investment case in those specific technical areas. So we're looking at kind of the metrics of kind of numbers of countries. Do you feel comfortable with that, given yesterday's discussion? And then in terms of numbers of members, we want kind of be, I'm going to really push us here, being bold. We have around 800 members, I put it 1,000, but can we kind of think really boldly that really the HDC and the SDG Gap Data and Digital is kind of the go-to for kind of a partnership in data for health-related data, for the SDGs, and by 2025. We're putting it there. Can this be a big thing that if we're all part of, and I sense a real energy in the room yesterday, that we go for a much bigger number, kind of, we're saying 10,000, but so that all income levels are represented. We look at the gender ratio of the membership, etc., and a bit of the stats that we presented yesterday. And the last metrics for this one would be kind of number of organizations. And again, we currently have 220. Could we think about 1,000 organizations by 2025? And there's a range of activities under there to make that happen. And next slide. So the second milestone area is on knowledge brokering. So what we're suggesting here is a lot more focus on the metrics that are measured on focusing on our website and the use of the website as to increase traffic, to put the report. I know the RHIS working group is really keen on looking at a repository being housed there. There's a range of other activities that could actually, the HDC website could be a repository for a whole range of other information as well. So really looking at ways in which we increase the growth in terms of the website page views, webinar attendees, and HDC email subscription. I mean, they're just very basic kind of matrices, but pushing for much more HDC SDG Gap hosted webinar attendees on a monthly basis, and that's what we'd like to do. So you'll hear Carolina has already approached many of you to really crank up the ways in which you can showcase what work you're doing. It might be a country-based webinar, what issues you're dealing with. It might be a constituency-based webinar. It might be a working group-based webinar. Anything that you want to show a good practice, or encourage peer review learning, using this just as a hosting platform. It's an asset for you to use. So really getting that kind of knowledge brokering right in terms of sharing good practices and making sure we've got a functioning website. We're able to host those webinars, or it might be regionally based workshops as well to establish that. Okay, next slide. So it's really looking at the scaling up and aligning HIS partner support. So as I said before, I mean, those are the numbers of countries that we're looking at, 12, 16, 20, 26. People comfortable with that, or should we look at the numbers again? But we want to be ambitious. So what did the country missions actually look like? So we're suggesting that in 2022, this year, we have 3 joint country missions. That's not going to happen. We've only had 1. I doubt very much whether things would really, between now and the end of the year. But next year, can we look at, I put 3 there, but it might be 5. What do they look like? That we're really focusing in the first 3 countries on CRVS and GIS. And I think, I mean, Rachel and I, UNFPA and WHO had a lot of discussion. It's really good to be technically focused on these missions. I think it's really helped focus a lot of attention on some of the priorities that have been identified by countries. And it's helped galvanize some of the action amongst partners into very concrete actions. So there's a real benefit for being focused on technical areas in the countries that they prioritize. So for the first 3 joint missions, Pakistan, Nepal, and Malawi, those would be the technical focus. And they may be the technical focus of other missions as well. What we'd like to suggest is there could be 2 other missions at least by June, July next year on top of those 3. So at the end of that process, we have 5 missions that have taken place that are probably initially led by the 3 multilaterals, but really we encourage, because we started a momentum, that it would encourage others to join, specifically in those country missions, to join and support in whatever way you can on those country missions. And that moving forward, again, we're suggesting, and again, this is for discussion, that can we align, is there a tool that we can align with when we're going and supporting countries based on their priorities, using something like the SCORE technical tool? We mentioned the SCORE technical tool because, speaking to many of you, it's an assessment tool that assesses how strong or weak information systems are, and that there's a suite or range of potential interventions after the assessment has taken place, and that potentially with partner support in countries and at a time, if it's presented at a time that is convenient for a country during a budget or planning cycle, the SCORE tool could have a lot of weight. It's got CRVS in it. It's got a whole range of other tools that could support you. And there could be a range of kind of activities. Now with the SCORE, all the stage that we've got so far is just basically the assessment side of things. We need to link in with a partnership type of approach in countries. Can the SCORE tool help galvanize and highlight what the weak spots are and the strong spots are, and use it as a tool that could be used for a way of looking at investing? So that's just it's a suggestion, and it could actually help bring a lot of partners together in countries and very focused on a discrete output. So that's what we're suggesting, and again, for discussion. The other metrics for this that we're suggesting is the annual improvement of alignment that we talked about before, and we would work very closely not only with the GAP Secretariat but with you, so that you have inputs into how we monitor alignment, and it encourages you to think, and your agencies to think about alignment in a different way and incentivize the issue of alignment and decreasing fragmentation. The other metrics with this one in scaling up, you heard from Wenya yesterday, and we're really looking at the model of using the regional platforms to help scale up and provide a coordination mechanism. When we talk about regional platforms, we're really meaning three main things that could require inputs in our work plan. One is supporting the regional institutes. There are 3 just now that we've identified or being suggested by you, one from Asia in India, one from Kenya, and one from Senegal. There are probably more. On top of that, regional support mechanisms for the regional offices of the mainly the multilaterals, but there may be more. They provide a huge coordination mechanism for many of the countries. And could we support that mechanism in a way of perhaps having a consultant or 2 that could support that and be embedded within one of those regional offices that could help coordinate the HTC and SDG GAP data and digital efforts? So we've used consultants like Serena and Nadej. Serena, you met yesterday. She was actually, they were both consultants contracted actually through a UNICEF contractual mechanism. It was really useful to do that. And we can look at ways of contracting, whether it's be through WHO or UNFPA or UNICEF, but housed with one of the institutions that could really be the eyes and the ears and support countries and have a relatively frequent travel arrangement with countries that need support as well. So that's the other element of the regional platform that we're trying to look at and promote, and we can, cost out how much that might cost, but that's the model that we're proposing. And then last on this output is a really critical one that I don't think we've really done our homework well yet. We need to kind of push a bit more, which is why we sent the email this morning, is the percentage of HDC working groups. As you heard yesterday, we've got 7. Some are really very active, tons of work going on in the working groups. Some of it is fragmented, as we heard your feedback. Some of them aren't communicating with each other. We need to be better at making sure the co-chairs of each working group on our monthly meetings are really exchanging information in a bit more effective way. But the metrics for this is looking at the percentage of HTC working group outputs that are achieved annually. So what we'd like to do in the work plan is actually consistently throughout the 7 working groups are the resources in the HTC work plan that can support 1 or 2 of your priority outputs per working group. And more importantly, you'll see in the email and from the discussion yesterday that the working groups are able to respond to potential requests from countries on technical areas. I think many of us see the working groups as a technical asset for countries that can be tapped in, not just WHO, not just UNICEF, not just the usual suspects, but a range of partners that can help provide technical expertise for countries. And we might want to think about a request mechanism of how countries, if they have a specific issue, they can raise a request mechanism to the HTC, and it falls into a technical area that a working group can respond to. And I think we need to look at the mechanism by which we do that, but that's one model, again, that we'd be very keen to explore as part of the work plan and allocate some resources that might make that happen. And then lastly, the fourth bit of the kind of the strategic priority that we're looking at is advocacy and political will for health information systems investments. So within that is really the making the case for the investing in health information system. You'll hear later on today the group that's going to be helping to lead some of the thinking in that. Many of you in the room are part of a technical panel that will advise on that. We hope that that will be presented in a leadership event next April or early May. But beyond that, can we look at ways in which we are supporting advocacy efforts? And again, many of you in the room are part of advocacy entities, but our civil society colleagues, for example, are much better. They can say and do things that many of us in the room can't. Can they support with advocacy efforts, for example, and moving along, potentially using SCORE, and that's a suggestion again, using the SCORE element, advocating for the use of something like SCORE to be used as an investment framework for health information systems. Again, these are ideas, and we're putting them in the draft work plan, but we need your feedback whether this is appropriate or not. And then the other thing that we're suggesting in milestones for this is having an annual event where one of the main bits of feedback that we've got over the last few years is make sure there's a much stronger connection between the technical work that goes on and the political leadership levels as well, so that there's a constant kind of communication within the agencies. It's not just HDC, and we're trying to promote that. So we'd actually have an annual event. We had one in late 2020. We had bits and pieces in the Data Governance Summit last year where there were many leaders involved. We'd like to propose another one in April next year that you'll hear about later on today. But every year, potentially there's an event where our leaders basically meet on a basis that can really shift the political landscape to make sure health information systems is on the agenda. We heard yesterday from our Gavi colleague that it's the first thing to get slashed. So it's basically advocacy will and trying to make that happen. Okay, so next slide is okay. So before we get into the detailed discussion and get your feedback, we wanted to kind of just emphasize what we have as objective 4. Just never forget there's some recurrent costs to make if this is a platform you want to succeed, there are recurrent costs involved. And there's no shying away from them. We want to be quite blunt and just make sure you're all aware of them. It's the building the relation, and this is part of the Secretariat's duty, but it's also part of general governance that you all have a responsibility for. So it's basically making sure that the Secretariat has a role to establish and maintain relationships between the partners and within the working groups as well. A large part of it is coordination. So it's the things that Mwenya, myself, and others are doing to make sure meetings happen on a monthly basis. There are many meetings, a lot of things that happen. It sounds easy to do. It's not. It's a really tough job, and it's important. It's important, and it's not an easily demonstrable impact. I mean, we all got to say, okay, so what's the impact of this? But coordination is important. You've all said yesterday you need it. We want to provide it. It needs to be somehow resourced in the work plan. So there's a list of issues there that need to be kind of taken on board. Then there's the monitoring and evaluation progress. If we can agree on some metrics, we're happy to kind of provide monitoring of how we're doing on a regular basis, a more regular basis. We're suggesting a quarterly basis. There's the database and the maintaining of the website, for example. And then there's the communication advocacy strategy, which requires a range of resources as well. So it's just a flag to say, don't forget recurrent costs, because if you want things to work, we're going to have to kind of look at resourcing them. Next slide, and I think it's the last one. So in terms of, the main, I kind of rattled through them, and their ideas. We put some of it on an Excel spreadsheet, which we can share. Obviously, I can't share just now because we really want your ideas on making this to work. But before moving forward, the key assumptions that we're making in those kind of 4 strategic areas, we want to kind of, again, get your feedback on it. We're assuming that we can go ahead in terms of the number of countries, 12, 16, 20, 26, along the lines that I described, and that are you comfortable with using something like SCORE? There may be another tool out there that kind of pulls a lot of other things together. We welcome suggestions for that. But the other assumption is the working groups, we heard yesterday, they need financial support to actually make things work in terms of their deliverables, in terms of responding to countries and contextualizing tools. The third assumption that we're making is this regional coordination platform that we're suggesting. There's resource implications for that. Are people comfortable with that, of really shifting a lot more responsibility and coordination to regional levels, which is closer to reality? And an evaluation, the evaluation recommendations next year may shift some of our thinking. So the evaluation is going to be important. The other assumption is there are special efforts to support diversity for increasing numbers of our country colleagues in the HTC, CSO colleagues, and those from the private sector, because they're underrepresented. And then you'll see, lastly, we also sent an email for ideas for innovation and creativity. Our Botswanan colleagues yesterday reminded us how important innovation and creativity is. So we were thinking, just if we have some ideas, we look at a model by which, is there a way in which HTC can stimulate them? So we're looking for ideas. We sent an email this morning. We hopefully get some ideas as well. And then the tech priorities, I mean, we're putting a lot of emphasis on data governance, CRVS, GIS, HIS investment, and community level based approaches for communities left behind. Those are kind of the technical priorities that we're seeing just now if we're going to prioritize some. So I'll stop there. I hope that was useful. It hasn't been a presentation of an Excel sheet with figures behind it, but if we're talking about an annual plan of about $600,000 to $700,000 just now, we want to implement much of that. I think we need to think very carefully about significantly increasing resources, probably 3 or 4 times. But that's, I think, for discussion. But we've made some fundamental assumptions there. We want to get people's feedback. So back over to you. Thank you.
Thank you, Craig. I think that's quite an ambitious work plan, but definitely would need inputs and suggestions. Yes, Steve.
Great. Thank you very much for presenting that in a lot of detail. So I apologize. I was trying to jot down some thoughts as it was presented. So just sort of a laundry list of things in no particular order. But one of them was on the point about the potential reference mechanism, or request mechanism for countries. This is something, and I know Derek and others from DH&I aren't here, so hopefully I'm not over speaking, but we do have actually a working group around country engagement in the DH&I working group that I think would benefit from similar being aligned here, because we're trying to, again, figure out how to best have country engagement in the DH&I, and I think a unified request mechanism and then response would be helpful, so that we're not getting some through DH&I and some through HDC at a different level, but again, fully support that idea. The around the objective two, a lot of focus on page views and things like that. And then I think another component would be looking, and not to complicate things, but the actual use of the tools that are there and the downloads and even small surveys of how this was actually used, because I think that will help us, just as we were talking about, we're talking about the HIS investment case later today. Craig, you're trying to work on the investment case for HDC, and we spent a lot of time yesterday talking about, what is the value of HDC? What's the value of participation? So I think, and I guess linked to that is somewhere in everything that we're laying out is almost this idea of customer service, of how are we measuring if we're creating value by people participating in HDC, whether it be country colleagues or other colleagues. And so I don't know exactly how we want to capture that, but I think something that shows, increase in number of countries who feel that HDC responded to their needs in some way, or even looking at how we're trying to justify coming together. What's the value of coming together? I think we all appreciated this yesterday, but even some small surveys, ideas of, I was introduced to a new colleague who helped me solve a problem, or to a new resource that I wasn't in touch with. So there are people who have put much more thought into this than I have, but just as we look to try to figure out what is the value of having networks and convenings like this, some way to try to quantify that and then try to capture that. Yep, that was it. Sorry, a lot of things.
Thank you. Yes, Pam.
Okay, I have a similar stream of consciousness response. Apologies, I was writing as quickly as I could. Okay, so a couple of things. Yesterday, it struck me that, in terms of, I think as you all know, I'm co-chairing the Research Academic and Technical Constituency. The other co-chair is not here. Chris is standing in. The constituency is deeply undermapped and underutilized. I think we all realize that. It's the largest constituency, one of the largest constituencies, but it's opaque to us. Even we do not know what that constituency, what the knowledge assets of the constituencies are. So, for example, I also I participate in the data governance working group. So let's just say you have a data governance working group and you have a research, academic, and technical constituency. If one were at a country level and just looking at these two working groups, one would immediately know what the data governance working group's knowledge assets are. But one would not be able to adequately map what the RATSI network would offer. So one of the proposals that I'm working on, which I have promised to Mwenya, is to figure out a way, and I think I've got it, I just need to map it out and send it to you guys, but to assess the knowledge capacities and skill sets of the RATSI. I'm just going to call it RATSI, sorry, it's shorter. And to then be able to utilize that in a very focused way to support missions. So for example, and this will be a lesson, or not a lesson, this will be a learning procedure. But for example, we should be able to do this assessment fairly quickly. This is not a difficult lift. And I know there are a lot of members, but still, this is not a difficult lift. We all know how to do this kind of work. And then once that is in place, then we should be able to draw upon that constituency to then provide a very significant technical mission support to Nepal. And we will be able to work with HDC to create clear goals and objectives for providing this support in line with what the country wants. This is, again, something that is completely possible as long as we know what is going to be required, etc. I think the one thing here is that I think the plan is ambitious. I think reaching up 100% always makes me nervous because I don't think it's possible, but I understand it and I wouldn't change it either. But I think that there are limits to volunteerism, even in a large group. So I do think that finding additional sources of funding, even if it is foundation funding, etc., I do think that if if we can all do our work with Nepal, I think that we would be able to make a very, very, very strong and empirically based use case and funding case for additional support from external foundations. And I think that that would help support the work. And it would be really great to develop. I really like the idea of the regional focal points. I think that this is very sustainable and the proper, governance way to go. I don't know if any of you are familiar with Ibrahim Index. Is anyone here familiar with the Ibrahim Index? Everyone from Malawi is, yes? Yes, the government, yeah. It's an extraordinary index. If you're not familiar with it, it is just extraordinary. I love it. I love its research methodology. Basically, it tracks all the different measures of countries in the African region. And I do think that this is very important for this group. So yesterday, it was very clear that there are overlaps of, for example, identity ecosystems with CRVS, as well as other technical components of health systems. So I don't think that we need a full Ibrahim index, but I think an index of how these systems interact with each other and can be scored and would not be a difficult thing to do in about a year. It would take about that, I think, because it requires foundational data and a couple of other things. But I think getting started on something like that and making it sustainable would be really, really good. And then, yes, I talked about the working groups, that we need to map that. I think it's really important. I really agree with the quarterly meetings. I think that's just about right. Someone yesterday mentioned a bottom-up approach. I really like that. I like the idea of having top-down approaches in addition to bottom-up approaches. I think both are very, very necessary. One concern I would like to just bring up is that I do believe that we need very specific monitoring and targeting goals. I think if there is a person who can be tasked with assessing SDG alignment with the activities, that would be great. It would be this is the kind of thing that might be very possible to get external funding for, or find it somewhere. But I do think that we're going to need someone who can very objectively sit outside of our work and track how we're tracking with the SDGs. And this would reduce work burden on a lot of folks. And I think I've mentioned the identity ecosystems and how important that is. Top deliverables, we definitely need support for because of the volunteering issue. And I had one more thing, and then it's going to be very, very close. Yeah, the percentage of the HDC and which parts are functioning. I know that at one point there was a consultant that was kind of measuring the productivity of the groups. Is this consultant still doing that?
Productivity of the working
Well,
groups?
like,
Or?
if we were meeting, and that sort of thing.
Yeah, so I mean that would be part of the terms reference of the person who coordinates the working groups and output. So yes, Alex was doing that, and we're looking at who might do that in the future. But yeah, definitely.
I thought that was really helpful, and having someone to coordinate that would save people so much time, and it would put it in one bucket and allow leadership to have oversight in a very meaningful way. And I think that would be really, really helpful. And then you've already included this, but I really support that this work should be technically focused. I agree with that. And I really support that the work needs to be measured very, very carefully. It could be qualitative and quantitative, but I do think there needs to be precise measurement that's ongoing. And I would really love to find a way that we could work collaboratively together as a unit to also assess areas of improvement and make sure that we are actually improving. I really love the Toyota way and the process and cycle of ongoing improvement. And I think that this group is already doing that, but just really would love to see that continue to support, including measurement of success. And then finally, just ending here, I think that Nepal would be a really, speaking for RATSI, I think it's a very, very important use case for us. We should be able to, so for us, for accountability, we should be able to assess the network, assess the knowledge capacities and skills of the network, and be able to provide technical support to that mission. And then the support should be functional and the support should be useful to the country, and the country should assess it as useful. If those things don't happen, we need to know what we did wrong and how we can possibly improve. But I think if we've got our eyes open going in and we seek those outcomes and information about those outcomes going in, it will really help. Apologize for the length, but I wanted to get all those thoughts in. Thank you.
Thank you for all the valuable inputs, Pam. We had a hand up here.
Yeah, thank you. Congrats to Craig for the excellent presentation. And I commend you and your team for holding the fort, for keeping the HDC going. Really appreciate it. I have a few comments. The focus on the knowledge brokering, I think, is very, very important. We have said over and over again that if you have the website, that is where we can disseminate all the good work that we are doing, and other countries can have access to them. All the work we are doing, the working groups, what have you, we can publish all on the website. I'm not very familiar with the SCORE tool, I must say, but if we have that or a similar tool to do a desk review or assessment of all the countries, it will help us to map the countries and we know where they stand. And then we can identify which ones perhaps we can focus on. That may be one way to also increase the number of countries we want to reach. I don't think we can go on joint missions to all the excuse me. I don't think we can go on joint missions to all these countries. But if we have a few countries based on the mapping, we select them, just making phone calls, find out what they are doing, and then referring them to the working groups sometimes may just be sufficient. It may be as effective as actually having the joint missions. There is a focus on CRBS and GIS. They are important. I lead our work on CRBS. I like CRBS, but I'm not sure whether that should be our only focus. And as we know, CRBS, actually, if you go to most countries, it is driven by other ministries, not the Ministry of Health. And sometimes they are not too keen on that. We had the joint mission to Malawi yesterday. It was on CRBS, GIS, and I'm hearing, I don't know whether correctly, that for the Nepal as well, we are looking at CRBS and GIS. I don't know whether that is the way to go. As we all know, the HIS has several subsystems. There are some countries that we have issues with the logistic management information system. ELMIS needs to be developed. In some countries where we have issues with the human resources, we need to have the EHR system, we need to have the electronic medical record system. Most countries have DHIS too, what have you. So I think when we do these assessments, what have you, we should be able to identify which area we want to support in a given country or refer them to experts who can support them. By saying that we'll have a focus on CRBS and GIS, I think that may not be applicable to all countries. Regarding the issue of having consultants, I think it's important to have consultants, but as we all know, consultants have various areas that they have expertise in. I don't think we can have a consultant sitting in, for example, Kenya, and we say you should go and support several countries in Africa. It depends on what area of expertise that the countries would need. So through the working groups, we have a rich group, we have a lot of people in the working groups. And I think sometimes we might not necessarily need consultants, but if a country has specific needs, we can refer to the working groups, tap the experts that we know to be able to go to some of those countries. There are times we have to pay for it. If you are lucky, we may not necessarily have to pay for it. So I'll stop here, but we appreciate all the work that has been done over the years. Thank you.
Thank you. Thank you so much. We have a couple of hands. I'd like Chris to go first and then
And then
Rachel.
there's some questions online too, but
Okay.
so just a couple of comments and a request for some input from our colleagues in the room. But thank you, Sam, for those thoughts. And I asked Craig to put back up, the overall aim, which again is the alignment of investments, technicals, et cetera, resources at the country level. So my ask is for our colleagues from Nepal, Malawi, Botswana, Cameroon, those who are in from the country, regardless of your role, what does this alignment and investments mean to you, and how is it facilitated, if at all? So is it where you have all your partners come together on a regular basis to report out their activities to some sort of central body or not? Is it another approach, et cetera? So something that the HDC can either help facilitate or possibly promote would be, I think, beneficial for us who are not at the country level. Nepal, I would ask you to react to the upcoming mission and what you feel is most important. And I know you won't be speaking for all of your colleagues in country, but if you have thoughts on that, so that they can help, really help planning of the potential mission that looks like it may be at the end of January. Who should really be there? What would be the real focus in the technical areas, et cetera? I think that would be helpful too. And I think that was it for now, but maybe why don't we see if there's just some commentary around that first, and then we'll go to some questions online and come back to the room. So maybe Nepal first, since we were just talking about your country, and then others about the alignment from the country level. Over.
Thanks. Nepal, like other countries, we have very good partners working together for betterment of health and also the health information systems. In previous events, in the Zoom meetings we had with Hendrik, Moina, and Craig, several times I shared that for country partnership, we need some top-down approach. They have to be communicated from their head offices, global offices, to make the partnership following the SDC norms. So in that way, it will be comfortable for us to have some kind of understanding. Like this meeting, the visit is planned for next month, for January. One of the colleagues from UNFP was asking me, "Oh, I came to know some mission is coming from headquarters, including UNFP and WHO. They are coming to Nepal." He came to know from their organization, not from me. So it will be very easy for us if the message could be communicated from their leading agencies, from headquarters to them, to make alignment and make this engagement to force at a country level. Then it will be easy for us to communicate and make dialogue there. Otherwise, we'll be briefing everybody, the SDC mandate, approaching everybody. Many of times we don't have approach to them like Gavi and Global Fund. They don't have office in Nepal. So how to approach them, we don't know. So it is needed at the SDC level from headquarters. It should be communicated, and we work over there. It's good. The ministry that has pivotal role in all this coordination. They make the program. They express their aspirations, their desires, and they ask for the support. So yesterday also I talked on this issue. We have to make ministry and SIS people competent to create the demand for the better health system. What should be needed? Like one example we have in Nepal, we have developed the HMIS roadmap. So this is the first time we visualize the beneficiaries. Otherwise, in the information systems, we always say that this is for PME, this is for PME, this is for program managers. But this time, explicitly, it is written the beneficiaries, the people, the service provider, the policy makers, the program managers. Explicitly, how they will be benefited through the information systems. This is not for only measurement, but to increase the efficiency for the service delivery as well. So the objective is quite tracked over there. In this way, we can make the change, identifying the beneficiaries and designing programs for them. Then we have common goal, and we can make the partnership at the country level, having shared the goal in common. So this is the way we are planning for. Thank you.
So maybe if I could call on our colleague from Botswana, the chair from yesterday, around, what does alignment mean at the country level in Botswana of these technical, and how does that happen? What would be needed from an agent, from an organization or group such as the HDC to help facilitate that at the country level to help further define our specific activities? Over.
Thank you so much, Chris, for the question. For Botswana, I think alignment means the government and the partners are working together on the same strategy to deliver it, and also to combine their resources in order to drive the strategy, and then to have a common monitoring and evaluation framework using the same systems. However, I feel there's a lot of improvement that is needed there. We do have what we call the Partners Forum, and it happens on an annual basis, where we provide feedback to our partners on the achievements of the health sector. But this forum can be improved in terms of getting the partners' input into what is going to be discussed during the forum. I also feel at the stage of planning, we really are not where we are supposed to be in terms of actually bringing the partners together. By default, somehow you find our partners working very, very closely with the different programs, and they are supporting the program activities. But there is no central point where, for example, I would understand what the partners are contributing. It's like each program is having its own partner, and they're doing whatever they're interested in doing, although it is part of the country's priorities. So in general, the partners are aligned with the country priorities, but they can be better coordinated so that we get better impact on the investment that they are making. I think the support that we can maybe benefit from HDC is the capacity building in terms of, again, our human resource on the ground, being able to effectively manage the partners, be able to come to the negotiation table and negotiate on the priorities that they're having there and how they are going to use the budgets and monitor the programs, so that we don't have this imbalance between the partner and the healthcare worker on the ground. So capacity building around that is very, very important, and I hope the academic and research subgroup can help us with some training programs that will focus on, partner management and negotiation skills, something to really help people on the ground deal with this complexity of managing partners or managing partnerships. Thank you.
Okay, I'm going to have Malawi do a similar thing, but maybe we'll pause for that just for a minute. Wanya, did you have online questions or something else?
Joanna from Global Fund waiting patiently online.
Okay, please go ahead.
Dr. Rashidian from our WHO Emerald Regional Office.
So
Joanna,
we'll take
please
a
go ahead.
couple from online, and then I'd like to invite Malawi to make the similar commentary as Botswana did, at least, and then move on to other comments.
Hello, so it's over to me. Thank you. Thank you very much. I have a couple of comments. I really like the thematic reviews, the technical priorities that you have set up, and the Global Fund really aligns with them and advocates with the countries to invest towards all these items that you have listed, starting from data governance, CRVS, GIS, etc. I think what is missing is data analytics and use. It's really key we don't invest only in systems. The systems are already producing important data. We have much more data available today than we had 20 years ago, but the data is not analyzed and not used. And we are not going to reach the SDGs if we don't put a handle on that. So I would really advocate in adding this to the technical items of focus. Then I would really like also to make a point for country choice. I think the 26 countries is not ambitious enough. And maybe we need to have a differentiated approach to the country support that the HDC is providing. One colleague said that maybe you don't really need to go on a country mission. Some of these missions might be actually very burdensome on countries. So maybe there can be, now that we are in a virtual world, maybe there can be something already identified virtually, and support can be organized through virtual means. And I'm saying that because there are so many countries, many more, like we are supporting over 130 countries, and they all need alignment, not only the 26 that are on your work plan. I would also like to advocate for inclusion of more French-speaking countries. Cameroon is half French-speaking. As you always see, for any initiative that the global partners are supporting, it's always the same suspect. It's always the Anglophone world. I would really like to push for more French-speaking countries to be targeted by such initiatives. And one thing that I really liked from one of the colleagues is the bottom-up approach. We need to ask the countries what they want us to do through HDC, how the HDC can be the most useful to them, and not top-down. And maybe we will be able to be more impactful if we align with what their needs are. I think it would be also very useful to see, have a look at of what different partners and donors are doing. And just for your information, and I'm not saying, that the Global Fund is best placed or whatever, but the Global Fund really tries to align with the national strategies. These are the, starting points for Global Fund investments. And we do have this investment rounds every 3 years. So every 3 years, we ask the countries to take stock based on the strategies, and this also for HMIS investment, HIS investments. Where are you at? What is your strategy? What are your priorities? And this is coming to the Global Fund, but maybe that could inform investment by other donors to see where the gaps are that the Global Fund cannot be filling, and they can complement. Moving now on to the country missions. I'm not sure this is, and sorry if I am frank, but I think maybe we could have a better metric on that. For me, the country mission is a starting point. What really should come out of the country missions is a clear action plan that is budgeted and for which there is commitment from different donors. Otherwise, the mission might not be very impactful. I really like the regional approach, and just to share with you one of the initiatives the Global Fund is working on. We are in the process of setting up or supporting regional partnerships between academic institutions at regional level that then work together with ministries of health in countries to strengthen data analysis and use. We also are investing in regional hubs for digital HMIS support, so the HIS hubs, but also beyond DHIS too. So I think it would be really beneficial to see whether we could combine forces and have one regional approach. And I'm very happy to see that Senegal, a French-speaking country, is already targeted. So maybe we can exchange offline and see how we could maybe join forces. Again, I think we really need to see how we spur alignment, and here I'm addressing the donor alignment with the country systems. It's really not where it should be. More efforts can be done, but I think we need and I don't know, I don't see many donors in the room besides Gavi and myself, I think, at the Global Fund. So I think we really, at the global level, we need to find an alignment between the donors already at the global level, and it will be then easier at the country level when we already come with a common agreement that this is what we are jointly supporting, and we don't confuse countries with too many different requirements that go in the same direction, but there are small differences, and it will also result in more efficiencies. I would also like to make a comment on the working group. Perhaps, you know, we could open the participation in some of the working groups. Maybe we can also look at the number or the thematic working groups. I think the GIS is very important and underutilized technology and tools. The Global Fund would really like to see how we can support geo-enabling HMISs, and I think it's really important to have a common and joint approach around this aspect. I don't know whether there is already a working group for GIS. I don't know whether GIS is being meant to be discussed through the RHIS working group in which I participate, but I think it will be really important because there is a lot of things going on in this sphere, and we need to have a clear alignment between partners and that are active in this field. Yeah, I think this is it from my side. Thank you very much.
Great, thank you very much, Munya. We had another question online that we'll take and then move back into the room.
Many thanks indeed. I'm Arash Rashidian. I'm joining from Cairo. First of all, my regrets again that I'm not in the meeting with you. I was in a mission, just arrived this morning, early this morning to Cairo. So a few comments I want to raise, perhaps most of them are in line with what's said, but with maybe adding a couple of angles here and there. First of all, in terms of, I mean, Greg, that's an excellent job. I mean, all the colleagues who have contributed to this, I'm really grateful for that. So in terms of the areas of focus, I mean, one understanding is that so not every area of focus will be applicable to every country. So in a way, for example, if you have CRVSL, doesn't mean that every country would need. So I think that would alleviate the concern that one of colleagues raised, that CRVS may not be applicable for different reasons, not that perhaps a country may not announce that they need it, not that they don't really need it anyhow. But I have a separate comment for that area is that, I mean, I think the key packs of programs should be separated from technical input to the better conduct of the program. So GIS on its own is a tool. Our CRVS is a national plan, a national structure. So, I mean, I would separate things that are about the major structures of health information system, for example, routine health information system, CRVS, survey agenda, national survey agenda, etc. And then the tools that would contribute to better conduct of those. So, for example, GIS would be a tool that would contribute to all of these and will enhance all of them. So anyway, that would separate the issues of, and it would also avoid that we go with the sort of plans for technical enhancement that may sometimes shadow the national agenda for the country. So let's say if you go with the technical agenda, let's say a good program like enhancing DHIS2 in primary care in a country that needs it, but then if you don't link that with the bigger picture of routine health information system, then that plan is certainly not be that useful. So in a way, so separating tools and approaches to the main areas of health information system, that would be important. The other conceptual comment I have is that, I mean, sort of the tone, I mean, all the suggestions are really good, but the tones sort of somehow maybe vacillate or change, so that I had that feeling between HDC as a sort of an informal setting that works as coordination, bringing different partners together, towards a sort of formal structure that would have its own tool. So I mean, where I felt that most was when referring to consultants. So I mean, are we talking about the HDC consultants in countries? So that would then be a lot a talk of formalities. So I don't think that would be probably what is meant. So this consultants to support secretariat function, I think that's one thing that is really needed. But then if you think of, let's say, consultants to support countries, then those consultants should be part of the existing structures in the countries rather than HDC becoming a structure also with its own consultants somewhere here and there. And the third point I want to raise is the issue of the focus. I mean, so obviously I've had the pleasure of working with HDC over the last few years, 7 years, but then also seeing how it's been revived very strongly in the last couple of years. So that's excellent to see. There has been some observations in the past that certain projects, certain HIS programs were running in countries as projects. So we've had, for example, under CRDS, I can refer to the same suspect here. Under CRDS, there have been countries that they have had CRDS project for years and it's still national information system or national CRDS agenda has not moved much. So in a way, giving more focus on issues of when we are talking about the sort of things that are about national structure, national capacity, national program, and separating that from the projects that are needed to fill the gaps and enhance those, that would be good. And lastly, and I think what I'm going to say is totally in line with what Joanna just mentioned about the missions. So yes, having the mission is excellent. The purpose of the mission is supporting the country, but also missions, and that's in our experience quite a lot, would also help the partners to know each other better. It's something to agree in a meeting on technical issues is another thing to be on the field and see that what those technical concepts mean in practice and agree on those agenda. So it would also help the countries. But then the missions, two elements I would add. One is that, and I raised that based on an experience of some exchange we had about for one mission that was being discussed. So for different reasons, we had the feeling that the country is not in the best position to host the mission at the time. But it was very difficult to convince partners to sort of convey the message saying that this is not the best time for this mission, this should be postponed. And so, as HDC, we should have a better sort of listening also to each other when we hear from each other there is a genuine concern to change the days rather than institutional mandates or institutional deadlines that we want to meet. So that's in the end, I would say, that was resolved, and I'm grateful that colleagues in the end agreed. But it took, a lot of time from several colleagues who absorbed that. Secondly is that, so Craig, 12 missions, but that's excellent. That's beautiful to have the target. So what, can we have some target about the actions after the missions? So how do we sort of make sure that those missions actually result in change? Can we make that a sort of an agreement? So it's not just going to the mission, but then something results out of it that can be linked to the mission. Many times, apologies that took too long. Thanks.
Thank you so much. We'll now move to Malawi. I think Malawi was waiting to respond to Chris's question when we went online.
Yes, thank you very much. So Malawi will make a response on how CRVS would be aligned, or how we understand alignment in the context of CRVS and the GIS. And then also,
it could be more than just CRVS, but a little bigger.
And then and then another colleague would make a presentation on HIS and how we would integrate these. So for CRVS, in terms of alignment, I think we already have a platform for which we have partners that support CRVS activities in the country, and in terms of and how would think of alignment is that after we've developed the first national strategic plan for CRVS, because currently we've never had one. We've only had a strategic plan for the National Registration Bureau, which is the agency, the primary agency for CRVS activities. So we're planning for a national CRVS strategic plan to include all the other facets of CRVS. So because we already have a structure where we have partners in it, I think they will participate in the as they always do in the planning of that, and certainly in terms of support, they can be reflected in the implementation of that strategy. So we I think are in a position that we can easily align ourselves in terms of CRVS implementation. And for GIS, I think as the mission also noticed, is that we have quite a lot of capacity and quite a number of agencies implementing, rather collecting data that is georeferenced. I think what's primary is to set up the governance structure, setting up a group of practice or some sort of working group that we think should be within the HIS structuring, so that they can feed into that, and then there's a link with the CRVS. So I would ask my colleague to perhaps come in terms of how we would do or how we look at alignment in the context of HIS as a whole. Thank you.
Thank you so much. So in the context of HIS, our thoughts are not very different from what Botswana presented. Firstly, the issue of agreeing on the strategy. So at least, buying into the existing strategy. And as we highlighted yesterday, currently the country is looking at developing a new strategy after the expiry of the current one. The thinking is that all key partners, donors will be involved. The priorities will be agreed. The current status will be understood by everyone, and then from there we'll have priorities that we can focus on for the next course of the strategy. And then the other aspect that we look at in terms of alignment is integration. So we've had a number of tools developed by different projects, funding partners, and the direction is to see how do we best integrate those tools to ensure that they're effective and also sustainable in the long term. We're coming from a situation where you have a program, and then small functions of the program have different tools which require a lot of resources to maintain, and a lot of effort and work from the health workers. So that is one thing that we are looking at. Integration, it's kind of challenging because some tools have some partners have invested a lot, and to think in terms of how that is going to look like in the context of integration can be challenging. Of course, the hard decision that some tools may be discarded, that also needs to be looked at and honestly kind of taken up and accommodated. And then the issue of forums. So we do have a number of forums. I think in our context, most of the key areas have forums of coordination. The effectiveness is varying, but at least what we are looking at is continuing with those forums, either more investments in ensuring that they are more effective, as opposed to coming up with additional forums. So that's one thing. And of course, active participation as well. So there are other partners that do not have key staff in country. The key staff are, at headquarters level. They may not follow each and every discussion that is going on at the country, but at least when key decisions and key discussions are being held at in those forums, the key decision makers, can avail themselves and participate. And then there is the issue of resources, allocating resources to, priority activities, based on the strategy. And some, are cross-cutting, and if partners are very disease specific, it becomes difficult, to consider, cross-cutting solutions. Yeah, and then the maybe last but one is backstopping, country technical expertise. So we do have situations where solutions can be developed by local, institutions. Sometimes what we see is if it hasn't been, heard or reported elsewhere, it probably may not work. So there's a wait and see. Let's wait and see how this thing is going to look like. But I think, partnership with, those institutions, local universities, to explore those solutions and, present them elsewhere, accredit them in forums like these would probably expand, the list of global goods that we have. And then, so I think basically that is, so the next point is just reinforcing what I was going to say, what I already said, the backstopping the country technical expertise. Yeah, thank you.
Thank you. I think but we have others waiting as well. So Rachel, and then followed by Anna.
Thanks very much. And thank you so much to Craig for laying this out and giving us a chance to react. A couple of points on alignment internally. We are now SDG 3 GAP. Data Digital is now in a HDC, but then I realize you have a subgroup on CRVS, but the people who are in SDG 3 GAP and CRVS are probably not within that. So anyway, we have a little bit of blending of the families to go along. I wanted to reinforce the comment about the joint missions and the absolute necessity that out of that we get an agreed investment case. And this was an initial experiment, I think, in the Malawi case, but I think we absolutely all agreed that it may not even be in some cases for some of the agencies and partners new money. It may just be course correction, realignment of what were already investments in the country so that those are much more effective and aligned. But the other comment I wanted to make is, yes, GIS and CRVS, and again, that came out of an SDG 3 GAP discussion, but listening here the last day, I mean, this is distinct from a group that is digitizing the health information system. CRVS and GIS, I will defend as absolute and great priorities, but I don't think they capture what it appears is a great deal of energy going into digitizing the health information system. And that strikes me as a distinct set of investments and expertise, et cetera, that again, if they're in terms of joint missions, that perhaps that needs to be a distinct group of people who are on that mission. And let me also say it, because it seems everybody's very concerned about data governance. But again, in the Malawi case, we had to be very restrictive and say, well, we don't have experts in this mission who are data governance experts. We don't have those people on the mission. And there's tremendous need, but I think I don't fully grasp, I guess data governance seems to be a subcommittee within a different working group, but we would need a distinct group of people who are focused on data governance, who need to come in on that one. So I want to at least encourage, if there's interest, the potential expansion of the joint mission into Nepal or Pakistan to include some of these other issues. And the last one I wanted to make was on the consultants. I don't think, in my view, it's smart to have an HDC infrastructure going into the field that is distinct from the partners. It's going to be difficult. And I wonder if we should investigate a little bit more potential secondments. And I'm just thinking about, many of us, we're in 130 plus countries as UNFPA. We have 6 regional offices. WHO has a huge footprint. UNICEF is as large or bigger. And I know that there's more than those 3 agencies, but they at least have a big footprint on the ground. And asking for someone like UNFPA to second someone to the HDC and who will then is already embedded within our regional offices, it's going to facilitate all the engagements with countries. And if you work through the existing UN structure, I'm a late UN person in my life, but boy, that's a useful structure to work through. So I would encourage to think about secondments, or even if you go with consultants, but to place them in either WHO regional offices, et cetera. And the last is, Johanna, I don't know you from the Global Fund, but I couldn't agree more with a lot of the items that you listed. And on GIS, you know, it's the evolution is really fast and it's very fragmented, and there's real risk to that fragmentation. So if there can be a working group or a dedicated group of people to work on GIS, I would encourage that. You know, the UN meeting on GIS, which is the GGIM, it just met in August. It was the biggest they'd ever had. I mean, I don't have the exact numbers, but there were just, maybe Ravi has it for us, but it was a huge event. Nobody could quite believe it. It used to be this sort of small gathering, but it's, you know, I just mean there's so many governments that are coming to the UN right now asking for help on GIS. So I think if we can have some dedicated expertise and focus on that, that would be great. Thank you so much.
Thank you. Anna, would you like to go?
Sure, thank you. So I'm just kind of not speaking now just as a co-chair for the community data. I'm speaking on behalf of USAID here. So just wanted to say a few comments. I do, Craig, I really just looking at this along with the at the original document from 2015 that we all started with, and just this 5-point call to action. I really recognize and really commend having a very clear cut understanding of where we want to head and why we want to go there. And so just wanted to kind of reflect on a couple of things. One is that, as we all know, HDC is not an independent funding entity. It is not. Regarding that, it is an entity that is meant to steer funding and organize it around host country HIS and M&E strategies and priorities. I think we heard that from Malawi, from Botswana, and over here from our countries that we work with. And so I think I love this initiative to align HDC and SDG Gap. I think it makes so much sense. There are other huge global health initiatives such as PEPFAR, PMI, and others that also offer a lot of incentives through the programs that exist, the mechanisms through which they do work. So I think this kind of bringing all of these players together is so important. Reflecting on this, I think that the HDC TA mostly should go around coordinating country mechanisms and supporting this knowledge management. I'm gonna go beyond this communication. The term communication is a little bit different. I think we're kind of trying to really spearhead knowledge management across, and this two-way exchange between countries and HDC technical working groups, which represents so much of the work that's happening at all levels. So I think we need to get ourselves out of these small projects, because I think this is such a fast evolving space. Data systems. It's GIS today. The issue for the country tomorrow will be something else. And I do kind of recognize we have a certain 7 working groups that are active. I think that's the good way and good place to start. But I do feel like we need to be open when we're kind of putting this forward to countries and say, we want to meet you where you are. We want to meet you where your needs are today, but also show you that we can also meet you in the future with these other technical groups. So I would kind of go back to Sam's comment. These things are great, but I do want us to kind of think about HIS broadly and say, we're here, we have technical expertise, we have donors, we have projects. Let us move in the direction where you want to go. And if you open with us and work with us today on CRVS, tomorrow it may be on another technical area and priority of yours. So those are a couple of things. I do understand there has to be some facilitation at the country level. If consultants or something that's HDC specific is there to really steer that coordination and that communication and guide that work, I think I see value in that. But I do agree that we need to have a strong country presence and leadership in the areas where they want to really invest and coordinate us. So those are a couple of thoughts to all of this. Thank you.
Yeah, thank you so much, Anna. And we're having a lot of engaging discussion. There are a few more hands coming up, but I'm looking at the time. It's time for a coffee break, and Craig says coffee is ready. So maybe we can take a 15-minute break and be back at 11:15, and then we'll go with Letitia and Dr. Teresa. Thank you.
I think we're going to continue this session a little bit after the coffee break. The Secretariat will just revisit the agenda a bit for the day, but plan to continue this conversation after we have a quick coffee and bio break, as we say.
Online now.
And online, and we'll come back to online for some more questions. So we're just at 11:15 again. Letitia will ask her question.
Needs from time to time, and so that donors can respond in a coordinated fashion. Also, integration into continental, regional, and existing country structures, and not necessarily creating something new, which is in support of what's been going around. Communication, typically in standardizing how the HDC and WHO and all the other multilaterals engage with partners, engage with countries rather, and streamline interaction and not necessarily overburden. But here, emphasis also in how to internally coordinate with the multilaterals prior to coming to, so essentially approach the country in a bit more of a coordinated way. And that would also ease the burden, and then speaking from one voice, more or less. Country missions to communicate with all, including the partners, coming in a coordinated fashion. Bottom up, also echoing the sentiment that's been going around. Yes, top down is good and involving leadership, but also catering for grassroots awareness and inclusion. That's really where the tacky hits the tar, where lives are saved, and that's where the voices need to be heard. Sustainability, that whatever what we do, that countries are self-sufficient and this is part of tying in with scale up. What really is scale up? Scale up need to be collaboratively and inclusively defined with a country. We know there are some generic elements and constructs, but there are also very specific country needs. Leveraging on what we've learned from COVID, every country have a story to tell for COVID, and awesome, cool, and allow me that, mechanisms put in place. How can we leverage that for future pandemics, or also just integrate into country health systems? Then leveraging on rather consideration, I mentioned that internal partner collaboration and one voice in line. And this is quite important also in line with social determinants of health, that we, let's not forget the preventative measures, and to work in a more coordinated fashion. And also when one speaks to country, that we don't just speak to the ministries of health, but speak to government, speak to the country as a whole. They also integrate and function and deliver as a whole, so not just as the ministries of health. Then, as we spoke about that definition, maybe just in general, accountability for funders and partners. If I say I'm going to do something, hold me accountable, and HDC can play a role in supporting that, and in that way also bring in transparency for the people we serve. Awesome progress from the countries presented here at this forum, and awesome that we can learn from you. Agree on not focusing. This is to caution, because great work has been done and need to be acknowledged, but caution against a systems approach to assisting countries, but rather assisting countries with their health needs, taking time and understanding their processes. How does the health system function in that country? What is important for them? How does it work? And then comes the technical part, and technical part is underscored, and I've just touched bases my CDC colleague, in terms of then crafting an architecture and understanding on the various levels. But it starts at the top. It starts with the strategic direction. Where is it that the country is heading and why? And what's important and how do they know they've gotten there? And then breaking it down to business, and then comes the applications, then comes the technical bits and pieces. So understanding that we don't get stuck into coming with a systems approach already to start the conversation. And then in support of that is obviously the interoperability becomes key, because the minute you start bringing things together, you understand where there might be duplications and efficiencies and effectiveness that can be brought into processes. Digital health governance has come out extremely strongly, and I'd also like to caution that we don't just get stuck on data governance. Data is an element of the broader digital health governance, which is, and it starts not with a solution or a system, it starts with identifying a need that need to be solved. How that need to be solved also goes through a structural governance process until you either develop or expand an existing solution eventually, and then rolling it back and making it sure that whatever you bring into the health ecosystem makes sense. So thanks for that.
Okay, thank you very much for those comments. Teresa.
Hi, I'm going to speak from a perspective that I was part of the initial HGC when I was working in UNICEF. I'm working with the Routine Health Information Working Group, part of HGC, and my role as maternal newborn child, adolescent health and aging. I'm not disease specific, and what happened with COVID. So I'm really going to talk a lot that I really think that routine health information system and HIS is extremely important. And these visits that the HDC does should have a specialist on routine health information system as part of these visits. The demands that I get from the countries now are routine health information system, HIS. How do you do the analysis and interpretation of these data and assess the quality of this information? So what happened during COVID? We had COVID and we had disruption of health services, and we didn't know how disrupted they were. And we should have had routine health information systems in place where we could look at that. And what happened is that in some places you had those, but you didn't know how to do the comparisons, right? And people were just sending numbers from 2019, number 20. And how do you do the analysis and comparison? And then we had to write a guidance to say how you do the analysis and comparison of that. And I think it's really important. And I think the woman from Global Fund was saying that we really need to work on capacity building for data analysis and of use of data. Now, the working group in HDC, you're looking at all the different tools. You're looking at the RHIS strategy as well. But I don't know how much we're working with the country visits, so we can examine that further. But I want to make a point with the SCORE package. The SCORE package has a set of tools for using routine health information data and for analyzing those data. What the struggle is that when funders come in and donors come in, they fund HIV, they fund TB, they fund malaria. They don't fund the integrated maternal newborn child, adolescent health, across to do routine health information systems. So even with the SCORE package and the different guidances we have in those different areas, the ones that have more funding are probably moving more forward and being able to look at individual level data and so forth. And we're stuck still with the aggregate level on data. So that we really need to look across at who is funding what and how to do a more integrated approach. We try to align a lot with USAID and their partners. But we also have GFF and Countdown funded by Bill and Melinda Gates Foundation that may be going sometimes in their own direction. And they do a lot of capacity building for using routine health information systems, but it's to analyze the data to look at coverage And we're taking a different perspective of using the data at the district and facility level to make program changes and not so much to do the calculations of coverage. So we also have to ask the HDC what kind of capacity building workshops or materials we have and in what direction, based on what the country need, what is it they want the capacity building for. So I just really wanted to kind of bring that all up to, so everyone can really start looking at routine health information systems and HIS instead of just GIS and CRVS, because that is the #1 demand that's coming, at least for my group right now. And that is the most important thing and basic thing to be in place should a big, huge pandemic or emergency or anything come in the future.
Well, thank you very much. Munya, let's go back online or check in with our online participants, see if there's questions there. Okay. Just a quick time check. So we're at 11:30, 11:40. Yes, maybe before we go on to your question, I just wanted to check in with our meeting hosts and organizers on where we're at with agenda schedule and what we should be mindful of.
So my personal suggestion would be, because this is a kind of critical piece of thinking, we need your inputs. I would suggest that we extend the time for another 20 minutes and we go at least till midday. There'll be opportunity, obviously, for people to contribute online, email afterwards, but now's the time to kind of give verbal inputs into what we presented. So if we extend it for another 20 minutes and then we continue with the next session at midday, which is the comms and advocacy strategy and hopefully the website, that would be good.
Perfect.
Well, Craig and team, looking at your presentation, you really have a challenging job. The entire team. It's really eye-opening. Building collaboratives is not easy, right? And I think, and I don't know if it's a question, but just kind of some thinking that what we're trying to do is have a collaborative at the global level. That's sort of somewhere managed or secretariated by you, but also help build these collaboratives at the country level. The stakeholders, partners may be different at the two levels, but and all of that needs to work together. The global and the country needs and priorities needs to come to the working group. The working groups can support academia. So, that's kind of, it needs some kind of a network of networks that really needs to come together and work. Thank you, sir, for handing this over. I just looked at this map, and this is just an example of having all the partners mapped and having responsibilities assigned. I think we really have to look at a mutual accountability sort of, it's not you, it's not us, it's not me, and we all have to, we are in it together. And what I'm really hearing is, be it UNFPA, be it Gavi, be it Global Fund, USAID, that I think we want to change. We want to do something more important, and at the broader level, RHIS. So we really have to challenge ourselves again, that we can manage the collaborative at the global level, support countries in managing the collaboration at the country level, have common investment frameworks, strategies that are aligned, gaps identified for capacity, for funding, that we can pitch to donors that, hey, USA, do you have money for that? Hey, Gavi, do you have Global Fund, UNFPA? So, that sort of and it's not easy, I totally understand. But if that can be set up as a model in the next year in the 3 to 5 countries that we are planning to get to, I think that will be a big achievement, and totally acknowledging that it's not easy, but we have a challenge in front of us. And again, I go back to 800 years of experience in this room. So thank you.
Thank you so much, Vikas. Do we have any other hands up? Yes, Ben.
Thank you. I had a question, actually for you. I apologize. I didn't get your name. You, yes, thank you. I had a question for you in regards to the topics that you're seeing. So a lot of the topics that you were discussing were actually, they're very tied into data governance, actually, and data governance systems. A lot of these systems are very, very difficult to disentangle from each other right now. GIS less so, but some of the systems are becoming quite entangled. And I had a question for you in regards to, is it possible to, I guess what I'm wondering is it possible to manage these different topical areas in a more connected way, as opposed to disaggregating them so specifically? I'm just curious. Thank you very much.
So when you look at this, the score package and tools, you have the overall and how to do the quality, and then you have the different disease specifics. And we had in the past tried to do things like for our module, we had to take from the others as well, so that you're always making sure if you're doing HIV in children that you're analyzing them the same way. But within WHO, and I said that we have to just kind of be more aligned, because if the investments are going into the HIV and they learned how to do individual patient records and individual, then we should be kind of following the same pattern. Also, when going down to the alt register level, we shouldn't have HIV specific, right? I know I used to work in HIV, right? But it's, you know, it's the person, right? The person is not just one disease. So we have to start from that level. We're trying to make registers now that are patient registers. I mean, in high income country, you have your own individual chart, but that is kind of the other way we have to go. But the investments come from disease specific donors. And so it's difficult in that respect.
Okay, now I understand what you're saying. I'm so sorry, I didn't have that piece. So is this analytically mapped anywhere where the RATC could look at it and take a crack at how we could address this? Because this is addressable. It's just a matter of understanding how it's mapped.
Well, there is a working group, right? Your RHIS working group here in HDC, and you could ask for that to move forward.
Yeah,
I would imagine.
I think we should try to facilitate that somehow, because I think that this is a problem that can be solved with some good research. I really do.
Just on that, all these resources are going to be demonstrated on the website in a few minutes, so that you know and so you can see them, and there are living documents. So like some of them have already been revised, some of them are still being revised, but I think a lot of the questions coming up, I think, are going to be handled a bit by the resources being more accessible, because they've been very obtuse to find up until now.
Anne had something to say.
So I'm Chu from DDI DNA. So I'm also on the HIS and the routine, and that's linked to what Teresa said. We have this concept of bringing the different routine data that supports different programs, but at the same time, the common data should be pulled together for the health statistics for the HMIS. And concept is to build it on integrated data platform. And the future, we should also link with the facility management, some of linked to the stocks and others, or the very basic, and immunization has done that. So they have a stocks, they have some of the cold chain management that is integrated. The issue here is that I'm very much with Teresa, and I have raised it and also reflected in the score. Those programs are well funded. They get that. Those who don't. So we have now about 15 programs join these efforts. And I have to really praise and also acknowledge the efforts at Global Fund and Gavi, because they are the ones who support this initiative from the early stage. And we have TB, HIV, malaria, and immunization, and now also with the vaccine, vaccine safety also in that, the COVID is in that, the surveillance for vaccine preventable disease, that all in this package, and from WHO, so we are coordinating that across all different programs. 48 countries has implemented these packages in one single platform together with mostly because the DHIS team pick it up and then sort of standardize in the DHIS, so it facilitates the rollout in a much more standard and systematic way. But at the moment, what has been missing is those programs that lack funding. MCH, abortion is going to be next under sexual reproductive health. NCD, people already asked me. So this is so interesting because NCD would be the first NCD routine data from facility. I don't know how many countries will be able to implement this. Everybody say how important it is. Everybody say, oh, we really need this. Who is going to fund this in the same concept, the way the Global funded Gavi? Because it needs a lot of give in and also give up, because you have to sacrifice a little bit of quality of data that you are used to in order to have something to build the quality of data in the country by using it and pushing for it. And this has been a traditional work of Global Fund of PEPFAR in many of these specific programs. I think the three key points here. Number one is how we map all of that and put the country at first, as you said, where the country needs are, how we're going to do that. And I think score assessment can give some hints of it, but we really need to dig deeper. And this is where this mission coming in. But then how we're going to support the coordination in the countries. And that's another, I have been questioning it a lot, because when I was in the country office, this is one of the biggest challenges. Who is going to coordinate this work? Who is going to support the government of taking the leadership in pushing for this sort of new approach? And then the funding, the mapping. I just given a very good example of the rolling out of the COVID vaccine and the COVID surveillance, that all of that done in a very short time. And we had this small working group. We have a WHO and some of other agencies develop the standard and guidance on analysis and data collection. But then the funding come through Gavi and other donors. And within 2 months, all 20 countries that using DHIS was able to roll out the COVID vaccine. But then a lot of challenge going back into the country, how they analyze the data, how they push it back, because WHO has another mechanism for report. So again, data sharing, standard, interoperability, all of that question comes up and go back into the governance. So I think there's a lot of things that we can unpack, but the question is, we cannot unpack them all at the same time because every country is different. But how are we going to, this is where the mission can support and identify some common theme or common approach that we would be able to promote and to generalize it, to make it into some kind of guidance that country can adapt and adopt. But I don't think we can push a lot to the country, that we guide them and empower them. That would be a lot of room for them to use the data. And I think that's the next thing that we also discuss in the routine health information working group with the HDCs, how we're going to promote the data use at subnational level. I think this is another thing that would be able to enable the data that we have been collected for so many years, and there's so many of them in the countries.
Just to add really briefly, the data governance part, which is another thing, and data sharing within a country. The person who runs the DHIS2 will sometimes share it with other program areas. And so we really need to say, what is our standard recommendation in this regard, so that we can use it for different program activities. So just to keep that in mind as well.
Thank you so much. Anyone else who would like to? Oh, sorry.
So one thing I didn't mention, it's more of a kind of an update. So WHO is in the process of looking at what countries could potentially be prioritized for support for a range of different issues. And there are ongoing discussions in the regional committee meetings, which haven't finished yet. But there is a thinking that there may be in the region of 30 countries where there is actually much more of a data science innovation focal point in up to 30 points. I meant in up to 30 countries. And I'm mentioning that because that really would help strengthen our alignment between the 3 different levels of WHO and potentially extra support and resources for countries. They're being prioritized in a range of issues around UHC indicators, around fragility. There's a whole range of kind of discussions going on just now in the regional committees. But just to let you know, there's probably going to be extra resources available for up to 30 countries, specifically on science, innovation and data, which really helps us, and exactly what Anne and Teresa have been saying as well, the country impact and the country coordination. And that will have, I think, an impact on how you might want to kind of view which countries and how they get prioritized. So thanks.
Thank you, Greg. Yes, Maxwell.
Thank you. I think most of the things I wanted to say have already been emphasized, but let me just hammer in a bit on the importance of data analytics. We heard from Malawi yesterday about the outcomes of the mission and the work, especially with death registration and the difference between the use of the data from death and birth. And I think we should learn from that. And going forward, let's try and offer technical support that include how countries can create value out of their own data for decision making and also for policy making, so that it doesn't appear to some of the countries that they are working for a certain mechanism or some external agencies. But this is really about helping you to make use of your own data, either for effectiveness of your programs or efficiency of spending or of resources. I think let's embed a bit more of data analytics into the bouquet of offerings that we offer as HDC. Over.
I'd echo that, Maxwell. Anyone else? We have a couple of minutes before we end the session. Anybody online? Yes, Rachel.
We're just prompted by the last comment. It would be great if on the website or the communication you have those use cases where the availability of good data made a difference in a big way. And I'll just cite one that I like very much, which is, I think it's Togo, where they mapped all the emergency obstetric facilities, had all the population mapping, looked at that alignment, and this is with government, of course, and WHO and colleagues. And then the recognition was that actually they could probably have fewer emergency obstetric facilities and cover more of the population if they were simply relocated. And that government was delighted because that meant cost savings while they expanded coverage. And I've used it in a few meetings, and I mean, we need more examples like that, where very nice, intelligent use of relatively simple data, and suddenly you can have cost savings and better coverage. If HDC had a section on your website with use cases like that, I think it would help build our investment case on data, which sometimes is not sexy enough.
I mean, you've just chimed in on one use case based on what Rachel has just said. So an example is in Ghana. So they started analyzing their CRVS data. And of course, with all the partners involved, one of the outcomes is the inclusion of family planning in the National Health Insurance Benefits Package. But all these years, the data had been there, but the attention to it had not been that strong. So I think if we can build on some of these use cases, then it builds a strong sense of ownership at the country level.
Thank you. I think we have one hand going up online. Arash?
Yes, and many thanks indeed. Yeah, so in following the discussion on the strategies, one further area that I think we can emphasize more on the strategy, and HDC would be an excellent forum, probably the only viable forum to address that, is the issue of surveys that are supported for, especially household level surveys that are conducted in countries. To give a bit of background, this is available to all. Everybody knows the challenge and the opportunity, but to give you the context. So in our region in 2017, we tried to bring partners, UN partners, that they have programs for major surveys so that to agree that on a sort of schedule of surveys for countries rather than sort of different programs, sometimes overlapping in terms of timing, coverage, the surveys they do in the countries. Unfortunately, it has not been that successful, although that we have developed some national survey plans for several countries of the region, but the implementation is difficult if such agreement doesn't exist at global level. The other challenge is that, so let's say, UNICEF, UNFPA, WHO, UN agencies agreeing on their major surveys as a plan, but then there are also many ad hoc surveys that the major funders support in the countries. So, we see a lot of, issue focused surveys. So a survey on TB, a survey on malaria, a survey for sort of maternal health issue in country, or nutrition now becoming a very important topic. Many of these surveys that they can carry many more topics. So I'm suggesting that, a bigger focus in terms of agenda, sort of agreement on how to align such surveys so that if a survey becomes a need, how it can carry more topics, and also a bit of further notice on the issues of spacing of the surveys and minimum criteria to be more efficient. And this is something that much better can be done at global level among the partners, and then coordination regions and countries can follow on that. Thank you.
Okay, last call for, I think with that, thank you all for your valuable contributions, comments, etc. And we'll be capping the primary themes in the end of the day recap, I think. So we'll move on to the next session, and invite Rachel to move us into that one as the chair of the day. Thank you.
Okay, delighted. That was a pretty active session. The next one is with Deborah Jackson. I think if we can have Deborah and Vikas from Palladium here, and this is on, we're going to take some decisions again on the comms and advocacy strategy. And I think this is excellent the way it follows on this one, because I think we have a lot that we need to communicate more effectively in terms of mobilizing resources and needed structures. So over to you, Deborah and Vikas.
Okay. I'll give a quick. Is that one on?
No, it's on.
Okay, that's different from those. Okay, great. Moving on to comms and advocacy, which are pieces of the work plan, obviously, and important ones that we've been hinting at over the last day and a half. So to start today, we're going to have 3 different presentations, and we're going to start with Alyssa Palmquist from the Secretariat, and I think there's going to be videos, and we're going to look at websites, all kinds of fun stuff. So there we go, Alyssa.
Thank you. Thank you so much, Deborah. Actually, before I go into the presentation on the strategy itself, I want to invite Anshu to say a few words. We actually have a launch today, in fact, of the DHIS2 hypertension package, and they've shared a quick video to promote that. So Anne is going to say a few words, and we'll play the video and then move into the presentations. Anne.
Thanks, Elisa. Just I was hoping that with the colleague from the team, the mobile team in Oslo, and Resolve to Save Lives to be online to talk. But just a very quick, and also this is an example of what we discussed in the previous session. So this work is done between WHO, Resolve to Save Lives, and the University of Oslo, together with the country office in Nigeria, Bangladesh, and now Ethiopia, and some states in India have joined. But the idea is that under the big umbrella of the NCD routine, primary health care for routine data for facility, there is one condition, which is the hypertension, that Resolve to Save Lives has been supporting several countries at primary health care level. And then we work together with the University of Oslo, because there are 2 things. Number one is these countries use the HIS2 as an integrated health information platform. Number 2 is that Resolve to Save Lives also have another app that run independently in the facility, but didn't have a database to push the data in. So the idea is to do a proof of concept of interoperability between the different apps into the DHIS and how the country can implement that. So one country use 2 apps and then the other one just use DHIS2 with the mobile app. And so this is an innovation, and the data collected through this app will be feeding into the big picture of the NCD. And if this concept work, we can also use that for other conditions in NCD, and that would be depending on the country and give the country the flexibility to choose and to adapt. So just a quick video and just a quick word on that. A big thank to the team from Resolve to Save Life and the mobile app team in University of Oslo, as well in the country office, has been really supporting the whole implementation, the testing, and now it's rolled out in more than 100 hand facility in Nigeria. And Bangladesh has pushed it into the national system. So it's quite a lot of work going on. Thank you.
I'm a health practitioner. I love treating people. Seeing them in good condition is a thing of joy to me. On the average daily, I care for over 80 patients. 5 to 6 of them have hypertension and they do not know that they are having it. High blood pressure is manageable if there is early detection, prevention and proper management.
In 2020, mo kàn rí pé mo jí láàárọ̀, ṣáàrí gbára mi ṣe sùẹ̀, oúnjẹ ò tún lọ lẹ́nu mi, ìyá ìṣekù, àfi kí n lọ hospital òkè mi wò. Nígbà wo lọ́dọ̀ hospital òkè, dọ́tọ̀ wa ní kí n la ṣe ìfúnpá mi wò níbẹ̀ yẹn. Nígbà mo débẹ̀, wọ́n ní ìfúnpá mi ga o. Ó ṣàbúrò mi tó jẹ́ pé wọ́n ní ìfúnpá ẹ̀ ga hospital náà wọ́n yẹ̀ wò wọ́n gbé kinní sí nígbà ìyá oxygen ló fi mú kó lè dáadáa ó ṣàbà bẹ́ẹ̀ lọ.
The simple app that's just introduced to us is a very good thing. It makes our work easier and faster. When we are using the manual record, it takes about 5 minutes to retrieve patient's cards, and which we are wasting the patient time. So when they introduce the simple app, it helps us to retrieve the card within a second. We just take the patient's name, type in on the system, and it will bring all the information about the patient out.
I would say 4 to 5 out of every 10 clients that visit, we discover that they have high blood pressure of various degrees. Part of the problems with the manual filing system, you need multiple personnel to handle that unit. Okay, the DHIS tool has actually helped us to tackle most of these problems.
Prior to using DHIS2 was that thing where at the end of every month, every facility has to collate the records. So how many patients did we see this month? How many patients are started on treatment? They had to manually do this count. But with an application, it's pretty seamless. You're getting data from the app directly real time on the dashboard. DHIS2 has several advantages. One of the advantages is the fact that it works offline first. The fact that it works offline first is great because it means that the healthcare workers can capture patient information without access to the internet and save on their mobile device. And when they get to an area where there is internet access, they can synchronize to the main server.
Because we know that we are in the 21st century and anything that we do digitally, tends to have a good output in terms of result. Using DHIS to capture NSCI data, is something that we need to also, maintain and also ensure that we extend it in all our other service areas.
Since we've commenced the use of this DHIS app, it has helped us tremendously in our record keeping.
The new system, most patients love it because when they come to the hospital, within a second they have been attended to and they have gone already.
And it's World Hypertension Day today, and that's why we introduced this one.
Yes, today's World Heart Day, so we wanted to just take a moment to acknowledge the app and the collaboration and present that at this meeting. So thank you, and thank you for the chance to share that video. And now I'll ask Monia to just share the screen. So again, my name is Alyssa Palmquist. I am with the HDC Secretariat, as well as sort of overseeing communications and advocacy for the data analytics team at WHO. So I was asked to sort of come in and help support building a zero draft of this strategy, which is, I'll say from the outset, it's a skeleton, framework document. It's meant to really drive discussion and spark ideas. And this is not something that should be in any way, unilaterally produced. This needs to be a collaborative document in order for it to work. And so part of the sort of purpose of the discussion today will be to just outline what is in the document and, take some questions and some reflections. And outline sort of the timeline and next steps and where we go from here. So I don't know if my video is showing. Oh yeah, it's on the screen. All right. So yeah, I'll just next slide, please. So I hope you've all been able to access the document. If not, it's in the Google Drive under session 5. And as we mentioned earlier, this is one of the 4 key strategic shifts that has been identified for the HDC, including increasing diversity, scaling up regional platforms, country coordination, and the investment case. So this really is one of the pillars of what we want to achieve with the HDC strategically. So next slide. So again, just coming to the overall purpose of this before we dive into the details, has been mentioned several times already today and yesterday. We have, I think, what was it, 800 years of experience in the room, which is an amazing figure. And I think how we communicate that, to a wider audience in this room, we understand the value that we all collectively bring to health information system strengthening. But I think, as we go forward, how can we raise the profile of the collaborative among technical audiences, but also among general public? So this strategy is kind of two-pronged. It looks at, audience stakeholder prioritization, core messaging, both for technical audiences as well as a broader public audience as well. So again, really building an effective communications and advocacy, it's really crucial for the ongoing success and scaling up of the HDC, as Craig was mentioning, and how we want to increase the countries and the number of organizations that join the collaborative. Of course, within the collaborative itself, the members do come from a wide range of backgrounds, and we can all, I think, benefit from a more structured approach to how we represent the HDC, how we speak about the HDC within our own networks, within our own organizations. I think yesterday there was a comment and a question in terms of when do I represent myself as the HDC versus my own organization. So these are all points that we can be, discussing. There are great opportunities to scale this work if we do it, strategically, and we make smart decisions. We leverage the network of networks that we have in this room and the channels that we all have within our own organizations and our own personal networks. Part of that is identifying key moments throughout the year. If someone is speaking at a conference, if somebody has published a paper, if there's an event happening in a country, how can we leverage that moment and really use that to promote the work of the collaborative? So another part of this will be really mapping out, what are the key events throughout the year that we can add to sort of a calendar of communications. And then another part is sort of building a toolkit, so a core package of resources. I think there's been a need identified, Craig, of need of an elevator pitch. How can we, again, just sort of pitch the HDC in a very clear, concrete way, avoiding jargon. I know it's hard, but avoiding jargon, and have a toolkit, a flyer, a one-pager, core messaging that we can all use and really use that to scale up. Next slide. So in the document itself, we have sort of the different sections that are laid out. So we've gone through the background. And then actually in the first section, I pulled together some of the materials that had been developed for the leadership event in December 2020. There was some really great content that was produced for that event. You know, we have the thought leadership video that was done, the data collection, data analysis videos that were done, the stakeholder interviews that were done. And, you know, I don't want that to really go into a black hole. Like, that is amazing content that we can continue to use and we should be using going forward. And I'm excited for this new website to be launched. And you know, how can we feature some of these videos, for example, on the website, along with, of course, country case studies, as was mentioned. So this document just has a quick recap of, you know, here's what's actually already been done. We're not starting from zero. We're not starting from scratch. Like, there already is a very strong foundation. It's just about having that be more sustainable and not having an event happen and then lose all of that knowledge that was produced, the content that was produced in that event. So I think definitely we should continue to be using those materials and updating them as we move forward. And then, you know, the theory of change, which we discussed yesterday, has been updated. That's also in this document, and that should be always referenced within any conversation about comms and advocacy, going back to that theory of change and what we want to achieve with the HDC. The target audience and stakeholder mapping, the map that you showed up earlier, I think is a good example of this. So one of the first parts of really operationalizing this strategy will be to map out the different audiences that are involved within the collaborative, as well as categorize them. So not every audience is going to have the same level of engagement. There will be owners. The owners would be the people in this room. There will be drivers. So who are the sort of quote unquote HDC champions within countries that are going to be driving this work with the direction of the SRG? Who are our influencers and supporters? You know, high profile, you know, people who can mention the HDC at an event, talk about the HDC in their own networks again, and then the end users. So the health facilities, the health community workers, the clinical staff, the administrative staff, practically, as Craig says, at the sharp end of this, how can this be, you know, used at that context, and how can they be supported with comms and advocacy as well? So again, just to recap that, so mapping out the audiences will be key. But it's not just a list of groups or people. It's actually thinking about what type of audience are they, and then what type of messaging can we use for that particular audience. So once we've done that stakeholder mapping, the next step is to then look at the actual messaging architecture, the key messages, agreeing on the key message, agreeing on the elevator pitch. This can be hard. You know, I've been in meetings where we've gone around for hours trying to develop a core message, and it's hard because it's hard to capture everything that we do in 2 sentences, but it is important. And you know, there are ways we can work around that. We can have a, you know, very short one, we can have a longer one, we can have one for internal, one for external, etc. But agreeing on that key messaging will also be an important part of this. And then going into more of the sort of operational pieces, activities, the tools, the tactics. I hope you all follow the HDC Twitter account. If not, please do. It's we've been tweeting actually a lot this week. We're trying to build up the following. We only got about 300 people following that account, so really an opportunity to increase that. Again, if we can get some retweets from executives, from, you know, political leadership within countries, that would be amazing to just build that visibility. And so I've laid out some of the strategies that we can leverage. Hashtags, what hashtags can we use? What topics can we follow? What groups can we follow? Of course, the website, Owen will be taking us through the updated website soon, and that's going to be another amazing opportunity to present the Health Data Collaborative to our external stakeholders. And then branding and visual identity, you know, we have a strong logo, but, you know, what other elements of branding can we think about? You know, even things like a color coding or color, you know, representation. We have the PowerPoint deck here, which is great. What other templates can we develop for use from the collaborative? Social media templates, one-pager templates, document templates, all of that can be part of that toolkit that I mentioned earlier. And then really, get drilling down into the work plan. This is kind of where the rubber actually hits the road in terms of who is going to be helping lead this work, what resources are required, what financial requirements are there. This will require people within the collaborative to work on this, and that's something that we'll be discussing in the latter part of this presentation. And then finally, KPIs, key performance indicators. How are we going to actually measure this? Things like website visits per month, growth in followers. We want to have this actually be a successful plan, so we need a way of actually measuring that. I'm sure everyone in this room would agree with having some KPIs around the plan. So that's just the basic framework. Again, this is a zero draft. So if you have other ideas of how this could be laid out, what's missing, something that doesn't need to be there, this is completely open for discussion. Really just meant to spark, like I said, spark the conversation. So next slide. In terms of next steps and timelines, so today we have the zero draft. We will be asking for volunteers to come forward from within the collaborative to conduct those activities, to do the stakeholder mapping, to hold a workshop on the core messaging, and start to gather some more feedback. And again, I think we'll probably use another survey of some kind to gather some additional inputs on that piece. Our goal is to have sort of V1 by November or December of this year, which reflects the additional inputs from across the HDC. And that will be presented at the end of the year. And then that will be followed by sort of the initial work plan implementation, starting from November through the senior leadership meeting in March of 2023. And then at that senior leadership meeting in spring of next year, we can use that opportunity to reassess the progress, course correct as needed, look at what's working and what's not, and continue to refine this. This is meant to be a living document. It's not meant to sit on a shelf somewhere. So it should be continuously updated and reviewed. I would say ideally quarterly, but at least twice per year. This should be continuously updated to reflect the latest information. Next slide. So I think we'll move into if there's any burning questions on that piece, but otherwise these were just some of the discussion questions that I wanted to put to the group here, just to get your reflections right off the bat, what resonates, anything unclear, is there someone, audiences, we can already start that conversation, who's here, who's not, in terms of what's in the document. What are you excited about? What are you concerned about? This is definitely the time to raise those points as we are in a very early stage of drafting this document. But of course, I'll remain engaged with this and help to take it forward. But, again, we will need people to sort of volunteer, ideally, again, from at least, I think, every constituency. We'd love to have representation across the board to make sure that this is owned across the whole network and reflects the needs and priorities of the collaborative. So I think that's it from me, but I'll open the floor to any questions or comments. Thank you.
Okay, so questions, comments. I'm going to use my prerogative as chair just to make a quick comment. I'm not sure why we would expend resources for the general public at this point. I think our internal constituencies we've already identified that we need to reach, and the data people and the policy people and the government, private sector, all of those, that would be my preference. But obviously others might have. And we had a comment in the back. Make sure to use the microphone. Thanks.
Just a quick question. Is there a LinkedIn account? Because I've definitely seen the tweets, but I feel like at least the way I use social media, LinkedIn would be a better venue. I use Twitter in spurts, potentially even Instagram for pretty shiny pictures. And everyone uses things differently. Most of our posts could be cross-cutting. And while, yes, I feel like we should target primarily our constituencies, but also just other colleagues, people who work in the data space. And many of them would, I guess, fall into the public, not necessarily the layperson on the street. But as we're trying to build momentum and try to better marshal our resources, at least for me, I think LinkedIn would be a more helpful venue to at least repost and pass things on. And as we move forward, thinking through, like every time we have a webinar, making sure that whichever social media platforms we all use, that we can just repost, retweet. And if we do, I guess once these are all up, or if we all start using them more, then if there is just more regular tagging, so it is a little bit more stupid proof, so we get tagged and can just repost and share with our networks from there. I think that might make it a little bit easier and help raise the profile.
Absolutely. There is a LinkedIn. So it's actually in the document under the tools and tactics. So at the moment, there's a Twitter, LinkedIn, and a YouTube channel. We don't have a presence on Instagram or Facebook, but that's something that could be explored. And yeah, I mean, definitely, I think, again, like key, like tagging accounts that we can have a repository of, like accounts that can be tagged at strategic moments so that you can just retweet. We want to make this easy as possible, right? Because we want people to actually use these and engage. And if it's difficult, then it's harder. So yeah. Exactly. So for sure, anytime there's a webinar, we'll tweet from the HDC account or from the LinkedIn, and then, everyone can be sharing that and retweeting it. But I would say, with Twitter, LinkedIn, YouTube, Instagram, Facebook, coming back to the resourcing, that is a lot of work for someone to manage those channels, update the content, respond to things. So might be a discussion at some point in terms of, do we need a dedicated resource? Yeah. But just, it requires some coordination and some time of somebody. So,
Okay. Go ahead.
I'm a little confused by the purpose and audience and maybe a little, I'm sorry if I'm late to the party here on this one. What I like about the HDC website as it is now is because is the documents. I mean, maybe I'm more technical person, but I'm going through, whoa, nice, Deborah, you got this one. I see learning about digital. It's this technical material that seems, at least that would be a reason I would return again and again and go back to a website like this on the HDC. I want to see what are the new products, what's the thought leadership that's coming out of this experience and this group. So, but in the presentation you just made, it was much more about, seemed to be, here's who we are and we exist. And so, but I'm a terrible media person, so I don't really get that if it isn't linked to, and this is what we offer that has technical value for this, for the world. So can you make the link between the presentation, which seemed to be more on name recognition and identity of HDC exists, and how that links and moves the technical material to countries and other experts? And if so, because then it's going to raise some other questions about whether you link laterally between agencies on technical material, and there's a tab that takes you over to what USAID or the London School or Malawi has just done on CRVS. And like, is it meant to be also that kind of a, what's it called, like an information hub where you might get into the added value of this many really compelling countries, ministries, and experts, et cetera, in the room, in the space? So I'm a little confused on the purpose. Over.
Okay. I'd like to comment on that as well. I think when we say we're the HDC, the we is not the HDC. It's the collaborative. It's all of us. So it went very much to what she was saying, is that it's more about how can HDC amplify the work that that all of the collaborating partners are doing, as opposed to, which still comes back to the question of how do you promote stuff as the HDC or as the individual partners. But I would see HTC as an amplifier. Obviously, there might be parts that have come specifically through a working group who'll hold a webinar to launch their stuff. But even then, that's not really HTC. That's, it was UNICEF and WHO and Vital Strategies doing something. And HTC was happy to amplify that for those three agencies. So I think that's a bit of the disconnect I think that we might be hearing in the comms. It's how can all of us use HTC comms as opposed to HTC as a face in and of itself.
No, thank you. Those are important points and very valid points. I think this is some part of what we need to hash out. I'm coming at it from a slightly different perspective, maybe of people don't know about the HTC. How can we increase the profile? But you're absolutely right. The HTC is a platform for promoting the work of the partners, and so maybe we're not necessarily using the HTC Twitter account as a primary channel, but maybe the HTC can retweet content from partner channels. So something like that. But it's absolutely valid points, and I think we can discuss how best to use that. But we want to grow the collaborative as well, right? We want more partners to join, so maybe they don't know about the HTC or the added value it has into the website. I think we'll have a demo of the website, and there will be, of course, the document repository section, but I would love to feature country case studies, profiles, linking to different partner content from that too. Yeah, Chris. Oh, there and one there.
Thanks. No, very helpful presentation, and just a few observations also, basically from the SDG 3 Global Action Plan Secretariat. Equally an effort to align partners, a more narrow set, but the multilateral agencies, and sort of probably struggling with similar questions on, how do you use the communication side? And I think from the presentation and discussion, I see there's clearly one aspect is this knowledge platform, what's happening on data and making that easily available for everyone to use. There's also always in the discussion coming up this aspect of, what's the value of closer alignment? And I think that needs to be something which also gets featured somehow. And I think on that we had this number of examples also, then linking it, what's the value of data for SDG acceleration? No? All our agencies are somehow focused on helping countries, or the countries are focused on achieving the SDGs. How can data support that? And then what's the added value of better alignment, better collaboration in the data space to help countries get there? And I think these are all elements which need to be covered. But what we're doing on the SDG 3 Global Action Plan website, and they have the progress report here, sort of a number of these case studies from countries, and Nepal and Kenya focus on data, and that's very much sort of work which HTC is doing. So we can do some certain cross-referencing using it on the different platforms. And I think the other aspect which needs to come out clearer, and maybe that's a thought for a leadership event, is also focusing that on, how does data support the achievement of the SDGs? Also keeping in mind that next year there will be a big event on UHC, high-level meeting at the UN. There will be the next SDG summit where basically world leaders take stock on where we are halfway on the SDG agenda. And of course, the picture is not good. So any aspect which can help accelerate progress, and especially the use of data to better target interventions and help countries move forward, will be quite powerful.
So I think just a description that Lisa was giving us and your reactions, I think the comms package is an opportunity to address all of the, so it's, the knowledge hub, but it's also what is the HTC about and doing. And I was intrigued by the one-pagers or the elevator speeches, because even I would say with Zen, maybe you'll agree or not, but in our organization, there's a lot of like, what is the HTC doing these days? Like that. So having that at the ready to respond to and promote the work of this group is important as far as products. So I wouldn't keep it too limited, but try to capture all these things. The general public versus not. It's a little balance there. I think a little bit of, general public promotion isn't bad either, because that's where you got your, some of your stakeholders too, and like that too. So I wouldn't completely shut them out, but that's for more discussion. Over.
I think there's something I used to always say to people, especially when HTC started, and people would say, well, I think the HTC should do this, or I think that, and I was like, well, but you're the HTC. So if you want to do it, step up and do it. And I think that's something we also have to remember is that, that, like I said, HTC is to amplify, to bring us together. But, so the same thing for comms. If you have something you want to get out, HTC is one place that you can send it. I'm sure that you have your own channels and other affiliated channels. But I do think to remember that it's what we want to do, and not that we love what Craig wants to do. Okay, any other comments on this before we go to the website? Oh, go ahead, Vikas, and then you can move on. Go on. Yeah.
Thank you. And again, a very challenging task ahead. And I think, listening to the conversations and the presentation, there's definitely, again, the collaborative, right? And that's essential at the global level, at the country level, and how we can really, highlight the importance of that collaboration. I think that could be a key message that comes out of HTC, and the contribution by partners. It's co-branded, it's all hashtag, so everybody gets the credit for it. HTC is just a platform to be able to do that. And I think the key aspect in all of this is, Rachel, I'm the second person to say this, but to make data sexy. Right, that is the heart of the matter.
I think we have a new tagline.
Sure, go ahead. I'll retweet it again. Let's make it sexy. Let's make it attractive for the Gavis and the global funds. If the USAID, if the money is going down, why? Or just to use data, right? So I think that is the heart of the matter that we really need to, we are together in this room, and we really need to sort of, continuously hammer on and make that better through analysis, through GIS, through data use, and make it useful for improving, health programs and achieving the SDGs. So just a thought. And with that, we'll move to the demo of the website. Is that you, Moina? Please take it away.
Thanks. So I hope Owen is with us online. There you go. Owen, over to you.
Hello, yes. If we could go to I've got a couple of slides and I'm going to need to share my screen, but if you could go to the next slide, please, Moina. So just a little bit of an overview of the kind of work we've done. We obviously had quite a few discovery workshops and interviews which we undertake, so some of you might have already talked to me before. We did quite a bit of analysis on how the website was being used, looking at Google Analytics and event tracking and things like that, just to get a picture of how people were using it. And a big part of the work was just to review the content architecture, the structure of the website. We were very motivated to simplify it down and give the site a lot more focus. So I think that's one of the things that we've been successful with. And also we've done quite a bit of work on the taxonomy of the knowledge area. So we've introduced a new taxonomy that has been a collaborative effort. Wendy, if you could go to the next slide for me. So what we've actually delivered, we've updated the design, and this has been an evolution, not a revolution. So we haven't just thrown away everything. We've tried to keep it in keeping an on brand, but we feel we've given you a very good modern looking website. The content management system has been updated and patched. The new website is much more performant, it's faster, and it's also much more secure. It's going to work very well on cheaper Android devices and in low bandwidth areas. So it's a very performant website. As I mentioned before, we've really tried to give the website a lot more focus. There's been a lot of reviewing of content and how the website's actually structured. A big piece of work we've done is we've expanded the knowledge area. So we've incorporated in a large knowledge repository of documents and resources from RHIS, and also some further HDC resources that were living outside of the website. So all that's been migrated into the site and been applied with a new taxonomy. And the interface for the Knowledge Hub, we've also tried to improve as well. We've brought in multi-select on the filtering, which you really have to play with really to understand, but I'm hoping that you'll all get a chance to do that over the next couple of days. And before I actually show the website, it's worth noting that the website is not finished. Websites never are finished. The idea is this is a platform to promote the HDC and do all those things that you've been talking about. There's also been some talk already I've heard about case studies and use cases. All that's going to be really great content that we want to put on the website, and there's a place for it there. So any ideas and feedback once you've had a chance to review the website, that's all really welcome, because this is an ongoing project and we're going to hopefully be improving the website and adding more content and features in the upcoming weeks and months. So I'd quite like to share my screen now. So Mwen, if you can stop sharing for a moment. So hopefully you can see that. I'll be quite quick. The website's actually going live today. It's getting pushed live as we speak. It can take a few hours to propagate throughout the web, but I think that if you check the URL in an hour or two, you should see this new design replace the current website. If you still see the old website, that's just because it's been propagated through, but I'm sure in the next couple of hours, it'll all be there for you to take a look at. So as you can see, we've updated the design quite a bit. We've simplified the navigation quite a lot. It's much more succinct. We've also introduced these drop-down menus into several of the areas, which hopefully means that it's just a bit more efficient and frictionless of people trying to find information and content. We've really simplified the homepage and tried to give it a lot more focus and just have really clear routing into the areas which we think are going to be important for your users. I mentioned that you have an updated, quite powerful content management system. The structure of the website can be changed quite quickly and efficiently without any development work through the CMS, so we can make quite reactive changes if we need to how this website is structured. So again, feedback is really welcome. We've got a partners page where we're listing everything out and we're listing all your partners. I'm just showing a few pages just to show you the kind of extent of the website. We've maintained our country pages, which all have documentation and priorities, etc. And some country pages also activities and milestones, which we've represented in this kind of timeline. We have the working group pages all still there. We've also expanded out the documents, and all these documents also link through to the knowledge area. But the meat of the website's really been the knowledge area. So if I can go over to that here, which is over here on the right here. So obviously I've mentioned before, we've incorporated more data into this knowledge area, and we've tried to work quite a lot on this taxonomy down here. So this taxonomy across the right, this is how you filter and engage with the content. So you can multi-select now, which you couldn't do before, which is a little bit restrictive. So you can select different kind of taxons on this taxonomy, and I'll just choose another one just randomly down here. And it kind of drills down into it reduces your search results dependent on the filters that you're activating and using. And because it's multi-select, you can do different combinations of filters to really reduce down the amount of documentation resources you're looking at. And hopefully it means that through the multi-select, you can kind of cut the resources in different ways. So we're really hoping this has been quite a significant improvement to the previous websites. And we've done a little bit of work on this user interface to try and make it super clear on how it all works. So that in a nutshell is the website. As I've mentioned before, next couple of hours you should see it live on the existing URL. I just want to stress again that this is an ongoing piece of work. So new content, these use cases that have been mentioned, all these things we really want to be able to publish on the website and, you know, align with the communication plan that Alyssa's talked about and join all those dots so that this is just another piece of your communications plan that's aligned with all the other communication activity that you're doing. So that was me in my very short presentation. Happy to answer any questions that any have or any comments.
Okay.
Great. Thank you. I do see a couple of hands up, but I think in the interest of time, what we're going to do is we will move to the data leadership event. Craig? Okay, and then we'll take the questions together.
Yeah, so we're going to presenting these three issues together because I think that they're all connected, and we're going to then generate questions and really get your feedback. And just for the communication advocacy strategy that Alyssa presented, we're really looking for, you know, a group of volunteers, the constituencies that can support ourselves and kind of taking the draft from zero draft on to the next stage. So really it's an open book and it's your book. And same with what Owen was saying. I mean, the website, we need your feedback, especially the next 2 months to get it right. There'll be some glitches, as there always is. We need your feedback. So the next bit we're just going to present on was just some ideas for the leadership event, and it's just one slide and it's still at the conceptual phase, but we need your feedback on what that might look like. So we've heard a lot of feedback over the last year really on prioritizing investment in health information systems and the necessary links between the technical work and the political advocacy that's required to get investment. When I say investment, I'm not just meaning bilateral donors, and I'm not meaning the Gavis and global funds. It's investments by not only the bank, but ministries of finance. So we're looking at some sort of leadership event. We've had two in the past, and I would say that, as I said, the one in December 2020 was obviously virtual, and then there was another one in the Data Governance Summit, which was different. But with this event, what we're thinking about is that they've got to be very clear with the reasons why, and I think we're thinking along three main reasons. One is, and we need your feedback on this, one is to kind of piggyback on the end result of the Data Governance Summit last year, which made the case for data being a global good and what that means, and there's a range of things to unpack from those messages that could be looked at. The other is actually looking at data governance and principles, and within that, the way in which data is governed and managed for health outcomes. And again, it kind of piggyback on the previous meeting in the Data Governance Summit, which kind of looked at perhaps identifying good practices from countries, what works well and what doesn't, specifically for data sharing, perhaps, and perhaps the data journey and breaking it down, but promoting that as an aspect. And the other objective might be really making the investment case for health information systems, so that, as we heard yesterday from our Gavi colleague, it's always that health information system investment is usually the first thing to get chopped off a Gavi proposal. And we know that. I mean, that's not just necessary for Gavi. How can we make it as what's been said, how can we make data sexy in terms of the political leaders and the investors as well? So those are kind of the three objectives that we're thinking of. Again, this is conceptual. We'd like to suggest that it happens before the next World Health Assembly, which is in May next year. There's been a fair amount of advocacy for health information and for data governance from different fronts. So we're trying to respond to that. And obviously Easter is a holiday. So we're trying to avoid Easter, but looking at around some stage in April, but before the World Health Assembly. So kind of perhaps mid to late April or early May. And in terms of kind of looking at a mixture of kind of in-person and online event as well, would have stronger links to specifically how can something like the HTC or partnerships or investing in health information systems, really look at accelerating the progress to the SDGs. So it's refocusing again on, as we merge out the pandemic, hopefully, a lot more focus on the 2030 agenda, given that we're only going at 25% of the necessary pace to achieve the SDGs. What can data specifically do to accelerate that progress? So we wanted to kind of put that on the table because a large part of it will involve advocacy. Some of it hopefully will engage many HTC partners at leadership level, and we need your support and your thoughts on how to make that work. And I think, you know, we're happy to convene and make things work, but we need your thoughts on it, ownership on it, and if we're going to engage leaders, we need to kind of get this right at the start, beyond the kind of conceptual stage, as we start to kind of think more concretely about it. So I think that's just it from me. That was the other part, the comms and advocacy piece we wanted to present and get your feedback on. Thanks.
Thanks, Greg. We can now, yes, we can do now questions or thoughts or suggestions. Remy, Chris?
Yes, thank you. So Remy from UNICEF. So on a leadership meeting, regarding target audience, I would suggest, because we discussed yesterday and today about scaling up, and also about involving more our regional offices. And Rachel mentioned the footprint of UNICEF, WHO on the ground. So I would suggest that as part of the target audience here, we make sure that we have colleagues from those agencies at the regional level, so that we can also, so that they are involved in the agency process, they understand it. And when we're gonna talk about scaling up, we have, you know, a critical mass of people that understand what is it about, and we can perhaps move forward quickly. On the website, my first point is about the design, because for me, the content, what I saw, the content uses only 1/3 of the width of the page. It's a bit small. I don't know if we can make it a bit bigger, because the way I saw it is not, you know, it's too small for people. And I was wondering about a restricted area for us, where we can go and perhaps, you know, access some information on the last CRG meeting, or when we could share some specific communication for our different groups. So for me, it might be important to have this restricted area. And internal, yeah, within the, you know, the web site. Thank you.
Great, thanks. Chris, and then Jean-Pierre.
Sure. Good. Thanks, Remy. Very, very valuable input. I'll let Owen comment on the first point about the design, but it's about the restricted, this backspace, you know, sort of area you're talking about. So two things. We're very transparent, as you know. So the SRG meetings, all the meetings we have, the notes are available publicly. So the general public can go in, see what we discussed during the last SRG, what was decided, etc. So apart from the Knowledge Hub, we're quite specific, and I appreciate, you know, Rachel's input earlier on. We're quite specific in having a Knowledge Hub purely for knowledge. So that's where you're going for technical stuff. That's where the data people go to. There is an area of the site, and perhaps when you see it live, you can play around with it. But there is another part where you can go to for these meeting notes and for these other background documents about the HDC and all this other stuff. It's also in there. And if you remember on the previous version of the website, we had tried to do this this backspace where people could come in and work collectively. The working groups could come in and comment on each other's work. And to be honest, it wasn't used quite simply. Everybody had a password and a login and could go in there. But very, 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 very few people, I think it was only Azza, to be honest with you, who used it. So for that reason, we said, well, maybe it won't be, you know, as needed or as useful in this particular, you know, version of the site. So hence that having been taken up. And I don't know if Owen wants to comment on the first point on the design. Thanks.
Yes, sure. The site's responsive website, so it will scale to the size of your device. So if you're on a mobile, it'll scale to your mobile. If you've got a smaller monitor, it'll scale to your smaller monitor. I was sharing on quite a large second screen, So it looks very spacious because we obviously cap the reading width of the line so that it just makes it more legible. So if you're looking at the website on your laptop, it will scale to your laptop size and will probably look like there's less white space there. So I think do look at it on different devices, check it out on your mobile, and if you think that font sizes could be a bit larger or there could be more effective use of space, then by all means please let us know, because all these things can be tweaked and changed, and we want to make very legible, readable website. That's our real motivation. So again, any feedback, but please do look at it on different monitors, because it is a responsive site, so it scales to the size of the viewport of your device that you're looking at the site through. I hope that answers that, but again, feedback's really welcome.
Great. So, okay, thank you, Owen, for all this this excellent work on development and everything. A couple of questions, and I'm afraid it's a little bit of work. The documents that you showed that one list of, it looks like it's basically the name of the saved file, and you have no idea what the document is, to be honest. So is it possible to replace that with the title of the document or the guidance, so that when the user comes in, know exactly what they're downloading?
Yeah.
And then the other question is, yeah, go ahead.
No,
my second question. Yeah, go ahead. On that first point, go ahead.
Sorry, yeah. So yes, completely. When we migrated everything across, some resources just don't have the metadata attached to it. So for every document or resource that's added to the knowledge area, there's the file name, and you can also add a human readable title, and you can also add an abstract. So for a few of the RHIS documents, they had titles and descriptions that you'll be able to migrate across. Unfortunately, there are quite a few documents that are just reading through the title. So that's actually going to have to be, and this can be changed in the CMS without any development work from us. You can log in, you can go in, you can tweak it, but it is going to have to be a manual job. Someone with
Right,
the
that's what I was
knowledge.
saying, yeah.
It's going to be a bit of work to go
So,
in.
right. So that's, I guess, for reflection and reaction from others in the room, what you think about that. The other thing for reaction maybe from the room is, I noticed with Kenya, the milestones were going back to 2018, and that seems a little passé, if you will. Do we want to be going way back then, or do you want to keep more current milestone achievements? So that's just another question or comment. But otherwise, yeah, that was it. Thanks.
Yes, actually, I have two points. One, it's about the communication and the branding of HDC. And thinking of what you have said yesterday, I think it's very important to have a communication towards the regional and country office of the different member of the HDC. I think that probably the mission may actually provide a kind of a confusion to have another layer in the alignment. What it's important, and I think a real problem, is that in country, the different representative of the different organizations are not talking the same language. So I think the alignment, it's that there is the same kind of message conveying by all the different agencies in the country, and that probably the real alignment should be done between the agency here at the central level and then communicated to the country offices, and that actually in the country there is already some alignment mechanism, and there has to be reinforced and not confused by another layer that the branding of this HDC may bring. So I think that in the communication we should emphasize this communication between the central level, I mean the HDC secretariat and all the different work made in the group, in the constituencies and so forth, to the different relay that we have in the different countries. I think that it's very important. The other point, it's about the website, and we have actually a kind of important conversation with you about the way to present the knowledge resources. And I remember, I don't know how it evolved. I didn't see it very well in what you have shown. It was very much connected to the name of the group. The resources at first, in the first design that we were discussing with you, was that the HIS working group resources and maybe the communication data resources. I think that we have to have something which is more general, because what we want is to have the countries going to a hub where they know that they will find the resources about the different issue that they have in data management. So I was wondering if you could maybe make a demonstration inserting just one document, and I'm thinking of the document, the HIS curriculum that was presented by Preti yesterday, and just to see if it's easy to find this document. I'm pretty sure that it's already there in your resources. Thank you.
Thanks, Jean-Pierre. Ernest?
Yeah, thank you, Ernesto from GIZ, and thank you for showcasing the website. I have one question, because currently the different working groups are working with Google Drive, and it's spread, I mean, all around the Google. Will be there some sort of synchronization with the Google Drive, or is it also thought to have a standard operating procedure with the working groups to upload it to the website, all the minutes and the presentation? Or what is thought here? Because I think that would be very helpful to have the central repository and not having a separate one on the Google Drive.
Just have a question. The website is going to be used by many countries. Can it be converted to other languages? And if yes, how many?
Thank you. Just a quick one. I was going to ask about translated content also. Events calendar was something else that we had talked about in the past, of having a sort of a calendar somewhere on the website with key events. So just wanted to flag that and ask if that's going to be part of the new website. Thank you.
Thank you. And thanks for the new website and all the work that went into it. Just on the photo, I couldn't see a reference there. Is there a reference? And has there been consent obtained for, from the people on that photo? We have in South Africa, protection of personal information and health information is sensitive, special information. And if we don't have, I'm sure we can get that. That'll be cool. And then, yeah, also tying in with some of the comments that the website is, maybe we should just revisit our objective and just get some realignment there to who it serves. So if a country goes in to see what I have and potentially from what's available, what I could use, which ties in with some of the comments that right now it's structured according to work group, which is not wrong because that's how it's been functioning, but just from a beneficiary use and need point of view, that would be, I don't know if that was considered, but I would like us to consider that. Thanks.
Thank you. Vidya?
My question is related a bit to Ernest about exactly how we will operate in terms of contributing content. So what the process looks like. And I was also going to ask about an events calendar, because our working groups hold a number of events. Through our members, we're made aware of other events. It would be fantastic to share them out. So in addition to that, I wanted to know if there was going to be an RSS feed or something like that, so we could, if we could be notified when new documents are uploaded for certain groups or countries or types of content or events. And then similarly, as we hear more about the process for sharing events or information, what that submission process looks like. Will we be contributing the metadata? Are we able to do it ourselves? Or is that going to be limited to a few individuals? Thanks.
Thanks, Vidya. So maybe we can pause there, and any responses to the questions or some of the inputs that have been asked for? Yes, go ahead. It's Owen, right?
Yes, yes.
Please go ahead,
So
Owen.
yeah, thank you. Just touch a couple of things. There is an events listing. It's currently doesn't have any events in there, but there is an events listing there that hopefully will be populated with upcoming events. When it comes to translation, there are Google Translate tools that we can very easily, with low effort, place onto the website, and that can be restricted to however many languages that are available, which is quite a lot. The issues we have with Google Translate, that it can sometimes not translate technical information very well, and it also can not do a good job with cultural differences in language. So if we were to implement Google Translate, we'd probably want to test that with native speakers first. Also, it won't translate your PDF content. So any resources like PDFs, they will have to be translated by yourselves or by someone else and then placed onto the website. So it's feasible and it's possible, and there are different ways to do it, but it would require a little bit of thinking. When it comes to RSS feeds or notifications, there is a simple notification system that we can apply to the website, which would require you registering to sort of sign up to certain areas of the website. You would then be able to specify areas in the taxonomy or the themes that you'd want to be notified about, and then when new content is published, you would could then get an email notification. So there are different, and also we can expose as an RSS feed the different areas of the website. So all that is very feasible, and it's quite low effort. It would take a little bit of exploration, but it's all very feasible. There was a comment about documents in different places, in Google Drives, etc. That's always going to be an issue. There's no real way to smoothly integrate something like Google Drive, so that if you put something up in Google Drive, it will also automatically write to a knowledge hub into an external website. So that might have to be a manual process of putting something up somewhere twice, which isn't great and is a bit of a manual overhead. So I'm not quite sure what the answer to that question is. When it comes to writing to the website and uploading content to the website, at the moment it's only content, the CMS administrators are able to do that, but again there are tools that we can apply on the front end so that anyone could possibly go to a form on the website and add their own events there, or update, add articles and documents themselves, and which will then automatically written to the website. Again, that's quite feasible. It's fairly low effort. There's a moderation question there, in that if you had a larger group of people being able to publish things on a public website, does that need to be moderated or checked by someone? So all this is possible, but I'm afraid a lot of it comes down to effort and resource within the HDC to actually be uploading things, moderating things, and producing and adding content.
Great, thank you. Any other time? Yes. Oh yeah, we're between lunch, right? And the social conversations. Sorry. Maybe we can do a quick round of last questions or comments, and then yeah.
That's what I was gonna say. It's now live.
Oh, it's on live. Whoa! Yay! 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 Great. Yeah, I know.
Because
Please.
just one note, I think that there will be a lot more thoughts on the website, maybe on the issue of LinkedIn. Now, for example, cannot find HDC on LinkedIn. Maybe I'm not typing the right stuff, and other things that we talked about. So I wonder, is there a way for us beyond the meeting today to provide some of the feedback? How can we do that? Because things will pop up as people go through the website, and really good suggestions that may not require humongous amount of effort on the developer side, but may actually be essential for making it really workable.
So yeah, Owen, it's a question for you. What's the best mechanism for you to receive feedback from the group?
I'd probably have to sort of discuss this with Mwenya about what the best kind of tool or process would be to actually get everyone's feedback back. So I think that's something that me and Mwenya and I would probably have to take offline and just discuss.
So maybe for now, if any feedback or suggestions can be sent to you, Mwenya, and then you can look at the resource requirements and time requirements and phase that out. So yeah, Mwenya will be the sort of receiver and gatekeeper for that. Thank you. Any more comments, suggestions?
Just a note that
Alyssa?
I added the links to the Twitter, LinkedIn, and YouTube channel are in the Zoom chat. So, thanks.
Great. Well, I guess everybody's hungry. Just two things on the event. I was just wondering that, and maybe you've already thought through this, if possible, maybe it can be hosted by a country or a couple of countries as the host for hosting the event. And the second was, it's kind of, I know we sometimes draw the line with there's no line, and also to make it sexy, I'm sorry, but it's data and digital. So can we combine that to bring the other, our colleagues in the spirit of collaborativeness, that it's all together now, data and digital, and we're working, there's a lot of paper systems, but there are a lot of digital systems as well. So how do we can combine and do that event jointly? That's just another thought. So last round, no more questions, suggestions, thoughts? Okay, thank you. Rachel?
Excellent. And my read on this is that we actually did get through entirely what was under this agenda item. So kudos to the facilitators. We'll break for lunch and then and we'll be back here at what time, Craig? 2 o'clock. Okay, see you then. Thank you.
Just a reminder for colleagues from the research constituency and regional institutes, we have a working lunch meeting, but we can take it 30 minutes for food if you wish. I know Pam has a call, so we can also choose to stay in this room or to move to the assigned room as you wish. We can just meet outside.
And lunch is just outside the door, okay?
It is room LAC 314.
And the afternoon session we're about to have now is going to be focused on an evaluation of the HDC, as I understand. And I'm pleased to turn over to Letitia and Joanna here to facilitate the next session. Please, over to you.
Thank you so much. So yes, welcome to our session. And what we would like to just talk about is decision and review and approve the HDC's draft terms of reference and draft evaluation criteria. So thanks especially for our online attendance. We see about 12 participants. So please, whenever you feel you'd like to make a contribution, raise your hand and we will provide you with an opportunity to do so. Also just to note that much appreciation to our secretariat for awesome preps. All the notes can be found in session 6 in the Google Drive. And so today we will essentially focus on the highlights. And how we will do this session is we will be having a short presentation of the terms of reference and evaluation criteria. And then we're going to open the floor and have a very lively, active discussion and also agree then on the next steps, high level. Joanna, you want to add anything? Thank you. Over to the presentation.
Sorry, you got my voice again, but I'll go as quickly as I can. So some of the background to why the HTC is being evaluated is that over the last couple of years, many of you fed back to us saying actually 2023 is going to be the midpoint between when the HTC was born and the SDGs. Could we look at refocusing, and how can the HTC perhaps be as fit for purpose as possible if it is to have a role for data for the SDGs, whatever role that might be? It might be useful to have an independent, objective evaluation of the HTC, looking back the way, but also giving some proactive suggestions moving forward as well. And the second reason why we're kind of putting it on the table is really post-pandemic and over the last couple of years with lots of people kind of working remotely, we felt very strongly that we needed to kind of refocus what our purpose might be and how we might function and what the impact might be. So a lot of the discussions that go on yesterday and today being evaluated a lot more in terms of robustness. So next slide. What I'd like to do is just quickly go through. You've all got, again, in the Google Drive, there is a draft version of the evaluation TORs. That has received some comments internally in WHO. We kind of reached out to some evaluation colleagues, but it's a zero draft. It needs to be owned by you as the HTC and make sure that you're on board with the different dimensions of the evaluation before we put it out as an RFP and have a group actually implement the evaluation as well. So I'm just going to talk a bit about the possible objectives, the possible scope and methods, and the timeline. And again, this is for feedback, both now and between. We're going to suggest the second week of November, we need feedback then, because we'd like to release the RFP certainly by them at the very latest if work is going to start in January. And then we're going to invite, there was quite a bit of interest and comments from the donor constituency. So we're going to hear from GIZ, who's going to present on behalf of the donor constituency on their thinking of the evaluation and what dimensions it might include. So next slide. So I think it's just 3 slides. So what we're suggesting, and again, the details are all in the draft RFP, the draft TORs, and please take a look. But in summary, the purpose is really by adapting and using an evaluation framework based on the OECD evaluation criteria that I think many of you are familiar with. It's regarded as good practice, and there are different criteria there. I'm not going to name them in the next slide. And the 2 principles with that. Could the group that's selected adapt those criteria to evaluate the HTC between 2015, when it was initially conceived, it was born in 2016, until December this year. So the evaluation period is really from birth until, I would say, the toddler years, which is the end of this year. And make practical recommendations to strengthen the HTC's potential contribution to 2023 to 2030, i.e. to accelerate progress towards the health-related SDGs. So that's the main purpose. We're suggesting 3 objectives. So the first objective is really to design the framework, design an evaluation framework based on the OECD criteria, which I've got my glasses on, but it's basically relevance, coherence, effectiveness, efficiency, impact, and sustainability. And if you go onto the OECD website, you'll see, I'm sure many of you are familiar with it, underneath each of those criteria are a huge number of potential questions to ask. You'll see in the back of the TORs, we're suggested actually there's an annex with questions that could be asked during the evaluation. And that's what also we need your feedback into. There's going to be some questions around these 6 dimensions that we could ask the evaluation group to look at. We just started food for thought in that annex, but we encourage you to look at the annex. What questions you would like the evaluation to look at, given those 6 different criteria. So the first thing that the group would do is come up with an evaluation framework that would then come back to the SRG, make sure that you're okay with it, and then they would start implementing the evaluation. So next slide. So what we're suggesting in the evaluation is there's 3 methodologies or 3 ways in which the HCC could be evaluated. Number 1 is specifically country specific contexts, and up to somewhere between 4 and 6 country specific contexts. How is the HCC engaged?
what have been the strengths, the weaknesses, and the different, potentially the 6 different dimensions of the framework in countries. So there'll be some country level work and in-depth engagement with countries. The second methodology that we're suggesting is a desk review of HDC background materials from its birth until now, which could be made available and could be reviewed and analysed by the evaluation team. And then lastly, stakeholder interviews from all the 7 constituencies, both at technical level, and we're suggesting leadership level, and also the HDC working groups and the Secretariat, with an emphasis on country and regional level. So those are the 3, I would say, kind of standard, you can call them cookie cutter, but kind of standard methods that we are suggesting for the evaluation. I think the main challenge is the logistics of actually organising everything, especially the stakeholder interviews and getting that organised. I think that's one of the main challenges. And the third objective is, having undertaken a thorough analysis using those 3 proposed methods, that the group would come up with some practical recommendations for the HDC to be considered by the SRG that summarise what their methods were and the analysis, both the quantitative and qualitative information that they might have got, so that they're drawing their conclusions on firm evidence using those 3 methods. And they make clear practical recommendations to strengthen the HDC's potential contribution from 2023 to 30 in accelerating the health-related SDGs. We like to emphasise that because we want to kind of refocus again the HDC effort towards the SDGs and what it might take to do that. And could update, so I'll come into the timeline in a bit, but could update the high-level leadership meeting that we're proposing in April/early May. The work will kind of be probably halfway through then, but at least make it available to that group. And lastly, for good practice again, ideally publish the results and the methods in a peer-reviewed journal. And next slide. So the timeline that we're proposing is that this is at draft 0. It needs your inputs and thoughts between now and I think for probably the first week of November, but looking for verbal and written feedback between now and then, that we'd revise the TORs and we try and issue an RFP as long as the SRG approves the TORs, probably in our first meeting in November, and that we'd advertise it as an RFP, ideally with the selected group to start work in early January. They would spend the bulk of January, perhaps a bit of early February, designing the framework. That's objective number 1. The country case studies would take probably right the way through from February to June/July. And the other bits of work, the literature review and the stakeholder interviews in kind of February through to April. And that could all be presented back to the SRG some stage, probably July-ish sometime, with the 3 methods and the recommendations ready to go. So that was the kind of the main components of the evaluation in a nutshell. And over to you for any feedback. But we want to emphasize it's a 0 draft. It's our current thinking. You need your thoughts on the scope, the timeline, and that. But it's important to get it done next year because it helps us align with a lot of other processes that we think are going on. It's midway to the point of the SDGs. So thanks. I hope that helps.
Thank you. Thanks, Greg. I'm going to hand over to Joanna to just facilitate the inputs from the table. Excuse me.
No worries.
Continue.
Do we have the slides? Yeah, thank you very much to giving me the floor to present also the input of the donor and philanthropic constituency that I represent with Rachel Lucas of USAID. Next slide, please. So we are struggling with the constituency to have engagement of other donor organizations as well as philanthropic organizations to really promote the HDC as well as to get their input in the work. And as you can see, we wanted to identify the opportunities of a more efficient constituency. And for that, we collected feedback from active participants of our constituency with these, and we asked the following questions that you can see there. The first of them is, to what extent does the HDC comply with the 5-point call to action of 2015? And how would you assess the current HDC activities in regard to its impact on country level, as well as to what degree should the HDC change the governance structure to adhere to the needs of partner countries, as well as to have an added value of donor organizations, because this is something that we're really struggling to get out there for our members of the constituency. And lastly, what is the best way to enhance information flow between the working groups and the donor constituency? Next slide, please. So what we found out is that for the first question is that the members of our constituency that we asked, they have the feeling that they assess that a 5-point call to action is almost met. However, they identified difficulties with increasing the level and efficiency of investments from our organizations, as well as from governance. And also that what we experience is that partners are really preoccupied with their own projects, and therefore the value add of the HEC is questioned a lot. And for the second question that we asked is that members of our constituency felt that the clearest activities that are known so far for them is really the country missions. They are really well promoted within the HEC network, but other activities are not so clear for our constituency. And the challenges that we identified is the sustainability and the scale up of projects, as well as that health data systems are about cultural change and sometimes, and also that country leadership is key here to really promote a better use of health data systems. Next slide, please. And for the other two questions is that we assess that the HEC governance is really working well, especially for the thematic working groups, but for our constituency especially is that the struggle is that all of our members are really represented by HQ level or at HQ level and not country level. And this is sometimes really difficult to explain my colleagues, especially for at GIZ, what they can do it on the HEC forum and where they find also information, and also sometimes the structure is not very clear, and this is something that we need to be very also focus on, because we need to explain them how the HEC works and what they can do and what they offer, right? And also we identified a challenge that there's a lack of guiding principles for coordinating the country HIS work, and this is something that hampers the effectiveness, and also the implementation of the HEC structure on country level. Lastly, but this is something that was very already discussed here. Now I hope with the new website there's a new momentum to really improve the knowledge management within the HEC, and we see that there's a need to have a better knowledge management, especially to communicate what is going on in the working groups and what we can also translate on country level to our colleagues. And two ideas that we had was that each quarter a new working group could present their work in our constituency, and also a central repository to access the latest meeting minutes. Next slide, please. And what we had for an input for the HEC evaluation are these 3 points. First of all, the juxtaposition between current organizations, structures, as well as alignments of principles, because we're really interested to see the relevance and the impact of our constituency as it's currently constituted. What we also want to see in the evaluation is to to explore the question of how to monitor the country level alignment. And lastly, how well we are also doing in terms of HEC focus countries and regard to alignment. This is just our input for the HEC evaluation, as well as our experiences so far. And I hope this can also be integrated into the evaluation. Thank you.
Thank you. So next we have feedback and discussion on strengthening the modus operandi of HDC, GAP and DDD. Just help us, Craig, please.
It was more of an open discussion from the evaluation. So there might be different components of the evaluation that members might want to be looked at. So the modus operandi, so for example, there might be, so within the evaluation, although we're looking at the potential vendor to look at the 6 criteria from OECD, there are different ways. If you look in detail in the TORs, there are different ways to look at that. You might want to look at it from the governance perspective, country impact perspective, communications perspective. There's a range of other perspectives there as well. So when we put on the agenda modus operandi, in that was kind of other elements in the evaluation that could be taken on board that the criteria might be adapted to, for example.
Okay.
Makes sense.
Oopsie, thanks, Greg. I'm giving over to Joanna for solicit some feedback. Thanks.
Thank you very much, and apologies if I don't know your first names, as I was not in the room yesterday, so I will be just calling on you as you raise the hands. You wanted to intervene. Thank you.
Thank you very much. So I've worked with OECD for about 20 years and have been through, I think, 6 OECD full evaluations at a very high level. So I can add a little bit to this based on how OECD does this at the ministerial level, as well as at the council level, and as well at the working party level. So I think the HDC is probably closest to what OECD calls its working parties, which are very significant groups within the OECD, under which most of the work is then structured underneath that. So what I can say is that the main thing I see that is missing that would be in a formal OECD evaluation is a very significant look at what they would call administrative and procedural controls. And I can give you some examples of that. So at lunch, we had a very good discussion and meeting with not the working groups, but the stakeholder groups, and our stakeholder groups, and you know, we all realize that we need mapping. So this is exactly the kind of thing OECD would look at. How well is your constituency mapped? Do you have full insight into your constituency? So this is an administrative and procedural issue. And then a question would be asked, is there an organizational level roadmap for conducting and checking on such types of procedures? So it's these kinds of very picky little questions. But I think that as we go along and begin to build this, because this is a very, you know, in a timeline, this is a very, very new entity. So it is completely understandable that these will now need to be added in as things ramp up and get larger. But I do think that those kinds of administrative and procedural controls would be a real benefit. And the biggest one I would say is that there needs to be a really good map. If you go to OECD.org, and you are able to go to their website, and under each working party, you'll see the leadership of each working party, their names. Under each working expert group, you will see the names and their constituency and their country. You can literally look through the website and see every single person. You'll find me on the steering committee for civil society. You'll find me doing the AI work. You see what I'm saying? So anyone can see this. I love this about the OECD, because when I need to contact someone to get some work done, I go on the website and I start searching for skills. I start searching for countries. And if I've met someone, I look for their name. And this is so, so helpful and really assists communication. The CDAP, the committee, one of the very large committee, the largest committee at OECD was evaluated last November, and we got the evaluation in the budget. The budget has to be approved by the council ministers, so it's taken very seriously. I think that the peer review journal would have the same function. I really do, because in the peer review, you would get that feedback loop. But something that came out that was really intriguing was the communications were criticized. So email is no longer seen as a viable communication tool as a standalone. And I'm just sharing this with you because I was very surprised by this evaluation response. So as a result, the OECD instituted a policy that all working groups have Slack channels. Now they chose Slack, but it could as well be a WhatsApp group or another similar technology, which allows more real-time communication and more casual communication. And the reason they came to this was because people had given the feedback that no one was seeing emails because all of our email boxes are too full. And this evaluation happened in 2021 after COVID-19, where something happened where all of us got too much email. But anyhow, those are just some observations having gone through the OECD process. I think this looks very, very good. And I would just add those few little elements to look at the communications flows and a little bit of the procedural controls. In other words, more transparency about who's where and how can we see those people. And also, is there a Bible, what OECD would call a Bible? So for example, someone asked during the break, we were talking about, it was you who asked, the conversation was how do co-chairs mentor the next co-chair? Well, there's not a Bible for that yet, right? But this is something that should be added, and it's very simple. I think this is something that everyone understands. But to have it written down somewhere is, I think, a very good thing. So apologies for the length, but I wanted to share those things I've learned from OECD with you. Thank you.
Thank you very much for your contributions. Rachel, over to you.
I just have a simple question. Craig, when you put up something earlier today, you said the purpose of the HDC was to improve the health information system. You had a very explicit objective at the top of a page under, work plans and objectives for the next few years. I want to point out that the purpose and the objectives listed under this evaluation document are different. And I noticed it because when I first saw the one up there, and it was all very much health information system. In this document, the HDC objective is broader than the health information system. It is about data writ large. It's about all the types of different data that would be needed to accelerate health in a country. And I don't know if I'm splitting hairs, but I wonder if I'm new to the HDC, so it's a little bit, maybe it's a question from an outsider coming in. Those do not strike me as quite exactly the same. And I would think you need alignment before there's an evaluation, because those are slightly different objectives. So I don't know if maybe I'm splitting hairs, but it seems to be a broader attention to data is the objective stated here than just the health information system of the country. Over.
Thank you. Would you like to react now, or we take more comments or questions?
I might have misunderstood. So I'm hoping that we've been consistent. If we haven't, then that's it. But basically, the mission of the HDC hasn't really changed. It's still, there's the mission, and then there's the three objectives of the HDC. So they're on the website. The mission is a collaborative platform, leveraging aligning technical financial resources to country-owned strategies with a specific focus on SDG targets and communities. And then the three objectives: the country capacity for HIS, the alignment and efficiency, and the global public goods being adapted to local context. Those three objectives, which are different indeed to the objectives of the evaluation. Is that what you're meaning, or are we meaning reference in the
No,
TOR?
What you just read as the mission is different from what you had as maybe it was on a slide earlier today, where you went right into the health information system. Whereas, which is different because this includes data that are not necessarily in the health information system. Sorry, but I
sure.
Maybe am I?
So
Deborah, are you nodding?
I'm happy to completely go back to the original, the mission and the objective of the HDC. So if there is an inconsistency in one of the slides, I apologize for that. I'll go back whichever slide it was. But we need to be consistent. What's on the website just now is the one that was way back in for 2 years ago. And that if there's a consistency issue in the slides, apologies. I can go back. Thanks.
Thank you. Any other comments or questions? Well, I have one, if I may. I was wondering, once you hire the institute, will we be able to contribute to the evaluation questions, or shall we do it beforehand, before you go into the hiring of the institute that will perform this evaluation?
So again, I'm guided by you as the SRG, but our thinking when we were putting the TORs together was that we can have the questions would help focus. If you have the 6 criteria, if we're going to move forward with the 6 criteria, each of those criteria has some fundamental questions that could be, if you look at the principles of the OECD DAC criteria as well, make them context specific to the HDC, and that if you come up with some questions, we put them in the TORs and the RFP as it's released. But as we move forward and have our, presumably a kickoff meeting with whoever, gets the bid, that we could contribute. And I'm hoping, as we do with other evaluations, other pieces of work we'll hear later about, we could have an external panel that helps guide some of the process as well and make sure that they have inputs throughout the process as well. So definitely open to not just what's written in the TORs and how the RFP is written, but as we move forward with working with the selected company, there may well be other questions as time moves on as well. So it's a bit like the velocity of co-creation and working together. And we would think about having a group of yourselves or specifically external experts in evaluation as part of that too, as an external panel.
Thank you. I think it would be useful to co-create, so we can also steer it in ways that we think could be useful. And again, here I think it would be useful to have country input as well. Any other comments, questions? No. So I don't know. Are we ready to close this session? Or I hand over to you, Letitia.
So I have a comment. But you've explained it, Craig, how there still need to be an agreement on which angle the evaluation will take. And I think that needs to come out quite strongly and echoing our discussions over the last 2 days, reiterating the country participation and taking a country lens assessment. And it's only if a country says we're successful, that's when we've met our objective. And now that we have a spanking new website, also to share the progress as we go along, and that makes it transparent, to also not just wait till the end. I think that was also quite nice, something that I've appreciated from the HDC so far as work is being done. We're able to share, and if there's minor refinements, then that obviously can be done, obviously within the TR. So just to reiterate that the TR is essentially about the mission and making sure that there's no misalignment, and there will be cross-checking for consistency. Also incorporation of the learnings from the OECD evaluation in terms of the administrative and procedural control stuff and how we hand over. There's governance elements there. Support, there is definitely support for the peer review journal in communicating to a wider audience, and also adding to the body of knowledge, and recommendation for real-time comms, and that email has sort of become slightly outdated, and we want this instant contact with each other. And then guys, so just a reminder that you can still comment on all of this, the six principles or from the OECD. Then there's theory of change and the added value for country impacts. All of this by 2nd of November. So please make your voices heard. And then going forward, the entire schedule is also published for your reference, and so you can track progress actively. Thanks for that. So I would want to just check on our online audience is 11, no hands. You have a chance to put your hands up if you still want to contribute or even just comment. And if you're there, okay, cool. Then I'd like to hand over to our overall chair. Thank you very much.
Well, then we are really galloping. So just a question, because there is another item in this subsection. Okay. And that is just about ongoing monitoring and evaluation. And maybe, is that a distinct area, Craig? Do you want to?
Well, I mean, when end the afternoon, whenever you want, we've got another session in here, but it would be useful in this discussion so one of the weaknesses that we're painfully aware of is our ability to report on a regular basis on progress of what the HTC is doing. And that's for a range of reasons. Two main reasons. One is our own capacity, and we need to be a lot more disciplined in that, quite frankly. And I think it's something that will be addressed with clearer metrics. But the second issue is the unclear metrics that we've had over the last couple of years of how to measure progress and impact has been challenging. So the whole monitoring, and I'm aware that the evaluation will probably seek that as one of the weaknesses, quite rightly. And we kind of think about what works for the SRG and what works really for countries to actually show that the HDC is useful, added value. How do we measure that? How often do we monitor it, given that monitoring processes can be quite onerous? How do we do that? So our suggestion was, with those four areas in the work plan that we're suggesting, we came up with some concrete metrics. So it kind of reflects a bit on our proposed work plan between now and 2025. Are those matrices the right ones? And how do you want to kind of hear back on kind of monitoring progress with the HTC? So it was more a reflection that I thought might come out in this discussion on how would you like us to kind of monitor without going into too much detail, but giving you the detail that you need, and especially from colleagues that are kind of monitoring progress that either want to invest technical or financial resources into the HTC. What are the right matrices, and how do we actually monitor the HTC? That's where we were hoping that the discussion might go to. It was a broad issue, but I thought it might be reflected in the discussion.
Craig, you mentioned that there's a new theory of change, an updated theory of change or logic model. So are there process indicators in that were updated that could be serving as kind of midpoint monitoring indicators, quote unquote? Not really. Okay.
So
yeah, I don't know. Okay.
Any other views? Yes.
My only comment is that you talked a lot about in the work plan about, I don't know, 1,000 and then 10,000 and users or members or something. I just had a question is it numbers? Are those going to be helpful? I mean, is that about accessing the user information, contributing? And I'm sure most of us would agree it's really more about the impact issues. So those are useful metrics to see that people are using the products, but I hope we don't get distracted by that too much and focus more on the challenging issue of impact.
Are there any other yes, thanks, Salome.
Yes, thank you, Craig, for that presentation. I just wanted to know at country level how the evaluation will really look like. An example, really the HDC as Malawi had described has really had a lot of institutional memory, but also some people have gone etc. So if, let's say, you came into the current ministry and asked about HDC, probably we are just rebuilding, post-COVID-19 rebuilding. So what are really the checks and the balances? Thank you.
Thank you, Salome. Okay, I'm going to think about, guys, just think about more things you want to add. And I'm going to ask Craig if you would like to respond to any of those or any of the rest of your team.
Just one quick thing. OECD evaluations can be massive. Can we do OECD light? All deference to my OECD colleague, former colleague.
You should do OECD light, absolutely, no question.
I think that wasn't the recommendation. She highlighted what was additional stuff that would be useful. So would that be okay, Deborah? Okay, great.
Give it my best shot. So thanks for the question. It's a really good one. I don't think I have the right answer, and I think I would hope that whoever is undertaking the evaluation would actually go through and understand and have a footprint of how ministries of health work, how health data flows through a government system, perhaps a non-government system, and is aware of some of governmental planning processes as well. And with that firm understanding and contextual awareness, I would hope that the evaluation team, as they engage with the country, they may ask specific questions of your just general questions of your experience with the HDC as an entity. Which actors or agencies have you engaged with? How has the engagement been? What has been the strengths, the weaknesses? What have you got from the engagement? What have you not got from the engagement? There might be rooms for improvement. There might be other questions that come up saying, how is communication? How is governance? But I think the evaluation will look at those, I'm hoping, if they come up with the right framework, look at those 6 criteria from efficiency, sustainability, impact, the others as well, and come up with the questions. And perhaps if we're able to co-create with them, which I think we can do, we can make sure that the questions are tailored to, at the end product, best understand how you as in countries are getting what your impressions are, and honest impressions of how the HDC has supported you or not supported you between 2015 and 2022. So the questions would need to be crafted by the group that's going to evaluate, and I'm hoping that we could influence some of the questions that are going to be asked as well. I hope that answers your question, but I would hope that that was the fundamental issue for me anyway, would be that whoever's going to be selected has a very intricate understanding of health information systems, data, digital ideally, but a fundamental understanding of country level work and ideally subnational work and how data flows at subnational levels as well. Thanks.
Thank you, Craig. Salome, happy? Thank you. May I, do you have a response on the numbers, whether that is useful, the targets that were set? Thanks.
It's so I completely agree. I think everyone will probably agree it's like apple pie, but how do we, if anyone can think of an indicator that's really that we could measure beyond the numbers, because I agree. I mean, our database, I like the word purge, but we don't want to, kick people out, so to speak. But we need to kind of review about who, and I think we need to kind of do some thinking about who's an active member, how do we define an active member, who's a passive member, and all those kind of things about numbers of looking at that, if that's a sign of success or not. It's a very, very blunt indicator. I think everyone recognizes that. But if anyone has any ideas on how to measure easily measure, and I think we've had some ideas using Campaign Monitor, for example. You can look at how engaged people are through either responses or opening up emails. There's ways and channels of doing that, and that might be a way we might look forward to. But I agree with you, it's a blunt indicator, but if anyone has any good ideas that can be easily measured, very welcome. Thanks.
Thank you. Chris, can you recap your question on theory of change, that it needs to be revised? Please recap. What was your comment?
I just asked if the current theory of change had any midterm process indicators that could be used, based on Craig getting some input on, monitoring during a typical year or whatever. And he said no, so.
Okay.
That's
so definitely no, but again,
maybe we could revisit. We could look at that and maybe tease out some potential, and take some time to do that. I mean, I would suggest back to the Secretariat that we have I know these are extra calls and everything like that, but we have all of these sort of topic areas that you're seeking input on, and we're trying to address in these 2 days, and I'm feeling the energy starting to wane a little bit after 2 days of almost intensive whatever. But to set up another call, sort of like ad hoc calls in between the monthly SRG calls, saying, okay, for those of you who can make it, we would like to discuss about ideas around midpoint or indicators, etc. We've come to a place where we need some input on the questions being asked for this formal evaluation. Let's have a call to discuss that. We're about ready to finalize the work plan. Let's have and I know that's a bunch of calls, but I think if we just have dedicated, even if it's an hour at a time, of focus on a specific thing versus trying to cram too much into an SRG call, and then sort of this blanket like, oh, we want your input, email us, which never really happens. You've got our dedicated attention for those who can participate in the call, and maybe try that as a format. Hopefully that'll be a little more efficient and helpful and the right people. So suggestion for consideration.
Jean-Pierre?
Yes, just a small question. Actually, it's because you are mentioning the change in the theory of change. I was wondering what is the scope in time of the evaluation, because there have been kind of big change from the first phase of the HDC and the second phase that we are in now. And I'm just wondering if there's different phases are taken into account, if it's only after of the second phase or it's the all from 2015.
So it's 2015, basically from the conception and birth of HDC till December 2022. So it will take everything between those two times.
Thank you. Any yes, because.
Thank you. Thank you. Again, I don't know if it's really the evaluation or the monitoring, but I'm looking at this this scorecard, the heat map from SDG. Right. If we are really one of our key aims is to improve alignment and investment around health information systems. Have we been able to do that across different funding sources, across different implementation mechanisms? That could be a monitoring indicator that we can assess at the country level. I don't know, maybe it sounds more challenging at the global level, but the countries that we're supporting, we're focusing, that this could be an example to look at and develop some kind of a monitoring sort of framework around this that is more sort of, it's more robust and provides more information than counting participation and in meetings, and that's helpful, but this is what we want to change, right? So something like this, I think this is a good sort of an example that can be aligned budget used for local monitoring systems, joint TA plans, use of local coordination mechanisms. I think it's there's some good examples right here that I think we can use for routine monitoring, even not for evaluation, but just a thought.
Thank you, Vikas. Any other contributions, comments, questions? Yes, go for it, Amos.
Yes, thank you very much. Interesting discussions. I was just wondering whether the evaluation would also include other non-HDC impact countries, so that we're able to see whether HDC indeed has a demonstrable value to the area, to the countries that they work in. And I think the other issue has been addressed by my colleague standing there about alignment, that it shouldn't just be in one aspect of key players, not just amongst the partners, but including even alignment within the member states. Are they aligned in terms of implementation of HIS staff and so on that HDC is supporting? Because I think that may have a bearing on the alignment by the partners as well. Otherwise, I think this is interesting. Thank you.
Thanks, Amos. Okay, the room's quiet. Online's quiet. We're running low, we need coffee. Any responses from the Secretariat at this point?
I think thanks for your ideas. Welcome them in written form. And I realize you have a lot of institutional knowledge on evaluations. And if you have an opportunity to discuss with your evaluation teams, we'd appreciate, sharpening up the TORs, getting your ideas. And I really like Chris's idea of kind of going back to the theory of change and really looking from a monitoring point of view, coming up with some very strong indicators using the revised theory of change. So thanks for your inputs.
Yeah, thanks for your inputs. And if I can just summarize the additional inputs that came, was maybe just starting with the theory of change. And I have a comment on, it's more from a readability point of view. It's very green. It doesn't read, especially on the projection, I think printed form. Amania is nodding, so we're going to fix that. And then the midpoint indicators, we could look at that. Then increasing or rather just looking into enhancing the evaluation or understanding how we'll measure those numbers to make it a bit more meaningful, and evaluation at country level, and then yes, and the consideration for the SDG gap heat map to present the monitoring and evaluation reports. So please, as Secretariat has asked all of us, to please provide our comments by 2nd of November to make this, to enhance the TOR and to make this whole evaluation as meaningful as possible, and so that we are able to evaluate the things that are important for the people that are going to use, that we serve. So let's just remember that. Thank you very much. Just before that, you want to add anything, Joanna? Okay, thank you.
Okay, thank you very much. So to Craig, do you want us to just move on to the next session?
If you're happy to, yeah.
If that's okay.
Keep it going and then you can finish early.
Okay, I presume coffee's not yet ready.
No, I don't think so.
Okay, we'll take a look. Otherwise, then thank you so much to our facilitators. And then I would call on Sam and Ernesto, I think, for the next session. We'll go right ahead, knowing that we may break it up for coffee partway through. Okay, so this is going to be on an initial HIS investment case.
Yeah, good afternoon, everyone. So in this section, we focus on the investment case that has been developed for HIS. We'll have a presentation and then we'll have some discussions. I must say that I wasn't involved with this, with the development of the investment case, so I don't know very much about it. I'm just like, you will listen to what the presentation, we'll listen to the presentation and then we'll discuss. We'll begin with an intro by Craig and then Jean-Pierre.
I'm keeping quiet in this session.
So
Jean-Pierre, and then handing over to Xavier, who's actually joining us from, I think, Bern, and just because we're early, I need to make sure he's okay.
Okay.
Yeah, sure. So I will just introduce on behalf of the RHIS working group. And so it's making the case for investing more in routine health information system. And why should we do that? Actually, we can actually look a little bit at the past years. And there is a real renewed interest in routine health information system. And maybe part of it may be due to the spreading of the HIS2 that makes information available. But this interest has been even actually increased with the pandemics and the management of the information around the COVID pandemics. And if you look at what we have at the disposal, we have also the SCORE, which has a section on routine health information system. We have now the routine health information system strategy of the WHO. So there is a real interest in the international community. But in the other hand, if you look at the country that we are interested in, there is a real lack of investment of the government and the ministry in their own routine information system. So in the group, we finally thought that we have to gather some good argument to actually push the investment on routine information system in countries. And so we came up with the idea of a study. And that will be the presentation that Xavier, I hope that is online, will make the initiation of this study. And this study, it's actually, yes, to look at finally what is the investment in a few countries in routine health information system, to try maybe to find some argument. Good argument would be the return on investment. If we can demonstrate that there is a return of investment in investing in routine health information system in economic terms, but not only in the outcome, in the health system functioning, in the better care delivery. That would be a fantastic argument to actually convince the countries and the international community to continue to invest. Because nowadays, as I said, there is a lack of investment from the country, and mainly those systems are supported by international community. So the study will be about making the case in studying the situation in different countries, trying to find some estimate of the return on investment, maybe to use also this material to elaborate a kind of a framework that can support investing in routine health information system, and maybe to come up with a publication in a peer review if it's possible. So without further ado, I will give the floor. Maybe Craig, you want to complete a little bit on that?
Sure. So Xavier, we're still trying to get in touch with him because we're a bit early. But the other background to it is really, I mean, I think we heard yesterday, again, I point to kind of Gavi colleagues who made a very strong case, like it's usually the first thing to get cut off. And all of you are saying, you know, we need to make data sexy. We need to look at investors. We need to make sure the technical components of the work that you do with the political leaders and the funders are made, and this we felt was a key component, and it was a large, when I first started in this role in October 2019, I think I interviewed or spoke to about 54 people, and I would say of them 2/3 mentioned the issue of, you know, health information systems per se needs invested in, and there's never really been a case made for it. So we, in discussion over the last sort of year or so, a lot of feedback that we got was, can we make a economic social argument for investing in health information systems, not for the sake of it? How does investing in health information systems translate to better health outcomes? And it's also that second aspect, teasing that out is really important. So we got a lot of contributions for the TORs that we drafted. It was approved by yourselves, so you all had a look at the TORs before we advertised the RFP. And the RFP, in essence, was trying to do several things. It's very much country focused. I think, sorry, the other feedback we got is it may be impossible to actually attach a return on investment figure to investing in health information systems compared to something like immunization. So for every $1, it's $34 or $42 you get back in when you invest in an immunization system. And some of the disease-specific initiatives have done that. And we were wondering, can we do that for a component of the health system, such as health information systems? And, you know, whoever you speak to says, that's never been done before, or to our knowledge, it's never been done before. Can we think about it? So it might not be impossible, but it'll certainly be difficult. So if it's going to be impossible or very closely kind of difficult, then one aspect that we put in the TOR on the advice of some of you was look in a few countries, 4 to 6 countries, where countries have invested in health information systems and very carefully tease out what has been the end result in terms of either economic impact or social impact in terms of health outcomes. So it's looking for specific examples from countries. If it's not possible at global level to look at a return on investment and come up with a financial figure, we don't know yet. We're hoping that a couple of health economists might be able to support that argument. We'll see. The other part of the TORs that we put in is obviously a literature review, and already the group that's doing it, Xavier and team, have got a ton of literature together. So that was the other thing we were going to ask you as you become engaged in this process. They're building up a repository of literature looking at investing in health information systems and what works. So already quite a high level document has come out recently, actually last week. It was coordinated by Dalberg, but it included colleagues from the World Bank, colleagues from OECD 21 on investing in data systems, not health data systems, but data systems per se. And that's kind of one that's kind of a fairly cutting edge. So I'm just giving you an example of a lit review, but we hope that this group, Xavier's team, will be able to work with us, work with you to do that, and eventually come up with, I haven't got the TORs in front of me, and Xavier can speak in a lot more, kind of the end product would be to present to the leadership event in April or May as really being a corner piece of what the April or May meeting might be. If we decide to kind of, the focus will be on how to invest in health information systems and what it takes, this is a key component or a bit of a background to give evidence to some of the discussion that we hope might happen in April or May. So I think that was some of the background to it. We've also put together, so Xavier, we've met with him a couple of times. He's putting his team together. There are different components to the work. We hope that there will be an external expert panel that we put together, and some of you in the room are part of that. There are some other health economists that are part of that group, and that they and you will have at least 3 opportunities to advise and to guide Xavier and the team. One at the start, which will be in the next few weeks. One in the middle of the process, probably in probably January or February, and then before the end product is finished as well. So we're really trying to make sure that you have oversight and you're able to guide Xavier and team, and that beyond you and the SRG, we actually have some other experts who are, I would say, from a political point of view and also from a technical point of view, can help cross the bridges between the technical work that needs to happen and getting it into the kind of the political arena in April or May if that works out. So it's a bit more about the background. Sorry, I talked a bit, but the TORs, some of you have contributed massively to, and a huge thanks to. It was a very competitive bidding process, and it came down to the wire between two bidders. But I think Xavier and his team have a huge again, footprint in countries and understand really in depth how countries' data systems work and have extensive years of work with it. They have a very strong health economist, and in our external group as well, we have another couple of other external health economists that are going to be working. We've engaged the health economics unit here as well. They've had inputs into the TORs, and they will also, one of their staff will be engaged with the processes that moves forward as well to make sure they've got a kind of, I would say, a UHC primary healthcare lens on it as well, which helps. So I hope that gives you a bit more background, and fingers crossed, I hope Xavier is online because he can talk a lot more articulately than I can. Thanks.
Just another thing is, I think it's important is that finally managing the group to have the support of WHO actually to recruit an agency to perform this study. And I think that probably in many groups that will be necessary to have resources to have sometimes some study to complement the work of the group itself.
Thank you very much for the background. If I may ask, what constitute health information systems? What are the key elements that you are looking at? This is my first time of coming across this case study, so I wanted to know a little bit more. Or we should wait for Xavier to...
I mean, the TORs is very much focused on routine health information systems, i.e. the 3 levels in countries, administrative levels that are government and its routine health information systems. But I think at the kickoff meeting, and it'd be good to get your inputs into what the scope is. The scope was written in the TORs, which you approved, and the Xavier and colleagues responded in that way. But I'm hoping he'll be online, so we're just trying to get it.
Thank you. I just, I mean, I'm not an expert in health economics, but this has been a question, certainly when I was in the PEPFAR program, very much of an interest to us because we wanted to assure that the investments were warranted, given, I think the way it was put to us, every dollar you spend on something else is taken away from putting a pill in someone's mouth. And so why do you want to do that? I actually welcome this. I think it's enormously important. A few thoughts on some of the questions that we faced. One, you know, there's a cost to implementing systems, but there's also a cost to not implementing systems. And you have to have some way of helping people think through that. The paper is expensive. Staff time is expensive if they're doing lots of duplicative work. So when you're measuring you do ultimately want to get to health impact, which is hard, but you can also get to other things, economic assessment that could also be useful. You can measure what it takes to do things the routine way, and you can measure what it takes to do things with a properly functional system. We've done some work around that with electronic medical record systems. I haven't looked specifically at the RHIS, but some of that is available. And then you can think about proxies to getting at health impact. I mean, for example, there was a study that was done that showed if you link laboratory and clinical systems, you can reduce the turnaround time for tests in a way that's clinically relevant, that it actually gets people onto ART treatment faster if they have the data indicating that they need it. So, you know, this is an enormously important area, but I think that there's at least some work out there that can be leveraged. Thank you.
Yeah, please go ahead. Yes.
Okay.
Talking about DHIS too.
No, of course, this money approach might be complex, and I'm not sure that I can come up with much there. But when it comes to what is not possible to achieve without information, we can start with, I remember what we worked on in South Africa and all this, that without data, how can you ensure equity in health service provision? Not possible, because you need to have data in order to see how you can, I mean, to what extent the different groups are served in equal ways. So that's one thing. And then, of course, you can say transparency. Health service, I mean, in the health services, how can you get transparency without having data? Because data is the only way you can actually show whether it's the public or the other parts of the health services, what is actually happening. How many seen, how many deaths, how many whatever. So transparency is another thing. And a third thing is obviously accountability. I mean, if you think about data during the COVID and what you could see, how was the government, how was the health services able to provide vaccines, for example? How many were vaccinated? The only way that accountability could be shown or actually demonstrated or actually happen was that, yeah, the health services could give data on how many were vaccinated, for example. And same in all other aspects of the health service. So for me, these three issues are key when it comes to the data information and the importance of it. Equity, transparency, and accountability. Simple as that. But that must, of course, be presented in some way.
Yeah, thank you. Rachel, you had a point regarding the inaction.
No, it's just sometimes it's easier to talk about the cost of inaction. So there's a big movement. I mean, anyway, had some presentations and some experts, and interesting to listen to them from the Harvard School of Public Health, talking about when instead of the return on investment, you know, so it's $1 in and $30 saved. Sometimes it's easier to talk about the cost, the health and the human cost of inaction in building the health system. And conceptually, sometimes that's easier on things that are difficult to monetize, was their point. I've never used it, but I thought it was an interesting point to consider.
Yes, please. Great, thank you. And apologies, because I didn't actually look at the TOR, so it's probably already answered in there. But to what extent are we looking at a routine health information system versus investing in a digital routine health information system? Do we have that knowledge of I guess, what they're going to be looking at? Are we looking at digital or non-digital? Or both? And I guess, well, I'll just continue on with that thought, because I think one other piece with something like return on investment is, are we also looking at potential return on investment? Because I think it's been mentioned before, you know, if you invest in something, it's in a lot of places you invest in a digital system, but then a lot of the return comes when you do away with paper and printing some of these things, which in many countries hasn't quite happened yet. And so I was wondering to what extent we're looking at, okay, what's been realized in country, as well as then what the potential could be. So again, sorry if this is already all in the TOR, but just curious.
Yeah, and then.
Measuring in terms of money, I think this is a quite tough job to have this one for the information system. But as on top of what John said, accountability and other matters, I suggest to have some check with the efficiency, like with the support of data and without support of data, the planning process in the planning process, how resource allocation efficiency has been increased and the service delivery efficiency has been increased with the support of data. So that can be measured in the qualitative in the qualitative information shape.
So I see that Xavier is already on the line, but maybe we can take one more question. Yeah.
Oh, very quickly, another resource maybe to look at is that WHO AFRO did a business case for vaccine venerable disease surveillance back in 2018, 2019, where again it was promoting the importance of surveillance. There may be reference to our HIS in that document. It's online. And I think there was also sort of messaging around the importance of countries to also be supporting their own surveillance systems in addition to other partners. But maybe some language from that document could be reviewed and as appropriate, some application to this work over.
All right, thank you for your questions so far. I think we can start with the presentation of Xavier, or 5 minutes, okay. All right, are there any further comments that you want to provide now? Oh.
Xavier, 5 minutes to come out. He was just busy. I gave him the time.
All right, and shall we proceed then? Okay. Then the floor is yours, Xavier.
Okay, good afternoon, everyone. I am Javier Bosch Kaplan. I am working at the Swiss Tropical and Public Health Institute, and I am really very happy and honored to be able to present before you all this our thinking so far about this work on the investment case. If you want to go to the next slide, please. Yes. Can you go to the next slide, please? Yes. So I am talking to you on behalf of a team which I am leading. In this work we have also Christian Auer, who is a public health specialist in the Swiss Tropical and Public Health Institute as well. His main area of work has been is tuberculosis actually, but from a health system perspective, and he has been working extensively as well on health information systems. Fabrizio Tediosi, he is a health economist, also from the Swiss Tropical and Public Health Institute, and he has done many works on modeling and other works on health economics, and including also as well modeling and investment cases. And then we have also Natalie Leon and Edward Nicol, both of them from the South African Medical Research Council. Natalie Leon has done a lot of work also on health information systems, and she's the lead author of the Cochrane Review on routine health information systems effects. And Edward Nicol as well, he has been working and published and doing research on the health information systems, particularly in South Africa. So I would like to take you through our thinking in relation to this mandate, which has 4 work packages. The first work package is related to framework synthesis. The second is the country case studies. The third one is the overall return of routine health information systems investment. And the 4th work package is around advocacy and dissemination. Next, please. So really, we have, I think we all are aware of the many problems that routine health information systems have. some of these problems, like the complexity of routine health information systems, the overload that these represent for frontline health workers, are problems that we have seen literally for decades, and that if all these problems as well we have been addressing through some of our recent research that has been focusing on paper health information systems recently. And the problems of the routine health information systems have an impact on population outcomes. Whether we can measure or these are measurable or not is another issue, but certainly it is reasonable to think that they have an impact on the population outcomes. So in this work, basically, we want to look at these kind of two plates of the scale. One is really what are the values of routine health information systems, and then what does it take to invest in these values, and also from different perspectives. And part of our job, and of course, as I think it was also suggested in a recent intervention, is also to look at some other cases or examples that can help us to formulate what are the values of routine health information systems, and how can we translate some of these values in quantitative measures, including economic measures. Next one, please. So in terms of the framework synthesis, which is the first work package, we have three components. One is to look at health information systems frameworks. We plan to do this looking at existing initiatives, also at the existing systematic reviews that help us to understand exactly what the definition of routine health information system, which is the scope of our work, and how these health information systems have been thought and from different perspectives. We will also look at, through a scoping review, we will look at other examples of return of investment of, probably we will have to look also at other interventions beyond routine health information systems, depending on the evidence that we find. But we would like to look at methodological approaches on returns of investment, and also some examples that can help on our work. So we will use basically here scoping reviews methodologies, which is let's say a slightly more simplified approach to systematic reviews, which is something that we have been doing as well. Actually, one of these papers is from ourselves as well. Next one, please. Actually, we will have to work in parallel due to the time constraints. Although we would have liked to work on phases and actually engage with the country case studies later on. But basically, almost in parallel, we will start the country case studies. So we will select 4, 5, 6 countries where we can go in depth, and based on what we have learned in the framework synthesis and the scoping reviews, we will collect data, existing data, in order to precisely look at the returns of investment of routine health information system. This data will have to refer to routine health information systems, or maybe subsystems, or particular interventions on routine health information systems. This is something that we will have to define. We want countries to have some geographical diversity, also some diversity on the income level. We would like also to take into account at least 1 or 2 fragile countries. And as I said, we may have to look, depending on the availability of data, on particular routine health information systems interventions. For example, digital interventions, or interventions in particular healthcare areas, for example, immunization, electronic records, or things like that. Some examples of countries that we have been looking at, and that we have, of course, thanks to our partnerships, many relations with, but one country is Switzerland, because Swiss TPH is based in Switzerland. We have some relationships with the Federal Statistics Office in Switzerland, and also we have quite some relations with Laos and Nepal. For example, in Nepal, is a component of the routine health information system that is related to community health funds. Also Colombia, for example, South Sudan and Chad for fragile states, where there are, of course, the HIS2, but also in Chad there is an intervention that is based on routine health information system and that is supporting clinical decision making at primary healthcare level, and also Nigeria and Cote d'Ivoire. Also, because thinking on Nigeria, to have a country or a case study that would be in a subnational level in a country that has a federal structure and highly decentralized health systems. Next one, please. So, based on what we have learned from the work package 1 and also from the case studies, we will try to synthesize all this information in terms of an investment case. And I think that here we will have to look at 3 complementary approaches because we anticipate that we probably will not have all the data that we would like to have in order to populate an investment case. So certainly we will use a qualitative approach in terms of hoping to define what does it take to invest, what are the possible values of this investment, and we expect that based on the secondary data that we get from countries and also data that may come from research, particularly from experimental or quasi-experimental studies, we will be able to also assess or to provide some quantitative and quantitative data on both values and investments. So we will, at this point in time, we are unable to really predict very well how the investment case will look like, but certainly we will try to use a mixed approach that can help us to populate this investment case, and that can be informative for investors, for ministries of finance, donors, etc. Next one. So the last work package is the work package that has to do with advocacy and dissemination. We keep in mind all the time that actually this work is meant to inform a meeting that will happen, I understand, in April or 2023. So we need really to understand what are the needs and the let's say the decision space in this meeting, so we can really tailor all our work in relation to this meeting and other decisions that can be made in the future in relation to routine health information systems investment. And of course, we will have reports written in each of the work packages with a full description of the work that we will do, and we expect as well to have an overall report and a paper in a peer-reviewed journal with the findings. Next one. I think that's all. Yes, well, in terms of timeline, as you can see, I mean, the timeline is really tight. We have a first kind of hard deadline at the end of October, where we expect that we will have from the work package 1, the framework synthesis, we will have of course the protocol and half of the work done up to the inclusion and exclusion of references. We will have the work package 2, which are the country studies with at least all the setup ready to start, and with including of course the protocol and the selection of countries. And then the next, let's say, hard deadline is, as I was mentioning, at the end of March, with the outputs of the 4 work packages basically finalized. We expect to have regular exchanges with WHO, both to account for our progress and as well to have support on the issues that may come up. and also from the expert group and HDC at several points in time. So I think that should be the last one. If you want to go to the next, but yes, yeah, thank you.
Thank you very much, Javier, for guiding us through the different work packages of the of your work that you're going to conduct for us. Because I think also following yesterday's discussion, there's definitely a need to have such an investment case also for the further advocacy of the HDC, and really have a guiding document that can be presented to partner countries to really see what can be done and what shouldn't be done in terms of the routine health information systems. So now, shall we proceed with questions? Or I mean, I think there were already some questions, but maybe I give the floor to you then in the first one.
I have a question for the country choice. Usually I preach for West and Central Africa to be included, but we have a representative there. I was wondering whether we could also get a country from Eastern and Southern Africa into the case study, just to have a representativeness across all the geographies. And also because there was a big investment in routine health information systems, I think it would be interesting. Thank you.
Thank you very much. Are there any other questions? Not at the moment. So I hand over to you, Javier.
Yes, I think our only limit is, let's say, the level of effort and time. We are aiming not to go very far beyond 6, and we have kind of to cover as well countries outside Africa. So I don't remember now if I excuse myself, because I think that the slides were slightly changed and I was not completely sure. But I think that of course South Africa, if it was not there, was another country. So yes, I mean we will try to be as diverse as possible. By all means, yes.
Thank you. Do we have any more questions? Yeah, Maxwell?
So Javier, thanks for a very interesting approach to this study. I'm just wondering, especially for the areas you mentioned that you might have challenges with the quality of the data, especially on the quantitative side. How do you propose to triangulate to make sure that at least the data that goes into the modeling is as near real to the truth as possible?
Yes, if you can take my response as very preliminary, at present I am more concerned about the quantity of data than about the quality of data, because we are really trying to translate values of health information systems that may relate, to the capacity of decision making the capacity of routine health information systems to make decisions, the capacity to relate improvements in routine health information systems with, for example, quality of care outcomes. Or even health status. So I think that I think our challenge will be more on the quantity of data in all these different domains. Probably one of the things that we will do. So we have basically 2 strategies. I think one strategy is to look at interventions for which we may have relatively good evidence. For example, there are randomized controlled trials testing the effects of routine health information system, for example, some digital tools. There are plenty of experimental and quasi-experimental studies on those, which of course there are some issues about also the quality of these studies. But there is research on health information systems interventions. In these type of studies, although there are, of course, very circumscribed and very limited in scope, but in this type of studies, it's relatively more feasible to find hard data on outcomes. So this is one avenue to look really at this type of studies with the caveats that I mentioned and maybe some others. The other thing that we want to do as well, and that we will have to do, is to work with models and try also to do sensitivity analysis. So try to build different scenarios. What if this value instead of this is double? What if this value is half? And this would help us to identify probably some variables that are more sensitive to change and that may require more considerations in terms of the quality of these variables, and also in the future if we want to refine the return of investment case. But having said that, probably what here we are looking really is a mixed methods and therefore mixed results approach, where we will have most of the evidence and most of the considerations related to the return of investment case in qualitative terms. So we will be able to say, look, these are the potential values of the routine health information system. These are the potential outcomes that are probably most likely related to investments in routine health information systems, and these are the investments that seem that may produce higher returns, even if we cannot completely quantify higher or lower.
Thank you, Javier. I see another question here. And
okay, thank you, Javier, for this quite interesting study, and I think really challenging subject relative to the quantitative part of these studies. Have you any idea on the variable you are going to use? Because when I understand you speak about these studies, I don't see which variable you are going to use. Perhaps it could be in terms of method, to go to explanatory method it can be used to go through the data and see how we can have. Are you any idea on what could be variable we can be used from the quantitative part of this study? Over to you.
Thank you. So in synthesis, well, the work package 1, where we are going to do the scoping reviews and the framework synthesis, is what is going to inform let's say, the shape that we will have for the return of investment, including, therefore, the variables that are we going to use. In a nutshell, and as basically like kind of a basic thinking, we are looking at two different things. We are looking at inputs and outputs. We are looking at what does it take of investment to make our routine health information systems work, and what are the consequences or the outcomes of a routine health information system. In terms of inputs, here we are looking at amounts of money invested or paid for. We are looking at time used by health workers, time used by managers. We are looking at equipment, infrastructure, services, communications, all these inputs that make up a routine health information system. So I think that this is likely my understanding. I am not a health economist, but my understanding is that this is kind of the more well-established and standard part of the work. In terms of the values or the outcomes, then here the variables are could be potentially many more, and some of them may not be so difficult to measure, but let me give you some examples. Like for example, we could try to relate the investments on electronic immunization records with vaccination coverage, or with indicators of quality of care. We, for example, have done three trials on health information system where we measure patient satisfaction. we can look at, for example, there are also studies that have looked at, in relation to health information systems, they have looked at antibiotic prescription and some other clinical care variables. So this is we have a potentially very large scope of variables to measure in both inputs and outcomes poles of this work. The difficulty that I think we will have methodologically, apart from as if we hadn't enough, but the difficulty that we will have is attribution. So it's really which proportion of these things that we observe is attributable with which probability to the health information system component and not to other components, co-interventions, or other components of health services. And here again is where in whatever quantitative analysis we can make will play a role the sensitivity analysis, where we will try also to play with different levels of attribution. What if we consider that most of this observation is related to health information system, or it is little related to health information system? Over to you.
Sure, but I think Vikram, you were first, and then you can go ahead.
Thank you. Yeah, very interesting. And I think part of my question was looking at the values and the outcomes, and it seems that still needs to be defined. So it'll be interesting to kind of touch base on that. But on the input side, you did mention about the investments that have gone into building routine health information systems. But I'm kind of wondering about, there are multiple components of a routine health information system as well. And are those components being identified? Are we looking at service delivery information systems, human resources, logistics, supplies, all of the above, or that still needs to be sort of defined? Thank you.
I think we can collect some questions. You can go ahead.
Yeah, I think I wanted to ask a similar question. This is a very daunting task. I remember we did the investment case for CRVS in 2014. It requires a lot of effort. So I think the timeline sounds a little bit ambitious, but let's give it a try. I think I want to follow up on the question. It's the same. I wanted to know what constitutes routine information system. What sort of investments are we looking at? Are we looking at the DHIS2 investments? Are we looking at the electronic medical records, logistics management information system? When you say routine health information, it's very broad. So we want to know exactly what are we looking at? What is the research question here? Thank you.
I think we can, go ahead with these two questions. Then, okay, then go ahead.
Yes, actually, it's related to what Vicky has actually said. I think that before coming to the healthcare delivery and see if well vaccinated or whatever, probably there is some proxy in terms of planification. Are the resources actually proportionate to the needs? Are there some wastage of, I don't know, vaccine that are sent to place where there is not the big population and things like that? I was wondering if you have that in mind also in measuring the impact.
Yeah, please go ahead, Xavier.
Yes, could you please repeat the last question? I didn't get the point, excuse me.
No, I was actually building on what Vika said about the logistics and things like that. And I think that planification also to have good coverage and the facilities at the right place according to information on the needs. Same things for, I don't know, vaccines, drugs and things like that, wastage versus shortage and things like that.
Okay, I think I understand. Let me start with the last one, and please question again if I am not responding. One of the, as I said, we are really literally developing the protocols these days. But one of the things that I see coming quite clearly is that it will be central to our work, the decision-making capacity and the influence of routine health information systems in the decision-making capacity. I think probably this will be core, will be likely very core in the whole investment case work. Which means, and as I said, correct me please if you don't agree, but for me, or for what we are seeing coming, probably what you mentioned as planification, and actually in more wide terms, the management of health services and health areas, including the management of vaccination programs. I mean, all this is basically a decision-making exercise. So I think that this is core to our work, is to look how investments on routine health information systems really bring an enhanced decision-making capacity and effectiveness. In terms of managerial decision-making, and also in terms of public health decision-making, and also clinical decision-making, which are tasks that are fundamental to healthcare delivery. In terms of what is the precise scope of the routine health information systems, if you allow me to share with you an internal team anecdote of a couple of weeks ago, when we were discussing with Natalie Leon from the South African Medical Research Council, where we're discussing with her, what is the definition of routine health information system, because she has worked a lot on this and she had to do for. Well, she said, look, I am going to send you a definition in a couple of minutes. So she sent us an email to the team, and I was expecting an email with some, a few lines of definition in the body of the email. And actually, she sent me a Word document of 8 pages with references and all sorts of definitions of routine health information systems. So we certainly need to define this. We all know intuitively, well, more than intuitively, of course, but we all know that what we are referring is to the information system that is particularly starting at the point of healthcare with routine data collection related to healthcare events by frontline health workers in primary healthcare, secondary and tertiary care. In principle, my understanding in principle is that logistics, health information systems, sorry for the noise, would enter into the routine health information system definition. So I think as it looks now, we will look at them, but as we advance in our research, and thanks for mentioning that this is really ambitious, but as we advance, we will have to make some compromises here, because we have the hard deadline of March, and we count on your help and the help of others as well to help us focus, so we don't spread ourselves and our efforts. And this is why I have been mentioning several times along this short presentation, is that we are looking at systems, but also we are looking at interventions. There might be, for example, just because I had this conversation yesterday with a colleague of mine, but we may be looking at health information system related to community health insurance. This is really something very particular. Is by no means the whole routine health information system, but it may be useful and feasible to look at the investment case in this particular intervention. So we will have to strike a balance, even if we will have an overreaching definition of routine health information system. In the way that our work unfolds, we will have to reach some compromises. Over to you.
Yeah, thank you. May I follow up on this? I think at the end of the day, you indicated that this is for advocacy. So you go to the policymakers in Ministry of Health, and what, for example, you want to tell them is that if you invest in routine information system, you are likely to get, let's say, timely data for informed decision-making. Those are some of the things that one would expect from an exercise like this. So it's not very clear to me exactly what we are going to get the scope of this exercise. Thank you, over. Sorry, I'm being provocative here. I just want to be clear exactly what we plan to achieve with this investment case. Thank you. It's not clear to me, I may be naive. Thank you.
Yeah, well, I think teacher, and then you can go ahead.
Thank you. Yeah, I think that definition is definitely challenging, but best that it gets pinned down and iterative circumscription and gets refined over time. So my question also, Xavier, is one of the outcomes, because you're putting a lot of effort into developing this entire investment case, and at the end there's also going to be a publication, but I was just wondering if one of the outcomes is could potentially maybe be a business case framework that countries could use when they are embarking on considering implementing various justice system, not very, very high level, but that it does touch on the fundamentals to guide the decision making and for them to understand really what it entails, and also to guide as implementation unfolds how value can also, we all know business cases then helps us when we implement also to make sure we keep our eye on the ball. Thanks.
Deborah, you want to ask your question?
Yeah, I was interested, and so this would be for Sam, actually. When you did, were you able to do an ROI for the CRVS? And, because that's probably pretty close, but in terms of what you might be, if you're looking at a very complex system like you would with RHIS, were you able to do that? And also, I think it would be great to share and add it to the HDC materials on CRVS. Thanks.
Yeah, thank you very much. I'll be happy to share that. I think we took a few countries, and what we did was that we collected cost data on how much they spent in establishing a CRVS system. So all the various components, how much they spent, and then we used that information to do some statistical modeling. That's why I kept on asking, what exactly are we looking at here? For example, investments on DHIS2, investments on any of the surveillance system, what have you, what are the returns? So I think that was what I was hoping to get from this discussion. What exactly are we going to do? Because it's not very clear to me yet. Thank you. Over.
I hand over to you, Xavier, to answer also the question from Letitia regarding the business case.
So let me start again with the last one, but I would be very, very happy, please, if I could have also this return of investment on CRVS, really, that would be very helpful to us. So I think that, going back, I think that one of the challenges that we have, and really, I think you have to understand that this is, you are really here witnessing this work as it is literally unfolding these days. So it is, I don't have all the responses yet, but one of the things that strike us is that actually when you look at the links between data quality, decision making, and outcomes, well, there is no strong evidence. There is no strong evidence that improving data quality, you improve decision-making capacity or health outcomes. We are seeing as well that, despite that the problems that we are looking at, there are problems that have been here for decades. Despite that, now we cannot talk about digital really as being an innovation. This is becoming really an old technology. Some of it may be new, like particularly its application in health, like or newer, like some things about artificial intelligence. But really, what is the reason why you still find in many countries like health information systems which are obsolete, not even in terms of technology, but they are obsolete as well in terms of design and in terms of fit for purpose. So I think that in what we want in this investment case, of course, looking at both aspects of investments and returns, but what we want to look is exactly what's going on. I mean, what are the good examples, and also what are the bad examples? And this is I am using a bit of a colloquial terminology here, but this is actually what we want to understand. Why some of the health information systems may look or may have potentially better outcomes, and some of them are even harmful. If we, for example, consider in some settings the amount of for example, duplication of data items. A colleague of mine was also discussing last week in chat. The monthly reporting has more than 1,000 items. All this is time which is diverted from basically delivering healthcare. So this is the problems that we are facing are very, very protracted. And we want to we want to project light in these issues. And going back to and then going to the second question, I think that here certainly for countries, what we want is that the investment case is formulated in a way that helps countries to reform. So how do you really manage to move all this machinery and extraordinary machinery, which are routine health information systems, in terms of resources, all sorts of complexities? How do you improve some of these health information systems? Some experiences like digitalizing some components, like there are some experiences done with SMS, which some of them has been a failure. There are also some experience about, for example, routine immunization records, which are only a very small part of the routine health information system. So we really we would like that the return of investment case is formulated in a way that would help countries to realize or to find out what would be potential avenues for reform and for making the routine health information, for making the investment in routine health information systems really sustainable, really related to decision making, really, that eventually would improve the health outcomes and the health and well-being of the population. So we have really this in mind. Although, of course, I cannot tell you now I cannot tell you the end because we are in the beginning, but this is our thing.
Thank you for your clarifications, Javier. I think, it's a work in progress, and we still have also the possibility to collaborate in this also via the expert panel that is also established. Are there any more questions or inputs? Yes, sure. Go ahead.
Just one comment to follow up something that I said earlier, and that is that yes, it's very difficult to prove that investment will return something. But what is actually possible is to say that if you want to achieve this and this, or this, you need a good information system. For example, I mentioned equity. It can be very concrete on that. Accountability can be very concrete on that. And you can say, for example, we want to provide ARV to 1 million HIV patients, for example. All these things need very, very efficient information systems. So then, if you start there and say, we need this information, and I'm actually turning the whole return thing around, and then you say, how can we cost it in an efficient manner? Then you have actually kind of proved the concept that I mean, you're not using exactly the same terms of return of the money, but actually, how can you efficiently invest so that I achieve that and that and that? So that's my point then. I'd say just one way of approach it. Okay, thanks.
You want to react to that, Xavier?
Yes, I think I am very happy. Well, I'm very happy of all interventions, but I think what you are pointing at is the or what I would understand, and please take some minutes to correct me if necessary, but is precisely to look at this work from the perspective of decision making. So basically, as I think you were pointing at, saying, well, what do you need to make a good decision? Certainly, evidence and information and data will come into play, and then we go, as you were suggesting, if you wish, backwards. The thing is that and is not an inconvenient, rather the contrary, but because gives the whole size of the problem, is that if we look at if we start looking at decision space, which I think we have to do that, if you look at decision space, then you realize that there is no decision in this world that is done based on a single source of data. So even programmatic HIV decisions or vaccination or any decision or managers, etc., even clinical decisions, you need several different sources of data, because you need data from demographic data, epidemiological data, geographical data, weather data, logistics data. So is precisely the beauty and complexity of decision making, that you need also research data. So this also helps us, as I said, I don't see this as an inconvenience, but this also helps us to look at routine health information system in the context of the data universe. So the routine health information system has a role, obviously, and has a role in decision making, but has to navigate with many other sources of data and evidence that make a human being or a team to make a particular decision on a managerial level or clinical level or public health.
Thank you, Sir Javier. I think now we can have a coffee break, as the coffee is waiting for us. And I would.
Sorry, there is an online.
Oh, okay, yeah. We can take this and then we can go for coffee.
Hello? Hello, Theo Lippeveld? Do you hear me? Do you hear me?
I hear you, and I hope that the room as well.
Yeah, I'm Theo Lippeveld. Have been working quite a bit on routine health information systems, so I'm following your discussions with a lot of interest. And I cannot more agree that focus should really, I can start the video also, yeah. Then you can see me. Okay, so I think it's all around decision making when you're going to measure what exactly the investment is needed to improve decision making. And I hear some classification like what you said, Xavier, on types of decision making: clinical, managerial, public health, etc. But I would suggest also that really the routine health information system is linked to the overall health system. And I think we should also pay attention in measuring decision making at various levels of the health system. So what do you need as outcomes and outputs at national level, where they are at policies, they are making policies and planning and so forth. What about regional level? What about district level, where supervision comes into the picture? Do they, because I have been studying a lot about, for example, what decisions are made by the supervisors, and is this really used then later to improve the service delivery? And finally, what I am very much think that it is very important for routine health information is what happens at the service delivery level. You see, if you observe a lot of care providers, in how do they use this data for their own decisions, meaning a patient, Does the patient improve? Did they use the right information? That's where it all starts, in fact, because routine health information system, the data are mostly gathered by the service providers. And so they need a lot of help in many countries to have them that culture of information saying, here we have this data, here we have a patient, here we have his family and so forth, and do we use that information to improve the situation at that level. So I'm not gonna go further on this, but I would like to see that point of view also coming in the investment case, that we address all the levels of the health system and see what they should be doing and what decisions they need to make, yeah, and if they do that. Thank you.
Okay.
Yeah, I think then we can continue the good discussions afterwards, or yeah, and then we can go for coffee now. Thank you.
15 minutes for coffee?
Then we can finish early.
Yep, and then we can finish early. Potentially, we're going to go to you. I think it's Caroline and Tashi for some closure and next steps, and then some final remarks, and we'll be out of here. Yeah, okay.
Thank you, Xavier. Xavier, we're taking a 15-minute break. I don't know whether you heard that.
Yes, but am I supposed to go here after 15 minutes?
I think there might be another additional question. If you could come back in 15 minutes, I think we'll just wrap up. Okay. Thank you.
My coffee as well. Thank you.
Okay. Thanks, Xavier. Cool.
And thank you, Xavier, for waiting.
Yeah. All right.
Great.
Are we all in here? Yeah. So I think we had one intervention from the online audience, and I think there was no reaction still from Xavier. If you want to continue with that, Xavier, it would be great.
You mean from Theo Liverpool?
Yeah, exactly.
Yes. Actually, I was going to be very brief, not only because it was before the coffee, but I totally agree with what Theo mentioned, and we certainly plan to look at different levels of the health system. Yes, so just full agree with what he suggested.
Right. Then I think we can wrap up the session if there's no any further input or questions. Yeah, there's one in the back. Please go ahead.
The coffee break. It just hit me. So one of the things that I know that's kind of evolving, and you're developing the framework, and I don't know if this will make it more complicated, but if it's already complicated. So one of the things, and I don't know how it all links to the return on investment and all that, but over the years, one of the main challenges in routine health information systems is not that I don't have the exact numbers, not that investments have gone down, but investments have been more fragmented into multiple systems, doing small things, and not a comprehensive, cohesive approach to developing the overall routine health information systems. So I don't know if that could be somewhere put into the matrix or the framework, that integrated health information, routine health information systems versus fragmented information systems, and how does that help or does not help. So again, just a thought while you're designing the framework. Thank you.
All right. Thank you very much for this input. Yeah, as we could see from the discussion, the interest is very high in this investment case, and also there are some questions regarding the scope. But I think, as you mentioned also, yeah, that you're still in the process of redefining how you're going to proceed. And I think this the input that you received now and the questions that you received now will help you to really establish a good plan and to proceed with it. And as mentioned also, there's also the external panel that will also guide you with this or assist you in this work that is really, yeah, I think very complex and has a lot of potential to really advance the advocacy materials also of the HDC and help partner countries to invest in a robust routine health information system. So anyone wants to add anything else? If not, thank you very much for your attention, and we can proceed with the last session then. Thank you.
If you allow me 10 seconds only.
Oh yeah, sure.
No, just because I wanted to react to the last intervention, which I think is crucial, and this is really in our agenda, because, and just let me just give you this brief comment, but in a recent study that we ourselves have been carrying out in 3 countries, we have been looking at the health information system, not even a routine health information system, not even kind of everywhere, but in primary healthcare, but not limiting ourselves to a specific program, but the whole primary healthcare, all healthcare areas, antenatal, immunization, postnatal, everything. And then, of course, we realized that when you look at in this case, the primary healthcare subsystem, not in a fragmented way, but in an integrated way, the challenges that you face are completely new and enormous. I mean, it is relatively easy to set up an electronic immunization record, but try to set up an electronic immunization record, an electronic HIV record, an electronic TB record, an electronic antenatal care record, an sick child record, a nutrition electronic record. So we have already 6 records, and we don't have even the chronic diseases. So when we have tried and achieved to do that in 3 countries, what we have learned is that we have been faced by problems that they were not even close to our radar. So the issue of fragmentation, certainly we have learned by tears and sweat, literally, and it will really be central in our work. And many thanks for this last intervention, which you were hesitant, but actually you had a great point. Thank you.
Thank you very much. I mean, yeah, for highlighting also this issue of fragmentation. All right, then I would hand over back to you, Craig, or... Oh, Rachel, sorry.
No apologies needed. Okay, last session, formal session, I think is Caroline, please, on, let's see, the action points and responsibilities. Caroline and Tashi.
Thanks, Rachel. Thanks, Sam. Thanks, Ernesto. Big thanks to everybody for joining, for, pushing. I know we're all pretty brain dead at this point, but just some highlights from today. Of course, these are highlights. This is non-exhaustive. Of course, we'll produce a report and hopefully we'll circulate it as soon as possible, and some action points that we noted from today's discussions. But feel free to just raise your hand or intervene at any point for correction or just a different perception that you had. We are a very diverse group, so we have our different opinions, and our hopes are really to kind of capture, the fine thread between what we discussed today, hoping to navigate in our work. So highlights from today, the very first part in the morning, if you recall that still, we discussed about how missions should be conducted by bringing this variety that we have here in the HDC reflected in the way that we plan, that we scope, that we conduct these missions, not just jointly with other existing organizations on the ground, as we highlighted quite often also yesterday, but also jointly by the different technical assistance areas that we have here represented by the working groups. We also heard about to reinforce the necessity that after the country missions, we have a solid investment case, and which may not be or look like new money, which may look like course correction for existing efforts from agencies, partners in country, which can also look like reinforcing some area that just need to boost. We have been warned for caution against assistance approach to supporting countries. So we heard and a Brazilian speaking, we heard very relevant points about meeting countries where they are in the present with timely and relevant propositions, but also hoping to meet these countries in the future with our value propositions beyond where they are right now. Challenges, we need to find ways of supporting the HDC dynamics, like this kind of energy that we found in this room for 2 days, and fostering this collaboration at country levels. So taking the dynamics that we have and what it looks like at global level, streaming it down the line. Communicating both the evaluation and the investment case more effectively, and our comms and advocacy strategy can really support us in doing that. But we'll have more action points. And of course, we have detailed and specific action points for the Secretariat, but our highlights for action points are, so once again, the issue of mapping turned out to be a key exercise, not only for alignment, as we saw yesterday, but crucially for leveraging our knowledge assets within our constituencies, within our working groups, scaling up country impact. And this is an opportunity to remind working groups to share with us. I think Craig circulated an email yesterday. What resources would you be needing to deliver on your working groups? So please do keep that in mind. In our thematic and technical priorities, we seem to be missing the capacity building for data analytics and use. So we'll think about adding that to our technical list, to our technical items of focus. Still in the spirit of mapping out, to map out and address now from a donor perspective, donor alignment with country systems, because it's not where it should be. And we've heard that in quite a few lines. We should find alignment of donors already at the global level. So when we arrive at the country level, we're not repeating ourselves, and we're definitely not pushing for competing donor requirements. The HDC Secretariat, and we heard Pam to pick up on the working group deliverables monitoring work that was being done, that it helps you and that it supports you and that it facilitates your work. In the session for comms and advocacy strategy, our HDC elevator speech. So we'll be working to produce the toolkit with one-pagers, success cases, info sheets, country stories, also to be featured in the website and our new website. Co-chairs, and this is an action point for you guys. Co-chairs and representatives of working groups and constituencies, please send your feedback on website to the Secretariat, and any volunteers to work with us to refine the comms and advocacy strategy. We heard Chris' suggestion to maybe book some side meetings for whoever is willing to give their feedback verbally instead of writing on email. Knowledge Hub, feedback on the website for a few documents. We'll try to work on the manual update of their working titles and also the matter of language that showed up. And last but not least, the co-creation of questionnaire for the HDC evaluation, which will be really crucial to ensure that country input and taking country lenses is the way to do it, and sharing progress of the evaluation through the website in the spirit of transparency, which has guided HDC work so far. So if you have any other, of course, this is non-exhaustive the report, and we'll of course be following up with you on the action points. We won't drop the ball. But if there's anything you would like to highlight now or course correct or thanks.
Okay, thank you, Carolina. Any questions, comments from the floor? Letitia, please.
So it's just a clarification, Carolina. Thanks to you and Wenya and the team for putting all of this together. Map out and address donor alignment with country systems. Can we just clarify that? Because we want to elevate to the health ecosystem and not just have a systems. First, understand the need proper before we get stuck onto a system. Maybe just a clarification there on the third bullet point. Thanks.
It's ambiguity about country systems.
We had a quick. So by the way, there'll be a report issued, and we hope to get that out within 2 to 3 weeks. Okay, so you get a report with firm actions. But we had I don't know whether each of us heard different things, and I think it was you who mentioned it, and we were surprised. Did you mention not a systems approach, or was it assistance approach, i.e. positive and negative? So I think all of us kind of didn't hear properly. Was it you were advocating against the systems approach or against assistance approach? Thanks.
Against a systems approach, because that's jumping to a solution before you understand the problem, so that we have more a health ecosystem understanding of how the health system work, the policies, procedures, processes, and then identify the need and then assess. And this would also address some of the other challenges of duplicating systems.
Well, there's a virtual explosion here. All right, so we keep it short? Please try to keep them short.
Very short. Just I would just say that I think it's very important that we do take a systems approach. That's just my particular perspective. I will leave it for you to follow up, Vika.
Oh, I was just clarifying because we couldn't quite tell with the word again. Is it systems or assistance?
Systems.
We are doing systems.
No.
I think we need to do systems.
Right.
I'm not
I'm
saying,
concerned this
please,
may open up
clarification. The need doesn't lie in I need a system. The need is my process is not working. And then understand that need proper within the context of the health ecosystem, not electronic system, the health system. And then only find an electronic health solution wherever that may be, and it could be in various ways: an expansion of an existing electronic system or integrating existing systems, which might address some of the 35 systems we have in Malawi and various other examples we have. And this is also the area of understanding the overall. Once you understand the business, you can develop an architecture, how the data flows, and then you map and see where you can support. Thanks.
I think we
it
have
may
a
be
misunderstanding.
a semantic.
I think it is.
Comprehension, communication issue here.
Definitely. We've decided that. Yeah. So I'm going to let you guys follow up. But, in data governance, all you talk about is a systems approach. There is a massive global literature on this. It's very meaningful. Electronic systems or digitalized systems are a completely different ecosystem.
So maybe, Craig, we'll make sure there's wine and cheese out here for a further conversation. But I think it's semantic now that you've elaborated a bit more, Letitia. Are we okay? Okay, excellent. Thank you. And other reactions or comments to the excellent summary? Wow, thank you so much to all of you. Any other reactions to that? Yes, Remy, please.
Yeah, I think we didn't discuss that, but Xavier perhaps said that they're gonna do a scoping review before coming up with clear questions, etc. And perhaps at this stage, so would it be a possibility to share it with us so that we understand what exactly will be the input and output for the study, the HIS investment case. Yeah.
Yeah, so for the investment case specifically, there'll be touch points with the Secretariat almost on a monthly basis to help manage the contract and etc. But in terms of the SRG, they will present at least 3 times. If you want more frequently, they can. But we were suggesting 3 times, and basically it'd be the November SRG and either the January, February SRG, and then towards the kind of the April, so November, January, April SRG, you'll get a lot more chance to input, and I think they would value your input into that specifically. But we'll be very careful. I've warned Xavier, be very careful with the questions, quite specific questions that he needs feedback on developing the methodology, because I think we all understand there's a lot of passion and different viewpoints on what this might look like. So indeed, he will come up with very specific questions, and you'll have an opportunity to give written input as well as verbal input. Thanks.
Okay, I don't see any more questions or responses, so thank you again, I think, from all of us. And I think we're now at closing remarks, and so I'm going to turn to my colleague, Onolena, please.
Thank you very much. Good afternoon once again. We have had a very productive 2 days of working very hard. And for me, what stood out was the remarks by Greg when we started. He actually reminded us of the role or the mission of HDC, specifically indicating what it is not, that it is not a funding mechanism, but it is a platform for collaborative work, which was very important. And also taking us through the constituencies, like the structure of HDC was also very important. And I think it assisted us as we moved through the meeting. We had a lot of discussions on all the sessions that we had, which I think we leave this place with quite a number of assignments. We are supposed to feed back to the Secretariat on a number of issues, and I don't want to restate them. We know that at every stage we were encouraged to input, and I believe that the Secretariat will be waiting for our input, and then they will finalize whatever they need to finalize. And the most important thing is how do we move HDC forward? What is it that is going to be done in the future? We were looking at the issue of engagement and alignment. How do we engage the countries which are center of our HDC work? And how do we align our stakeholders or our partners and everybody around the same priorities as country priorities? And then also internally, I think we also need to be coherent in the way we approach issues as constituencies, because it became very, very clear that, and I'm happy that right now we are talking about a systems approach. We are different constituencies, but if we don't adopt a systems approach, we are going to be fragmented right here. So it is important that we integrate our activities and approach the tasks that we have as a single entity, which is very, very important. One thing again that came up very strongly is prioritizing the needs of the countries. A lot of discussion went on around the CRVS and GIS. And the final thing was like, okay, this is okay, but at the same time, let us look at what is it that the countries need. Some of the countries may not be at that level, and therefore we have to rethink and readjust our priorities. So scaling up, showing impact of HDC within countries is very, very important. I think today we are missing the lady who was from the marketing environment, because she was really trying to help us, position this entity from a business kind of perspective. How do we market it? How do we take it to the people? How do we sell it? Was really, really her issue. How do we package it? Because in order for us to sell it, we need to package it in a way that it can be interesting. And people kept on using the word sexy. So, so how do we make it attractive to countries? So those were really very important. And I want to just take this opportunity to thank all of us for being here, and also thank the Secretariat for doing a very wonderful job of bringing us here face to face and say, in Setswana, we normally say lekamoso. Lekamoso means even tomorrow. So that even tomorrow you do the same thing, you bring us. Because I think something that was missing from the objectives of this workshop was the networking and the potential that it has to actually drive HDC forward. We have really established links, and we are going to really work hard based on these linkages that we created. So I thank you so much, and thank you, Co-Chair.
Thank you so much, Annalena. And with that eloquence, I'm just going to say thank you, Craig. Thank you, Muenya. Thank you, Carolina. Thank you so much to the Secretariat. And when we heard how few you are and recognize how much you're doing to pull us together, I just think we need another round of thanks to you. And then just to wish everyone safe journeys home. Thank you so much.
Can we take a group photo before everyone leaves? So if you could just meet me at the green wall, right outside in the hall, we'll take a group picture. Thank you.
So before you leave, just a quick one. I just wanted to, on behalf of the Secretariat, most of all, thank our colleagues from Nepal, Cameroon, Botswana and Malawi for coming, because I think we're all also very much aware we're taking you away from your day-to-day duties and work, and for you to spend 2 days with us and give us your inputs is really valuable. I'd like to thank also our two co-chairs for the day, Ornella and Rachel, and I think behind the scenes, you've given us thanks, but I wanted to kind of call out names. One person that actually has helped bring you together and is not here today, she's actually in the Philippines, is Nina, and she's done a huge amount of work, even coordinating us late at night, together with my colleague Innocent, who's kind of organizing a lot of the IT backwards and forwards, and a large sort of shout out to the emerging team, which is basically Muenya, who you all know, Alyssa, who's been working on the comm side, and our newcomers, Tashi and Carolina as well. So I want to thank our own team for every bit of effort they put in over the last few months. And thank you all for coming. It may not be hosted by WHO next time. We're happy to host, always welcome you, even if you're not here on HDC duties. But we're thinking maybe the next time we meet might be in a country, might be in a region, might be another institution. It's a collaborative, and it's everyone's collaborative, and use it as your asset. So thanks again, and a safe trip back home. Thank you.